and I will call this meeting to order, this regular meeting of the Washoe County School District Board of Trustees. Okay, I will just take a moment to remind everyone that due to the current state of emergency declared by the governor because of the COVID-19 virus, and more specifically Governor's Directive 021, the Board of Trustees will receive public comment via email only. Those wishing to make public comment should email their public comments to the board clerk at publiccomments@washoeschools.net. All public comments received before and during the meeting will be forwarded to the Board of Trustees for their consideration. All public comments will be included in the public record as minutes, but will not be read aloud during the meeting. In order to comply with Nevada Revised Statutes, Chapter 241, Open Meeting Law, and on the advice of legal counsel, the board is precluded from deliberating and or acting on items raised by public comment which are not already on the agenda. The Board of Trustees may impose reasonable restrictions depending on what is in those public comment. And those comments then, if they were inflammatory, offensive, irrational, would not be forwarded to the Board of Trustees. I would also like to say that the public comment is accessible on the homepage of our website, washoeschools.net. You can read the public comments we have received as of earlier this afternoon. We are getting a fairly heavy influx of public comments, and so the full public comments, the remainder that were received after earlier today, will not be posted until tomorrow. But at that time, we will post all of them. The Board of Trustees will continue to read those public comments as they come in throughout the meeting. We'll take breaks if needed to pause to read those. And then lastly, I will just also note that we are attending this meeting, obviously remotely. That is at this time, again, in compliance with the governor's directives, knowing that we are unable at this point to accommodate a large public comment of over 50 people, which is the restriction on gathering size. At this time, we are looking to be in person for our meetings. As soon as our staff and students return to their school buildings, we will make every effort to be in person. We're currently exploring options for venues for that, and we'll announce when we have made that decision in order to let the public know. All right, having gone through that, I will now turn it over to our clerk, Trustee Andrew Cottle, to call the roll.
Thank you, Madam President. President Raymond.
Present.
Vice President Taylor.
I'm here.
And I am present. Trustee Calvert.
Here.
Trustee Simon Holland.
Here.
Trustee Kelly.
Here.
Trustee Minetto.
Here.
Madam President, we have a quorum.
All right, thank you very much. I will now ask everyone to please rise for the Pledge of Allegiance. And I will get us started as soon as the flag is up. All right, I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, next up on our agenda is 1.04, which is action to adopt the agenda. I will make note at this time that staff is requesting that the following items from our consent agenda be removed for consideration at a future meeting. And those are agenda item 2.02, the renewal of the contract with School Safety Advocacy Council, 2.06, the agreement with ProCare Therapy for audiologist services, 2.11, the MOU with TMCC related to welding at AACT. Is that, I caught everything? Kristen, thank you. Okay, I saw Trustee Simon Holland.
Thank you, Madam President. I would move that the Board of Trustees adopt the agenda with the exclusion of the consent agenda items 2.02, 2.06, and 2.11.
Second.
Okay, motion by Trustee Simon Holland, a second by Vice President Taylor. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? Okay, that motion passes unanimously. And that then leads us to agenda item 3.01, which is our first public comment of the afternoon. Trustee Simon Holland.
We just took action to approve the agenda.
Oh, you're right. I'm sorry.
We need to approve the
Adopt
consent.
Yep, thank you for pointing that out. Appreciate that. So that is agenda item 2.01, which is approval of consent agenda items. And again, we did remove 3 of those consent agenda items. I'd be looking for a motion at this time, or if anyone has any questions. Actually, let me just double check first with our clerk. JJ, did we have any public comment on the consent agenda?
We do not.
Thank you. Okay, so I will look for a motion.
I'll move that the Board of Trustees approves consent agenda items 2.03 through 2.05, 2.07 through 2.10, and 2.12 through 2.21.
Okay.
Second.
I have a motion by Trustee Simon Holland, a second by Trustee Cottle. Any discussion on these items? I know our consent agenda, if there were questions by trustees, we always post those in our board docs. We review these at length prior to the meeting, and they're items that we can move through fairly quickly because we ask those questions in advance. Okay, I'll call for the vote. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? All right, now we'll move on to 3.01, which is public comment. At this time, we would be hearing any public comment that is not related to an agenda item. I will ask our clerk, JJ Batchelder, to read the names of the individuals that submitted general public comment. And I'll just remind everyone that you can still submit public comment to the email address publiccomments@washoeschools.net. Thank you, JJ.
We received public comments from Mary Boutal, Krista Rossi, Vicky Boley, Charla Baker, Carly Humason, Linda Gambudo, Andy Guzman, Empower Nevada Teachers, and Zephyr Hanna. That's all.
All right, thank you very much, JJ. And again, those are just general public comments not related to a specific agenda item today. Okay, on to our regular agenda. Our first item is 4.01, which is presentation, discussion, and possible action to approve the application for the Coronavirus Aid, Relief, and Economic Security, or CARES Act, Elementary and Secondary Schools Emergency Relief Fund for $9,908,499. And our presenters on this item are Mr. Ben Hayes, our Chief Accountability Officer, and Ms. Lauren Olin, the Director of Grants.
Thank you, President Raymond, Superintendent McNeil, and trustees. For the record, Ben Hayes, Chief Accountability Officer. This is, I know you all know about the CARES Act, and this is one of the grants, the kind of allocated grants that came with the funding. And it's such a large grant that we wanted to get in front of the trustees to kind of say, let you know what we're doing with it and what we can do with it in the future. This is one of hopefully several large grants that we'll be bringing in the next probably month or two. And all of these grants are kind of intended to help us get through this in the best way we can for our schools so that learning continues uninterrupted. A thing to remember, and then I'll hand it over to our Director of Grants, Lauren Olin, about these grants. This one in particular is it's flexible and it's built to be flexible. So we can use the money as we can in order to set up the best conditions for learning for our students. So we submitted the application last week for certain things, and then after the legislative special session, and there's going to be some changes that we'll submit next, in a week or two. And as conditions evolve for our school district, we're able to kind of be flexible with this grant. So with that, I'll turn it over to our amazing Director of Grants, Lauren Olin.
Thanks, Ben. Good afternoon, President Raymond and board members. For the record, this is Lauren Olin, Director of Grants for Washoe County School District. Ben agreed to be Vanna for me today, so we'll go to the first slide here. So under the CARES Act is the Elementary and School Emergency Relief Fund. And so under this grant, there's an allocated portion to the funding. Nevada was awarded $117 million. And of that, 90% or $105 million had to be allocated to the LEAs. Based on our Title I formula and methodology used in school year 1920. So Washoe County share, as you can see, was $9,908,497.97. There's two sections to this funding. The first is we could ask for its expenses already incurred between March 13th, 2020 and June 25th, 2020. There's also allowable uses of funding that we can use moving forward starting June 26th. And it has to be in one of the 12 focus areas, and I'll get into that a little bit more in the presentation. All funds for this grant must be expended by September 30th, 2022. And due to the complexity of the funding for K-12 education during the pandemic, like Ben said, Nevada Department of Ed has granted us the flexibility to do numerous budget amendments as we move forward and as things change for our schools. Okay, next slide. So in the already incurred expenses, we are asking for $248,148 for printing. And that was, if you recall, for our phase 1, 2, and 3 packets for our K-12 students. Next slide. Okay, so now we're going to get into the 12 focus areas. And please note, we did not apply under all 12 focus areas. It was nice that the U.S. Department of Ed and Nevada Department of Ed gave us the flexibility to move within categories that best fit each school district across the country. So under the first focus area, we did apply for focus area 1, and that's providing schools and principal leaders necessary resources to address local needs. And this is really a very broad category that we can put a lot of different items into. So in our original application, we have applied for long-term subs for elementary schools to assist with social distancing. We put in for a 21st century learning specialist to help our teachers learn how to do distance learning. And then we do have the flexibility of adding a little bit of admin staff to this to help us manage this grant. This grant is quite cumbersome because we have to include private schools in our allocation as well as charter schools. So there's a lot of moving pieces in this grant. The next area is focus area 3, and this is addressing the unique needs of disadvantaged and at-risk students. And so for this one, we put in for hourly pay for teachers to do intervention for children that are falling behind on core subjects. And also we put in for family resource center specialists that can help with the growing needs of families that we're seeing out in the field due to the pandemic and people being laid off from work. We're seeing a lot more at-risk children, and we need the staff to help serve them. Thank you. The next area is purchasing education technology for distance learning. We have put in some money to have mainly elementary schools and some middle schools use web-based programming for students who need to catch up and reinforce what they need to be learning in school. Area 5, under this part of the grant, we, like I said in a slide, 2 slides ago, we are seeing a large number of homeless population increase due to the high unemployment rate in Nevada. So we have asked for 2 more children in transition liaisons to help with the need that we are seeing with a number of homeless children in our school district. Area number 7 is social emotional learning. In this area, we're asking for a social and emotional specialist that can help expand teacher capacity on how to help children who are dealing with this pandemic, and also a school counselor to help provide counseling services. Number 8 is provide extended learning opportunities, similar to a couple of slides before. This is for teachers during non-contract hours to help students that need more help in any of their core subjects. So one-on-one tutoring with students. Focus area 9, this is another very, very broad category that we have put funding into. And this is basically the federal government says, this is to be used to conduct activities necessary to maintain the operation and continuing of services, employing existing staff, and coordinating activities. So in this category, we have put in a number of teachers to help provide instruction with attention to students who are most at risk of academic failure. Under the CARES Act, like I said, we have to serve both charter and private schools. So all of our charter schools together have a combined total of $282,633 that they could use in this grant in any one of the 12 categories that you can apply for under the grant. As you can see, these are all our sponsored charter schools that are participating. And the next slide is our private schools. And this is unique. Under the CARES Act, we are having to do private consultation with our private schools. So we did send out notice to all our private schools in Washoe County that are nonprofits. And I think there's 29 of them, 10 have decided to participate. And through that participation and the number of students that they have, the total funding is $287,995. And the next slide shows the 10 schools that are participating. So Bishop Minot, Excel Christian, Little Flower Catholic School, Nevada Sage Waldorf, Newton Learning Center, Pebbles Preschool, Our Lady of Snow, Sage Ridge, St. Albert's, and St. Nicholas Orthodox are the schools that are participating in this particular grant. And with that, I am open to any questions you may have about this grant application.
All right, thank you so much, Lauren and Ben. Trustee Simon Holland.
Thank you, Madam President, and thank you, Lauren, for all of the work I know that you've done for this one and for other grant applications. You really are the empress of grants, and we appreciate it. Just a question about, do the private schools apply under their own focus areas, or did everybody get together and say, these are the focus areas we're going to pursue as a region?
No, each private school had to give us an individual application. And I just think it wasn't really doable to make them all work together. I mean, the Catholic schools probably could have worked together because they're under one thing, but the other private schools aren't really related to each other. So we let them all apply under the funding, under the focus area that they thought they needed the most.
Okay, thank you.
Vice President Taylor.
Thank you, Madam President. And thank you, Lauren. I echo the Empress questions as I bow at your feet, as stated by my colleague. Just a quick question. I know we talked about getting devices for students for the distance learning. Does that include hotspots? I know it does. I know we've done some things. Will you talk a little bit about that, just primarily for the community? Because we've received plenty of questions about accessibility.
Well, right now in this grant, we do not have funding in there for devices or hotspots. However, we are working on other funding sources. We did receive some money from the 21st Century Community Learning Center grant, and we did apply for and were approved to buy 2,290 devices. As well, we have a need of about 4,000 devices immediately, as the way I understand it. And then the general fund bought the remaining portion of that. We do have a grant that's pending with a private foundation where we are asking for hotspots. And that's all I can tell you about right now, because we haven't heard back from that. But there are other opportunities that we believe are happening in the CARES Fund through the GEAR grant, which is the Governor's Education Emergency Relief Fund. And we do believe that there is some technology that will be in there. So because this is such a big funding puzzle, we are trying to make sure that we're putting funding in the categories where we can really, that we're most likely to receive that funding, and so that we're maximizing all our grant sources that we have.
Okay, thank you, Lauren. I knew there was some activity and that we had some success, and I just wanted to make sure that was on the record because we're asked about that quite a bit. So thank you so much, and thanks for all your work. And every dollar you get, as you know, makes a difference, and you get a lot of them. So we're lucky to have you.
You're welcome.
Thank you. Trustee Cottle.
Thank you, Madam President. Thank you, Lauren, for the presentation. Just a point of clarification on the dollar amount. So is our cut 9.9 million, or is it 9.9 million subtracting out then the charter and private school funds that give us probably about 9.4, 9.5 million? If you could clarify that, that'd be great.
Yes, out of the 9.9 million, we had to subtract out the charter school and the private school portion.
Okay, so our cut would be around 9.4, 9.5 million-ish.
Correct.
Perfect, thank you.
And I have a question about that just to clarify. So for the private and charter schools, I guess it wouldn't matter that they received a PPP loan. They still can have this funding, and they still also received the PPP loan.
Yes.
No conflict there with.
Okay. No, there's no conflict with that at all. They could. I mean, the thing with the with this allocated application, because we have so much flexibility to do a revision. I've already had a couple charter and private schools ask if they can do a revision because they have other money that's now coming in. So that's why I'm saying this grant is sort of like we have one thing right now that based on what is happening in the future, what funding sources are in the future, we have the ability to put in a budget amendment so that we maximize all types of funding sources in our school district so we get everything covered that we need covered during the pandemic.
Okay, thank you. That's a huge amount of work, I know, for you and the staff, just to not only be the recipient of the funding and all the reporting and tracking that goes along with that, but also to be the grantor and the pass-through and having to deal with that whole other side of it. So thank you for the incredible work. And I know there's a lot more ahead for you. So I appreciate it.
My pleasure. I'm happy to help.
All right, I will ask our clerk, JJ Batchelder, if we have any public comment on this item.
We received public comment from Amanda Jones. That is all.
Thank you. Okay. Yes, Lauren.
We are asking for a motion for approval for this grant application as well.
Great. I was just gonna see if there wasn't any more questions or concerns, if someone would like to make that motion. Okay, Vice President Taylor.
Thank you, Madam President. I move that the Board of Trustees approves the application for the Coronavirus Aid, Relief, and Economic Security, or CARES Act, Elementary and Secondary Schools Emergency Relief Fund for $9,908,499.
Second.
On mute. Motion by Vice President Taylor and a second by Trustee Cottle. All those in favor, please signify by saying aye.
Aye.
Aye. Any opposed? All right, that motion passes unanimously. Thank you both for the information and the hard work.
Thank you.
Okay, our next agenda item is 4.2. This is a presentation and update from the Washoe County Health District on the current outbreak status of the COVID-19 pandemic in the community. This is again for just information and discussion, and our presenters for this item are Mr. Kevin Dick, the Washoe County Health Officer, and Heather Kerwin, Epidemiology Program Manager. I see they're both joined us here on Zoom. So I will turn it over to you to begin.
All right. Thank you, President Raymond. Kevin Dick, District Health Officer. And good afternoon to the trustees. Thanks for having us this afternoon. And I hope you have many more funding opportunities come your way like the one that we just saw. I know you very much need that. I thought I'd start with giving you a brief update on what our current status is with COVID-19 in Washoe County. We, as of yesterday, had reported 35 additional cases to bring our total case count to 4,823, and our total deaths to 107. We have been on an upward trend with new cases occurring daily, and we had a record day on Saturday where we had 159 new cases. We do track a 7-day moving average of new cases, and on Sunday that hit a new high of 97 cases. So we do have a very active COVID-19 transmission, elevated levels of transmission occurring in the community. We have, as of yesterday, close to 1,300. We had 1,287 active cases of COVID-19 in the community. Fortunately, we've had almost 3,500 people recover from COVID-19, so 3,429. Also, fortunately, to date, our hospital capacity has remained good as far as the available beds for acute care and ICU beds, as well as ventilators in Washoe County. So we haven't experienced the level of demand that has occurred on the hospitals recently down in Clark County. So Heather and I have been engaged in the health district's COVID-19 response since the very beginning. Heather in January and February, working with the quarantining of individuals that were coming back from countries that had COVID-19, trying to research and find out what we could about this novel disease that was coming out of China at that point. And then COVID-19 really came home to Washoe County with our first positive case on March 5th of 2020. And we actually have been engaged with the school district on COVID-19 since that date. I was on the phone with Superintendent McNeil discussing that case because of a relative that attended Huffaker High School. We were side by side doing a press briefing the next day. We immediately mobilized a drive-through testing operation that started on the following day for testing of some of the students that were in that elementary school classroom. And thankfully, no COVID-19 found with that. The health district has been expending additional resources on the COVID-19 response since that date, as we've continued to work to expand our testing, to expand the call center work and the platform that goes around scheduling people for testing, as we've worked with the state lab and other labs to report out results to people that are tested and to contact cases that are positive to conduct the contact tracing work. As this was all going on, as everyone knows, we had regional declaration of emergencies and a state declaration of emergency, and the health district has been operating as part of a unified command for our regional response. The National Guard has also joined us and has been instrumental in helping to bolster our staffing as we're responding to this emergency. But what we've seen is that after initial actions taken with the school closures, with stay-at-home orders, with closure of all but essential businesses, is that as we have reopened and have allowed other businesses to resume their activities, invited visitors from other states, resumed gaming operations, we've had more and more interactions occurring that have led to the spread of COVID-19. So that is what's resulted, I think, in the increase in cases that we've seen since early May with as the reopening has progressed. So as far as our current operations go, we are seeing record numbers of people that are coming through our post, our drive-through testing site that we operate at the Reno Sparks Livestock Events Center. We had a record day of 709 people through for testing on Friday. The state lab is somewhat overwhelmed with the number of tests that are coming in, and we're seeing significant delays in getting the test results back from the state lab. So as of today, we still haven't received results from the tests that were collected on Friday. And commercial labs were seeing a week or longer in many cases for getting the results back. While we have utilized the Guard and we've added additional staffing with grant funding we got from the federal government for our case investigation and call center or contact tracing activities, we are not able to keep up with the number of new cases that have been occurring. So while we hear about testing and contact tracing being the solution, with the delays that we have with the state lab and with the available staff that we have, we are falling behind and losing that opportunity to get people isolated and quarantined. We're continuing to work to add additional people and to try to get additional funding to support the level of staffing that we need. Here at the county complex, we're building out additional space. We did have the health district contained within building B here, and we're now currently occupying as well most of building C and a good portion of building D at the county administrative complex, and also occupying a sizable portion of the Reno Sparks Livestock Events Center. We do have a Salesforce platform that's being developed by Deloitte through a contract with the state that's supposed to help to provide efficiency in our case investigation and contact tracing activities. But that has been several months in development and still has not been able to go live. And that is needed for us to be able to access the additional contact tracing staff that Deloitte has based out of Texas that can assist us with some of that work once we have that platform available. But the health district staff, we've redeployed many of them to support this mission. And with them and the new staff that we're bringing on, many are working long hours, most of them long hours and overtime, and it's just not sustainable. So we really need to bring on those additional staff. But I think one can see that when the state, Julia Peak, in her briefings that she provides, indicates that of the new cases that we're identifying, about 15% of those are coming from contact tracing efforts, that the testing and contact tracing is not keeping up to control the spread of COVID-19 right now. So we have lots of community spread that's occurring from the number of cases that are out there. We also conducted a seroprevalence study, which was to use the antibody test to identify what proportion of the population may have been infected with COVID-19. And this was conducted back in June, on June 9th and 10th. And the results from that tell us that at that date, we had about 2.3% of the population that had been exposed to COVID-19. Looking at that number versus the number of people that we had tested positive, we can conclude that as of that point, we have about 5 times as many people as have been identified positive from testing that have been infected with COVID-19 in the community since the start of the transmission occurring. So I talked about our efforts with the Washoe County School District, and I think we've had a long and productive relationship in working together on communicable diseases and outbreaks. And we've continued that relationship as we've worked with COVID-19. And this is something that none of us have experienced in our lifetime. It's dramatically affecting life here in Washoe County and across the world. And we've been working together to try to figure out how to do this. And I think that the school district and their excellent staff have done some really great work with the plans that they've prepared for you of the different scenarios that it would look like for depending on which route is taken with the reopening. They've been very thoughtful in those approaches, thought through a lot of different ideas and issues, engaged our staff as well. And so I want to commend them for their efforts and their cooperative activities with us. We've also worked together on development of an outbreak response plan, which will be utilized as we have cases of COVID-19 or other diseases occurring in the schools. So that we've had significant effort that's also been conducted, and that documents in its final stages of development. So I'd like to move to the recommendation that I made public last Thursday at the District Board of Health meeting. And I made that announcement there to be able to provide some advance notice of what my recommendation was. It's obviously an issue that is quite important for our community. And there are many people that disagree with my recommendation, and I believe there are many people that agree with it. But it is not to open schools at this time. And my recommendation, and I've made this clear when I've announced this, is coming from a public health perspective. And the responsibilities that I have and that are mandated for public health on preventing and controlling communicable disease transmission. And I recognize that this is a decision that the school board needs to make. And there are many factors that are involved in that decision, in addition to public health, education, social issues, safety, nutrition. I think it just it reveals the incredible demands that we place upon our education system and the services that are provided through the schools. So through the public health lens, I wanted to walk you through the basis for my decision to not recommend the schools be reopened. And I provided a document that is the basis of my recommendation. So I'd like to walk through that for you. But one of the common elements that we see in the guidance on school reopenings is to look at the rate of disease transmission that's occurring and the trends of what's going on with elevated transmission, if that's the case. So the CDC, Centers for Disease Control and Prevention guidance states, it's important to consider community transmission risk as schools reopen. Evidence from schools internationally suggests that school reopenings are safe in communities with low SARS-CoV-2 transmission rates. So that's the virus for COVID-19. Computer simulations from Europe have suggested that school reopenings may further increase transmission risk in communities where transmission is already high. The CDC guidance also states communities can support schools staying open by implementing strategies that decrease a community's level of transmission. However, if community transmission levels cannot be decreased, school closure is an important consideration. I also reference the state of Nevada's county tracking system, and also what the state of California is doing with their county monitoring. And the state of Nevada has joined the compact of the Western states in working together on how they address reopening under COVID-19 and are taking some common steps together. And the governor's criteria for the county tracking in Nevada contains some of the similar tracking items that California does, but not all of them. California has a much more robust public health department than we do in Nevada, in public health system. We are one of the bottom states in the country in our investment in public health. And California has a much more significant investment and many more scientists and epidemiologists that work there. They have decided to use that county monitoring as how they will determine whether schools reopen in California counties. And so a common element in those two documents are the availability of 150 more tests per day per 100,000 population, and we're meeting that. We're over 200 tests per day. The other is a daily new case rate of 100 or less per 100,000 population over a 14-day period. And just over the weekend, we were at 240 cases per 100,000, so well over double that threshold. So those are a couple of indicators to look at. And I'm not claiming that these numbers are precise, that the 100 level is exactly what it should be, but it's a number that has been picked that I think is reasonable. There are other criteria that have been developed, and one I think that's significant is from the Harvard Global Health Institute, and that one has a color coding system that looks at yellow, green, orange, and red, with thresholds again for what the transition level is between those risk levels. And in that Harvard model, the orange is between 10 and 25 new cases per day with a 7-day rolling average. That's per 100,000 people, between 10 and 25. And so we're in that yellow or that orange level that's at elevated risk of because of elevated levels of transmission. And for that orange level, the Harvard guidance and for yellow establishes a preference for reopening elementary schools and middle schools. In that orange level, it's for keeping the high schools closed. But with the orange level, it is also predicated really on the rate of increase of the COVID-19 cases being flat or moving down. And we're continuing to increase. We have been over the past several weeks in our COVID-19 cases. So the Harvard guidance notes a couple of things. It says, as of mid-July, all countries that have opened schools without further school-based outbreaks have achieved low case incidence levels by the time they opened schools. The guidance recommends schools only reopen if community transmission levels permit it, and if conditions for pandemic resilient teaching and learning spaces can be achieved at scale. Districts, states, and federal governments invest in healthy buildings and healthy classrooms. And in the absence of conditions for pandemic resilient teaching and learning spaces, schools continue with remote learning. So they're also kind of predicating this on availability of funds for the types of HVAC system modifications, et cetera, that help to support that pandemic resilient teaching and learning spaces. Under the Harvard guidance, there's also a quote in regards to orange risk areas reopening schools. So Dr. Ashish Jha, who's the director of the Harvard Global Health Institute, said in a statement, if you're in a red zone, there's simply no way to safely open schools now. So a red zone is 25 or more new cases. We're at just over 20 right now, and we've been moving up. It says orange zones will struggle as well. If you open schools in these areas, the chances are that those will likely close quickly when teachers, staff, and possibly students start getting sick in large numbers. If leaders in these countries want to reopen schools in the fall, they must bring down the level of virus starting now. Yellow counties are in a slightly better position, but must still make hard choices. So Washoe County exceeds the Nevada County tracking threshold for elevated transmission of disease. As I mentioned, California is using that same threshold to determine whether they reopen schools or not. We also are exceeding Nevada's threshold of 7% daily testing positivity, the number of positive tests that are coming out of the testing that's occurring in Washoe County. So it's for these reasons that I'm making this recommendation. I would feel more comfortable with school reopening if there was a decreasing rate of new cases occurring in Washoe County, indicating that we were helping to get this transmission under control. What I would recommend is that school reopening be considered when new cases occurring in Washoe County are reduced to 100 or less per 100,000 population over a 14-day period. And daily new cases are on a decreasing trend. I think that's the direction that we need in order for the transmission not to cause additional problems, which I think could lead to the school closure being closed once they reopen. While it's your decision to decide whether to reopen or not, it's my responsibility under the law to then work with the school district and assess the conditions in the schools and the conditions in the community. And if outbreaks are occurring, to make decisions about whether I need to close school classrooms or close schools or close down the district. So, so that is the role that I will need to play if necessary, if you do decide to reopen. As I've acknowledged, many other factors besides public health that you need to consider in that decision, and I don't envy any of you with that responsibility that you have. I'd like to also spend a moment to talk about some additional data and questions that I received from Trustee Holland that we provided, that I saw was also an attachment in your packet. And that had to do with cases occurring in children under 18 and under 10 in Washoe County. So our epidemiology team and statistician were able to pull some of these numbers for you. And you can see that we have broken out by the under 18-year-olds, the incident rate. So for children under 18, they have 2.3 per thousand of those children have contracted COVID-19 and tested positive for it from our initial date of March 5th through July 27th. For the under 10, we have 3 children per 1,000 children that have contracted COVID-19. As a comparison, for over 65 individuals, 8.5 individuals over 65 contract COVID-19 per 1,000 individuals over 65. And for the entire community, that figure is 10 out of 1,000. And then we also break down by age group and the number of cases by age group and by race and ethnicity for you. And as we have seen across our population of all ages, that we have a significantly greater number of our Hispanic population that is contracting COVID-19 than is their proportional makeup of our population. We do have children under 18 and under 10 who have been hospitalized. We have 5 hospitalizations reported for children under age, between ages 13 and 17. We have 1 hospitalization for a 4-year-old and 4 infants that have been hospitalized with COVID-19. Thankfully, we have not had any deaths of children under 18 in Washoe County. There are a number, 212 confirmed cases under 18 years of age that are associated with a cluster outbreak, and 170 confirmed household contacts have been reported from these outbreaks. And I don't know, Heather, if you wanted to add anything to that.
In terms of the transmission among families between kids and parents and other adults, it's difficult sometimes on this massive scale to delineate who brought the infection into the house, but we do see an enormous amount of transmission occurring in households. And of course, the larger the households, usually either intergenerational living or larger number of children in the households, it is definitely passing through nearly every member in those households. So, you know, whether people are leaving and going to work or leaving and going to school or engaging in other social behaviors with persons outside their households, those are all increasing risk factors for bringing COVID-19 back into the house. And just to note, we did update our hospitalization data today, and we do have additional pediatric hospitalized cases, including some teenage cases as well.
And then we've also included, I think both here and in the basis document, that 7-day new case trend line for you. And so the number of new cases per 100,000 is on the same trend line as this one. I believe that number is 20.3 was the latest that I saw on that. And then we also do have cases out of daycares and pediatric offices. And then we're also showing the number of other cases that are linked to cases that are out of those outbreaks. And I don't know, Heather, if you wanted to speak further on that also.
Sure. So among the daycares and pediatrician offices that we have here, again, we're showing the total staff and the children who had either visited or had been in either the daycare or the pediatrician's office. But you can see in that final column, those numbers are much more than just the people who had, again, visited there, showing that transmission does continue on, even though it is linked back to that single source. And we know that we see the same trends happening pre-COVID in our outbreak settings in our schools, as noted by several pediatricians in our area, well-respected clinicians as well. So. I
also included a story that just was run yesterday about increases in child COVID-19 cases occurring in Florida. So they're seeing some dramatic increases. On July 16th, the state had a total of 23,170 children under ages of 17 who had tested positive. And then by July 24th, that number had jumped to 31,150. And there's a 34% increase in new cases among children in those 8 days. And then we have also an increase in children being hospitalized from 246 to 303. It's a 23% increase in hospitalization in 8 days. So that's an example of a state that does have even more elevated transmission that's occurring here. But obviously the children are being infected with COVID-19. Trustee Holland had also asked me about what I thought about Dr. Trudy Larson's comments. And I think that, first of all, I want to say I consider Dr. Larson to be a good friend. And she's just a marvelous woman. Pediatric doctor, dean of School of Community Health Sciences. And she and I disagree on the school reopenings. She also is part of the governor's medical advisory team. And she believes that we should allow elementary schools to reopen at this time. I think we need to be careful in presuming we know more than we can reliably infer or deduce from limited studies that have been done on this new disease. And I think that as a general statement, I think that it's safe for us to believe that most children will not get as severe an illness from COVID-19 as older adults will. However, some of them will get severe illnesses and they could be hospitalized and they could die from COVID-19. We also don't know a lot about COVID-19 long-term. We've only been studying it since this disease, we first became aware of it around January. And we don't know, we don't have a good understanding of what the long-term effects might be of people that have been infected with COVID-19. It's an inflammatory cardiovascular disease. And I believe that can pose the potential for long-term health consequences for people that have had it. And I think we'll need further study to really understand what the longer term impacts of COVID-19 might be. There have been studies that have indicated that there may be reduced transmission from children. However, I believe that there are limitations to those studies because those studies were done of children, populations of children that were either going through school closures and or stay at home directives. So not children that were out doing everyday school activities, et cetera, during the COVID-19 pandemic. And in those situations where those children are staying at home and they're not essential workers, et cetera, we would expect that they would be a lower potential for being an index case to introduce COVID-19 into the household. So I think we need to be careful and understand some of the limitations that exist with some of these studies that have been published, and cautious with presuming about how much we understand and know about the disease. And from a public health perspective, I think that it's important, and I think it's important for you as well, to consider not just the risk to the students, but the risk to the teachers and staff and family members and others in our community, because COVID-19 is not contained within school walls, and the interactions that occur with the students and staff at the schools will be part of a continuum of interactions that occur with the rest of the population in our community. And we know that the spread of COVID-19 results from people that are infected coming into contact with people that aren't infected and infecting them. So that's my recommendation, the basis for my recommendation, and my concerns with the studies and the science behind, yes, let's open elementary schools. But I will acknowledge that some of it does look encouraging. And I mentioned that the Harvard Global Health Institute did have a first priority for reopening schools for elementary or pre-K through 5th grade, and for special ed of pre-K through 8th grade. And I think that's based both on some of these studies as well as the other significant needs of that student population. So I appreciate the opportunity to brief you on my recommendation. As I've mentioned, ultimately the consideration of what to do that's yours to make, and your decision to make. And I acknowledge there are many other factors in that beyond public health. These are unprecedented times. We must all use our best judgment in our decision making. And we must remember we're in a long-term war with COVID-19. The disease is our enemy, not one another. We must not let up, become complacent, or let our guard down upon winning a small skirmish or battle in this long-term war. That only emboldens the virus to heighten its attack upon us. That's what has brought us to this point of surging cases. And we must persevere, and we'll all work together to be successful. So I urge everyone in our community, come together, be part of this fight. Let's keep our community safe so that we can have our schools open. Thank you very much. Be happy to take any questions.
Well, thank you very much, Mr. Dick and Ms. Kerwin. I appreciate your taking the time to be with us today and to provide us with that information, and for so thoroughly answering the questions that were presented. I know we do have more questions for you, and I'll look to my trustees for that. I do have one question myself. When we see a day like Saturday with that big bump, I've heard that that's because we're getting a bunch of private labs reporting all at once, and it isn't necessarily reflective of actual increases in cases. It's a backlog that we're seeing all in one day. Could you address that?
So you'll see if you look at that trend graph that I provided, that there's a jagged, choppy line that is really variable from day to day on the lab results that are reported to us. And that's why we have the yellow line that's on there, which is the 7-day moving average of the cases, the daily cases that are reported. And so that's used to smooth out that variation. But you can see from that yellow 7-day trend line that it is in an upward trajectory of increasing new cases daily. And so Heather can probably speak more directly to what causes the spikiness. I'm not sure it's just commercial labs. Some days we get more results coming back out of the state lab as well. Some days there's delays in reporting because the state MBS system, the data management that they use for the lab reporting has problems that occur with it, but I'll let Heather also throw in her 2 cents on that.
Sure, thank you, Kevin. So we do see spikes day to day. The last 2 days, fortunately, have been what we would deem kind of slow days, or what we used to see back pre the reopen back, April, May. To put it into context, 1/3 of Washoe County's total cases have been reported in the last 3 weeks. So we're definitely not seeing a slowdown. And while a lot of people like to point to increased testing, anyone presenting with symptoms is absolutely encouraged to test. So if we're seeing more symptomatic people, we see a surge in testing. And then, relative to the proportion of people testing positive, or what we refer to as the positivity rate, you're going to see those increased numbers as well. And so when we see those fluctuations, as Kevin described, sometimes there's backlog, sometimes there's data batching. The Saturday number was not the only high number in those 3 days. We actually had over 100 cases 3 days in a row, which has yet to happen here. So while some of those tests do date back, a week and a half to, in some cases, 2 weeks out, these are labs being reported from Renown Hospital, who is running those labs within their laboratory, our state lab, some special testing events that certain organizations put on locally. We also are seeing considerable number of positives still coming through the CVS, the Walmart testing, some of the commercial labs like Quest and LabCorp. So it's not really a result of one particular laboratory reporting versus another. But we will still continue to see those spikes, and that's something that is occurring nationwide and globally as well. But that's why we take into consideration those 14-day moving averages and 7-day moving averages to help smooth that out. But what I would really take home from that is that of our total cases, 1/3 have come in the last 21 days.
Thank you for that. I will move on to some of the other trustee questions, and then if I have a few more that if they aren't addressed, I'll come back to. So I will start with Trustee Cottle.
Thank you, Madam President, and thank you both for joining us today, and thank you both for your service during this challenging time. I do have 3 questions that I have, some from my constituents. The first one has to do with the timing of your recommendation. The school district has been in constant contact with the health department, and there was health department representation on the reopening task force. So if you could just go into a little bit for us in the community, why wait till the end of July to make the recommendation that schools not reopen?
Well, I think that what we've communicated to the reopening task force is that it was going to be a matter of watching what was happening with the cases and seeing where the trend was going. We did have a previous peak that occurred right around the July 4th holiday weekend. And then we were seeing cases decreasing for a while until about July 12th. And then from that time forward, we've seen that increasing trend line of new cases that have resulted in now the even higher record levels for that 7-day trending number. So we were seeing that trend occurring. I made my recommendation based upon that. And then we've continued to see it increase since I made my recommendation last Thursday.
Okay, thank you. My second question has to do with your statement. In your statement, you had mentioned that one of the concerns you had was the school district potentially putting 25 or more students in the classroom. And I was just curious how much you've had the opportunity to see what the current plans are. Because I know in our discussions of the school district, the idea of the elementary plan and the hybrid plans was to keep classroom capacity numbers very low, that keep students out of the building and offer an online option. So I don't think any of our classes would be more than 25 kids at any time during this period of time we're in. I'm just curious if you could comment on that.
I think I was identifying the concern that at our level, the recommendation is now to keep gatherings to 25 or less. I wasn't briefed on the actual class size numbers that were going to occur, but I knew in general of your plans for how you're going to be breaking up the middle and high school level classes.
Thank you. And then my last question, a few times this afternoon, you've mentioned that it's a recommendation and ultimately the decision rests with us. It feels like everybody in the world knows that we're making this decision today. So why stop short at a mandate and mandating the school district not reopen? Why keep it only a recommendation?
Well, I was asked to make a recommendation, so that's what I did. But additionally, as far as my legal authority for closing schools, I think that it has to be based upon what is occurring in the schools, as well as the community. And we haven't had the schools open. We haven't had an outbreak occur in the schools to date. And so that's my responsibility to be working to work with the school district as they reopen to assess what's happening. And if we do have conditions that warrant a closure of a classroom or a school or of the district overall, that would be based on what we see occurring with communicable disease outbreaks following that reopening.
Perfect. Thank you very much for your responses, and thank you, Madam President.
Trustee Minetto, and then Vice President Taylor.
Thank you for your wonderful presentation. I just had, I guess, a couple questions. So I know that the testing can take forever somehow. People are tested, 2 weeks later, they find out they're positive, but in that 2 weeks, they could maybe have gotten well. Then they have to be tested again, and possibly in 2 weeks, then they're told maybe they're well and maybe they're not. What can we do to make the testing go faster? I mean, the finding out, or is there, that's just the way it is?
Well, we're, I think, suffering from the same situation that people across the nation are experiencing, where we just don't have the testing capacity available to keep up with the demand for testing. And so we have been relying on the Nevada State Public Health Lab for our testing. We had also tried through Washoe County to work with a commercial lab that did not perform successfully for us. We're exploring other opportunities to try to find other labs that will be able to run tests and provide us with better turnarounds. but it's a significant problem that we're facing and others are. As far as needing to be tested again, as far as being released, if somebody tests positive, there is a protocol in place to be able to release somebody if they have recovered from the disease, if they had symptoms, and have a certain period without having symptoms or a fever, as well as if people are asymptomatic, if they had positive results after 10 days and additional at least 1 day without symptoms or diminishing symptoms or without symptoms in that case and fever, they could be released. I don't know, Heather, if you want to comment more on that.
Sure. So really there's two criteria that we would recommend people be tested, and that is if they are experiencing symptoms themselves. And that point, even if they are waiting for their test results, we would not expect them to be entering into public spaces, including schools. People do. However, our hope is that they wouldn't. The second is if they are identified as a contact to a positive confirmed case, they are to enter into a quarantine where they fulfill the 2-week or 14-day incubation period, which again, they're not recommended to be going out into public. And if during that incubation period they do become symptomatic, then they would seek testing. And of course, again, under the same recommendation, not be going out into public until their symptoms have subsided, or even, of course, until their test result does come back negative, indicating that their symptoms are a result of some other pathogen. Now, in terms of coming back into a workplace setting or the school setting or going back out into public, as Kevin said, the recommendation from CDC now is to not ask to be tested. Again, the diagnostic test for this is a molecular test. It's very, very sensitive, and it's picking up RNA genetic material. This is an RNA virus. And once the symptoms have subsided and it's been 10 days from the symptom onset, they're finding that the virus, even though people can still shed it, is no longer infectious. So they deem this a symptoms-based, time-based release, as opposed to releasing somebody in order to get a negative test. We've actually seen people who have completely recovered and been without symptoms for 6 to 8 weeks continuing to test positive, but that positive test is not indicative of infectiousness at that point.
That's a wow in my mind. And I noticed that there are lots of people who are testing who aren't getting this. I mean, they clearly have something, but it's not this. It seems like
Correct.
That's a huge percentage. Yeah, I'm right about that. Okay. Now, I just kind of have a weird question. So you said the hospital is in an okay place right now? The hospitals are, the rooms being filled, or what is the difference between a year ago today? Well, you may not know this, a year ago today and today's hospital usage. I'm just curious about that.
Couldn't tell you off the top of my head. I don't know, Heather, if you've got any better idea.
Yeah, so typically our area hospitals actually have been, and especially our ED departments, have been running at about 90% capacity. I think since COVID, people, especially our hospital systems, have been very acutely aware of the impacts that they may be needing to prepare for surge activities. And so they've done all they can, including back in March, and for a period of time, eliminating elective surgeries. And so they have done what they can. They have staffed up, they have closed wards down and transitioned them into COVID units when they need to. But I think they're really, a lot of people, and we're seeing this through just general outpatient data where we're wandering for other communicable diseases. People have stopped seeking medical care because they're afraid of possibly picking it up in a hospital setting. And so we see just general public kind of shying away from that, whereas before maybe they wouldn't think twice about utilizing the hospital system. Sometimes for things that really don't require that level of care. So I think between the hospital system being more adaptable and trying to maybe turn beds over quickly, and in the event that they need to find a place for someone that is being ruled out for COVID or who has been transported, who is COVID positive, they're taking more steps to be able to have those spaces available. And I think that there's just a general from the general public perspective that people are, trying not to use the hospital system as their first stop.
How many people are in the hospital right now with COVID? I mean, how many rooms are approximately?
I just
Believe
updated
it-
our numbers today.
I believe
We're
it was
at 80.
87 I saw.
They change every moment, I'm sure.
Yeah. So as of our data grab today, we have 87 persons currently hospitalized. Renown does have what is deemed as a alternate care site. Their parking garage has been converted to be able to deal with many, many more, and we hope to not have to use that. We haven't had to so far. But at this point, our Nevada Hospital Association numbers do indicate that we do have capacity today.
I would add, though, that while we have that additional 700 beds that Renown had in the construction, as well as the capacity that we're seeing, I think that the constraining factor at hospitals now is staffing, and particularly nurses, with the surges that are occurring across the country and the demand that other healthcare systems have for traveling nurses is impacting, I think, the available staffing if we were to surge.
So if we currently have 87 people in hospital beds, and so that overwhelms the staffing, is that any more or less, since we're not doing I'm just being the devil's advocate here.
I don't think we're at overwhelming staffing now. I'm just saying.
Oh, good.
Yeah, but when you look at the capacity based on beds, that doesn't indicate the staffing that's available to help people that are in the beds.
Okay, and then just one more little thing. Did you, in the midst of this, and this may not have been something you thought about, did you consider looking at the suicide rate amongst teens and how isolation possibly can really affect that? Did you look at that, or?
We have the suicide rates for teens, elderly, et cetera, all part of our community health assessment, and it's a concern in our community, and for both teens and our senior population.
Okay, thank you.
Thank you, Trustee Minetto. Vice President Taylor. Are you there?
There we go. I was trying to unmute. I think my picture's frozen though.
You are frozen, but we can hear you.
So when I'm looking at myself, I'm like, that's my head's moving and that's not moving. Anyway, first of all, thank you, both of you, Mr. Dick and Ms. Karen, for being here. As you know, this is a big issue in our community, and a lot of people, I'm sure, are watching and listening and have a lot of questions. So please, thank you for bearing with us as we ask a lot of those. I'm going to do that now. I have several questions, if I may, Madam President.
Yes, please go ahead.
Okay, great. I did have a question regarding the report, but as you know, there are a lot of rumors out there that there were a lot of false positives that went out, and so there are false positives that are in some of these numbers. Can you talk a little bit about that?
The PCR test is quite accurate for identifying the positive cases, and so false positives have not been our concern with the molecular testing. So I don't know if you have anything you want to add with that, Heather.
Yeah, molecular tests, when they're done, non-rapid point of care tests. So the ones that are being done at the majority of our care sites now and through Washoe County Health District, anything being reported through commercial and private and state labs are considered to be, again, those molecular tests. And there's a very, very low chance of false positives. There have been some tests that have been falsely reported as positive and then later corrected as negative. And we have adjusted our numbers accordingly. That has been fewer than, I believe, 15, maybe even fewer than 10. And of course, they're not included in our numbers. What is more concerning is actually false negatives, where symptomatic persons may present too soon, right after symptom onset or even before symptom onset, to be tested. And it indicates that they are negative, and it's just that the viral load is not at a detectable level yet. And so someone is sent home with, symptoms, but have received a false or what would be called a false negative. and think that they don't have COVID. And if they were to go back and test, 3 days later, they may be found to be positive because the viral load is at a detectable level. So with molecular tests for viral pathogens, we don't tend to see, less than a fraction of a percent really that would be a false positive.
Okay, thank you for that. Also, Mr. Dick, you referenced that you're working on getting to a finalized document, I guess, on what the protocols will be if a student or if a staff member tests positive in a school. We've gotten obviously a lot of concern about that. People concerned about their students or even about, themselves if they're, a teacher or staff member with that. Any idea on what the timeline is on that? Because there's a lot of angst around that, regardless of what, if we have any kind of in-person learning at all, there's a lot of angst around that one.
Yes, we're meeting on a weekly basis with the school district's team for this. And our next meeting is scheduled for Thursday morning. And I think we're really close, and I'm hoping that we'll have a final document at that point. And we've also discussed the importance of working to communicate this to the families of your students, so that there's a good understanding of what will be involved if we do have people that are developing symptoms, needing to get tested, the exclusions, et cetera.
Okay, thank you. And then that will, of course, that's also a question that I've gotten a lot from teachers who are concerned. What happens? I'm in a classroom and one of my students tests positive. So there'll again be a lot of concern about that. Again, a lot of rumors, a sick room down the hall and all this stuff. And I know none of those protocols have been established as of yet. So the sooner the better on that. So thank you for working on it. I also just want to confirm, according to the data that you went over earlier, hospitalizations and deaths for us are still about stable, I guess, if you will.
Well, we're continuing to see deaths reported quite regularly, but we're not seeing the types of numbers that have been coming out of Clark County recently. So I would say, yeah, that we're not seeing big spikes at this point in the death rate, but that's also a trailing indicator, and we would expect if after we have spikes in cases or in people being hospitalized, that's going to be lagging by a number of weeks after those cases occur.
Right. But hospitalizations are relatively stable. At least, I mean, I know we aren't at a critical point yet from what you reported. It doesn't seem like we're at a huge spike in that area either.
Well, I think our increase today was 20 up to 87. So that's a little bit of a spike, and I don't know what the reason for that is, but that's one day.
We updated our line list that we received from Renown Hospital, and so we had several discharges, but many more intakes than discharges.
Okay, so that is, when you're looking at 67, 20 is a bit of a spike. You're right.
But again, that's one day, and so I think it's important that we look at trends over time.
Right. Okay. A few more questions. Thank you for bearing with me. One of the concerns, obviously, when you look at the CDC recommendations for reopening schools and so on, it's being able to track or trace any kind of contact that there may be if someone does test positive and so on. How do you feel from a confidence level standpoint? Should we decide to return to some sort of in-person teaching? How do you feel about the ability to do that, to track or trace? I know you talked about that a little bit earlier, but specifically speaking about the schools.
Well, I think I can let Heather jump in, but I would summarize that right now we're challenged. We're challenged by the delays in getting the lab results back. We're challenged by the staffing that we have on board. We've been ramping up, brought an additional 30 contact tracing staff on just over the last couple of weeks. We've got plans to bring in close to another 20 of those staff. Hopefully we'll have the Salesforce platform online and be able to have Deloitte pick up some of the contact tracing effort over the next couple of weeks. But we're stretched really thin, and we've fallen behind with that. And with the guard plan to step down at the end of the month, we've been using the National Guard to help with our case investigation and contact tracing efforts. And so we're losing that capacity.
To add on that, I was just going to mention, to add on that, we're really in a time of transition because we are onboarding so many new staff. It takes about 6 weeks to really get investigators trained up to a point where they're comfortable making some of their decisions on their own. In addition to, as Kevin mentioned, losing our National Guard support, they've been phenomenal. Some of them have been working alongside us now for 4 months, and to have them come out of this response is going to leave a hole in a deficit. In addition to the increase in cases that we've seen over the last 3 weeks, we're running, about 300 to 400 cases behind in terms of picking up the phone, reaching these people, and conducting a thorough investigation to solicit the contacts. So right now we're stretched thin, and as Kevin had mentioned previously, staff are working long hours, 7 days a week to be able to meet the needs of our community, but definitely can't be done just by us alone.
I'd add also that we are notifying the positive cases when we get the positive test results, so that they are informed of that, so that they can isolate, self-isolate. It does take us a time after that to get the case investigator available to be able to do the interview for the contact tracing work.
If I could, Vice President Taylor, if you don't mind, if I just take a minute, because I think it's timely. We just shortly after the meeting began, received public comment from the chairman of the Washoe County Board of Commissioners, Chair Bob Lucy, who is also the chair of the governor's LEAP Local Empowerment Advisory Panel, I think is what that stands for. And it just relates to what we've been talking about here. So I do want to just mention 3 points he made in his public comment, which will be made available for everyone to review on our homepage of our website after today's meeting. But he does state that, and I know he's been working closely with our superintendent, Dr. Kristen McNeil, over the past few weeks on this, but that the county is committing to funding the health district for added and more robust COVID-19 testing and quicker turnarounds for the results, so as to be more efficient with timing to provide assurances that we can better contain the virus. He states that there'll be added contact tracers within the community to help address the needs of those affected by the virus and assure those around them that services are readily available. And he also states that a greater public relations campaign will be done to provide continued messaging to parents and the community about available testing, social distancing protocols, and self-screening protocols. I again just thought that it was important to make note of just those 3 items, and that came in just as our meeting began shortly after 2 o'clock. So good news that I think we do have a great partner in the county, and that there is that commitment to that additional funding to support you all in your work, which then supports us and our goal of reopening our schools. And I apologize, Vice President Taylor, for interrupting you.
No,
that was a good moment to share that.
No, that was very timely. Thank you, because that's the kind of thing we were talking about. It's because, as we move forward, obviously being able to track and trace, should there be a positive case, whether it's picked up in school or, in home, family gathering, or whatever the case may be, we need to, that's just all a part of ensuring that our staff, our students, and our families are safe. So thank you very much. Those are all the questions I have to now. I really appreciate your input and your information. Thank you, Madam President.
Yeah, thank you. If I could just follow on that. Wanted to say I'm grateful for the chairman's statement and his support. And I think it's important that what he also mentioned with the campaign for getting people to be wearing masks, understanding why that's important, and a positive approach to messaging on that in our community. Because we can't do this just through the testing and contact tracing. We really need everybody doing their part to prevent the spread of the disease, and using that testing and contact tracing to mop up.
I did see your hand up, Trustee Kelly, and did your
Thank you, Madam Vice President, or Madam President. And Mr. Dick, I appreciate you updating the school board on some of these numbers. And Heather, thank you for being here as well. I was kind of curious a little bit more if you could break down the numbers for me a little bit more. I mean, we know the county numbers, but I was wondering if you knew, for instance, where people lived that were coming up positive. Now, of course, where somebody lives doesn't necessarily mean they contracted it there. They could have contracted it anywhere else in the world, really. But if you knew, were cases higher in certain parts of the community than in others? One of the reasons I ask this is because I represent Incline Village, population center that's detached geographically from the rest of Washoe County. But then North Valleys is so different than Southern Reno and vice versa. So I was just wondering if you were able to break down those numbers, geographically and perhaps by age, just so I can get a better feel of what the positive numbers that you're seeing recently, what they represent in our community.
Thank you for that question, Trustee Kelly, because I can use that to do a little advertisement for the dashboard that we've got on the Regional Information Center site. It's at let's see, sorry, just jumped off it. It's at covid19washoe.com. And so when you bring up that site, there's a dashboard that's in the upper left-hand corner, and there's a box at the bottom left of that dashboard that you can blow it up full screen size. And that will show you that new cases daily trend line, as well as our total numbers of active and recovered cases, deaths, hospitalized, et cetera. But at the bottom, there's a number of tabs that you can select where you can get zip code maps that will show you how many of our active cases are in the different zip code areas. And you can also click on active cases, and that'll give you another dashboard that will show you what the age ranges are of our active cases, what the race and ethnicity are, et cetera. You can also get that for our total cases and for the deaths that have occurred in the community. So it's all available through that covid19washoe.com website.
That sounds great. Thank you very much. I mean, as a leader, I like the most information, the most accurate information possible. So I think that's great that you guys have that you're updating it constantly, and whomever is the one putting in all this huge amount of data, just tell them on behalf of me, thank you for doing that, because it really helps us, I think, with our decisions today and for other decisions that might have to occur in the future. So thank you.
That would be thanks to Ms. Kerwin and her fantastic epidemiology team.
Well, Ms. Kerwin, thank you.
Thanks. And if I could just speak to that, it's kind of interesting from an epidemiological standpoint. At the beginning of this, we really saw transmission coming from international travel. So some of our higher socioeconomic neighborhoods were really kind of drivers of this. And then once the shutdown occurred, we really saw it happening, interestingly, in kind of areas around the Sparks location, which to me was unique. So I dug a little bit into this, and it really was driven by our essential workers who work in warehouses with hundreds of other people. And that's what was driving it. And now we don't see really trends in one area of our community or another, because it is so widespread, and because everyone has returned to work in one form or another. And so it's pretty evenly distributed across our community, aside for some larger outbreaks in and around certain areas or potentially apartment complexes as well, if they've had gatherings or neighborhood gatherings or larger household sizes, which are driving those numbers relative to the number of rooms in a house given different neighborhoods. So that's what we're seeing now.
All right. Trustee Simon Holland.
Thank you, Madam President, and thank you, Kevin and Heather. Thanks for being so responsive to our questions, and for being so thorough and comprehensive with the information you're providing to us. We are really grateful for that. And I know you're aware of the complexity of the things we're dealing with that are going beyond incidences of cases. We're dealing with food insecurity with children. We're dealing with students with disabilities that cannot be served through distance learning adequately per our federal requirements. And so we're really struggling with, as you can imagine, balancing all of those concerns. And of course, as you've noted, we don't have conclusive studies on a lot of the things that we need to have conclusive information about in order to make good decisions. So we appreciate your adding to our knowledge. I wanted to just have a chance to rewind a little bit about some of the numbers we've heard, because it's some of it, I know it's been a function of time, and then we might be talking about a 14-day average in one place, and then we're talking about the incidence over the last 4.5, 5 months. So last week I read that we were at 190.8 cases per 100,000. And then today I think I heard you say we're at 240 community-wide per 100,000. Is that correct? Did I understand that correctly?
Yeah, I believe that was over the weekend. And hang on.
And is that a 7-day average, a 14-day average, a point in time? What is that?
Yeah, actually what I have as of today, it's about 239 cases, and that's per 100,000 over a 14-day period.
Wow, okay. And the numbers that you gave us, and thank you, Heather and your team, for pulling out those numbers that relate to children. That's one of our big dilemmas. We absolutely, I don't want to speak for my colleagues, but I think I can. We absolutely understand that children aren't the only people affected in a school. We do understand that there are staff members, and there are teachers, there are counselors, custodians, speech pathologists. I can't even say it, and I'm talking about speech pathologists. And so we understand that it's not only about children, but a lot of the studies we've seen from other countries have related to the incidence among children. Do we have a sense of what the 14-day average case incidence per population is for children, for young children?
I don't think we have that available to us, but we can get those numbers if that is of interest.
Because I appreciate that, we've seen, as you said, for under 10-year-olds, 304.7 cases per 100,000 in the entire time of our collecting the data. So that's and it was my question, and I appreciate you answered it. And as I see it now, we want to be looking at what's happening on a rolling average. So that might be interesting for us. We also have questions or assertions by folks who have emailed us in our public comments that the flu kills more children than COVID. Can you speak to that?
So locally, we haven't fortunately had any pediatric, meaning under 18. We did have the youngest person to have passed in our community was 18. They did have underlying health conditions. Right now, locally, we don't have data to compare to what our influenza-like illness statistics are relative to that. We did have pediatric deaths due to flu last flu season. If we're looking at it from a total population, we do know that COVID is has a higher fatality rate based on the numbers and the data so far than influenza. So it would be a safe assumption to say that would be true across most age ranges, but locally we don't have that information, fortunately, because we don't have any pediatric deaths at this time.
Okay. And I just, I want to give you all the opportunity to talk about that, because there's a lot of people, as my colleagues have said, there are a lot of people watching right now, and they're asking us questions as you're speaking. So I want to be able to have some of that addressed. I also just wanted to go back to the precautions that that we have recommended if we were to open any schools at any time during this epidemic, whether it's now or 3 weeks from now or whenever, and wanted to just give you an opportunity to comment on your view of things like, for example, we, in our July 7th action, made a decision to require masks of everyone of any age. So I just wanted to give you an opportunity to comment on what we had recommended for the safety protocols for our district.
So, Trustee Holland, I tried to convey at the beginning with some of the work that we've done with the school district, the hard work and the thoughtfulness behind the work that your Superintendent McNeil and her staff have done on the reopening plans. And I have been impressed with the different considerations, and you do one thing and then that impacts another, and you have to think through a whole series of things as to how to make things work with your altered operations. And so I appreciate that you made the decision to require the masks to be worn for younger children, and not just cutting that off at 10. I think those are important things. I think the masks are going to be very important for us to make success moving forward with this. And so overall, I think that the school district has done an excellent job with the plans that you put forward to prepare for this under the various scenarios.
Thank you. And one last question. Did I understand that the whatever the R stands for, the R rate, the reinfection rate, the multiples of how many people are infected by an individual, do I understand that to be currently less than 1 or around 1? What's our current R, whatever it's called, R factor?
Let me.
So the state announced today that our R naught was at, I think, 0.98. I think it's too early to start jumping at and calling that good and happy news with the uncertainty in that number. And that's a number that's statewide for Nevada. There's a COVID Act Now website that provides information for Washoe County. And that was updated yesterday on July 27th. And they have our effective transmission rate at 1.13.
Okay. Okay, thank you. That's all I have right now. Thank you very much again for what I know is very difficult for you all. And I know you don't have enough team members to be helping you work on it. And I appreciate the long hours you're all giving to help keep us safe. So thank you.
Well, I appreciate the magnitude of the decision that you have before you. And I can just ask you all to use your best judgment in making your decision. So good luck and thank you.
Thank you. Vice President Taylor, do you have a question?
Okay, yes, I'm going to probably log off and log back on because I have some tech issues going on. Anyway, just one more quick question that I did forget to ask. Looking at your data, we know we if we follow anything nationally and so on, I mean, there is, in our community in particular, there are an incredibly high proportion of cases that are impacting the Hispanic Latino community. And I know that you've seen this, and we have a very high population of students in our district from that background as well. Any idea as to why? And if there, I know you're thinking about efforts that can be done about that, but certainly with that instance already being so high, that's of concern to us.
Heather, you want to get that one?
Sure. So there's a couple different factors that really help drive this. First, early on, back in March, in the middle of the stay-at-home order, a lot of our Hispanic community works in those essential roles. So they are essential employees. They had to continue to report in person often to the workplace, and they worked in areas where and in some industries where there was consistent and ongoing transmission. A lot of our Hispanic families also live in multi-generational households. So again, because the spread that occurs in the household, that really is driving that. They're a community and culture that values family time and family gatherings. And we know that we've had an enormous number of contacts generated from some of our Hispanic households with persons who were infectious at the time, having social gatherings, birthday parties, other celebrations. And so we know that also has contributed to the high number of our Hispanic populations, driving the higher number in our Hispanic populations. We do have several Spanish-speaking case investigators, and they also have expressed that there are some challenges within some of those families trying to convince them of the seriousness and the magnitude that COVID carries, because of the perception may be, and I know that it's not just a Hispanic community perception, but across the board, that it is not that serious and that it's just another kind of flu. But I've definitely been approached by some of the Spanish-speaking investigators who have run into this challenge. And it does come down to educating all equally, but those first three factors, you know, the essential workers, larger multi-generational households, and then having dynamics where they do like to have more, you know, family gatherings outside their household with one another, tight community and family bonds that have really helped, unfortunately, drive the numbers up in that population specifically.
Thank you very much. Thank you for that.
Thank you. I know our superintendent has some questions, but just quickly before I get to her, there were a few things that were on my list that a few things that did get answered and a few that didn't. So if I could just quickly ask, so if we're looking at a scenario of, you know, setting some criteria for moving either into distance learning and out of in person, or out of distance learning and into in person, you've mentioned those two items, the new cases being under 100 per 100,000, and that's over a 14-day period. Is that correct?
That was my recommendation, yes.
Okay. And then the daily new cases on a downward trend. We do hear a lot from the governor and nationally about that positivity rate, and that number. And, you know, I know the WHO has one number, and we've talked, as you mentioned, about that 7%. I guess first, why isn't that part of your criteria, that positivity rate? And second, what is, I guess, our positivity rate in Washoe County?
So the state has adopted the county tracking using the positivity rate in a different way than California has in their county monitoring. And I don't know that I fully support what the state has in the way that they've adopted that. California uses the 100,000 cases per 100,000, or the 100 cases per 100,000 population over 14 days as one of their criteria for monitoring counties. They have as a completely separate criteria if you have more than 25 cases, then your positivity rate should be below 8, is the positivity rate in California. In Nevada, the governor has said that it should be, that we're tracking counties that have both less than 100 cases per 100,000 over that 14-day period, and they have 25 or less cases and less than 7% positivity rate. To me, it should be, you have one or the other of those criteria that you meet. To simplify it, I was proposing just the 100,000 or 100 per 100,000 population over 14 days. Our positivity rate has been around 10%, the way I've been calculating it. the correct epidemiological way to do that is to actually track the positivity of the test back to the day that the test was collected, which takes a lot more work and has a lot more time lag to it, because we have tests that are coming in over a week after people were tested, et cetera, and we have them coming from different labs at different times. So I've been trying to do what I think the state has been doing, which is just looking at the daily positivity test, positive tests, divided by the number of new persons that were tested that day. It's a little cruder measure, but I believe that's tracking right around 10% right now. But my thinking is, if we're going to be successful in moving forward and reducing our rate down to 100, I would presume that would be based on the amount of testing that we're doing, going to drive our positivity rate down significantly as well to get there.
Thank you. And I have visited the dashboard frequently since it was created, and just wondering, looking at it, and I've kind of got it pulled up now. Again, if we're going to set some sort of criteria to use for our decisions about in-person versus distance, when I'm looking at this, am I looking at, do I see on here 100 per 100,000 on the dashboard and I'm just missing it? Is that a number that is being reported on this dashboard?
We don't currently have that on the dashboard, but I think we could work on trying to integrate that into the presentation. That's a fairly new criteria just over the past couple of weeks.
Okay. Yeah, I think, I mean, you know, and I know we haven't made any decisions and won't in this item, but I do think when a decision is made, this is, as you have said, and as I think each of the trustees has hit on, this is a community-wide effort. This is not just something on, you know, the shoulders of our students and families. But if we can have a common goal that we're working towards and be transparent about where we are and where we need to be, I think that's the best case in this. And I apologize, just one quick last question that I had about your presentation, that graphic with the kids, for instance, like that daycare, the number of positives, the children positives. Do we know in this chart then those numbers of like the total children positives, those are directly linked back to, they were contact traced back to someone in the daycare? They aren't just positives coincidentally at the same time that there's someone else positive?
No, those are actual attendees of the daycare that were positive. So those first two columns there, total staff, indicate the number of staff who either work it or who work in that setting, whether it be a daycare or the pediatrician's office. The number of children who attended either an office visit at the pediatrician's office or who had attended in person at the daycare. And that final column is more the branching contact tracing that are linked back to that cluster.
Okay. And do we know, did the child give it to the adult, or did the adult give it to the child? Is that clear in your information?
I'd have to go back in and to each one of those cases and actually look at onset dates. The tricky thing about SARS-CoV-2 is that because of pre-symptomatic transmission, and different people may have actually had the same exposure, but one may start presenting with symptoms days before another person, that just looking at the symptom onset date is not going to be a definitive answer. In some of these it's pretty clear, and in some it's very hazy. And so I'd have to go back and look and see, you know, who had it first and who had spread it to others. With each of these clusters, it gets pretty complicated fairly quickly, if you can imagine. So yeah, I can't answer that right now.
All right. Well, thank you very much. I will pass it over to our superintendent, Dr. McNeil.
Thank you very much, President Raymond, and thank you so much, Kevin and Heather. I know that you all are exceptionally busy this time, and truly appreciate the time and effort that you all put into this presentation to allow the trustees to hear the data. I just have a couple of questions. So on the numbers that you all were able to provide in answering Trustee Simon's questions, the numbers for under 18 and under 10, the frequency counts, and it's been a long time since my stats days, but the frequency is that going to be different than the actual number when you break it down for race and ethnicity, because those numbers aren't equal. So is that because of the frequency?
So frequency in this regard is actually interchangeable with number. So with that first table there, that is the true number of cases that fall into those age categories. In that second table, we are missing race and ethnicity for 124 of the pediatric cases. And so that is the difference there if you try to add those up. Some are unknown, and some, we do have some, because obviously when we investigate pediatric cases, we speak to first the parent and legal guardian, and then if they provide permissions and the child is old enough to communicate, we will then question the child. But in some instances, race and ethnicity is not captured, and in others, it's actually refused to answer. So,
okay, thank you very much, Heather. And then for the metric that we're looking at as far as 100 cases per 100,000 and that particular metric. I mean, obviously we're a very large organization, and we can't just flip the switch. So when we talk about the 14-day average, I think it would help the board to know, is that kind of the metric that we would be looking at? So let's just say, for example, on day X, we get to 100 cases per 100,000. And then 14 days out from there, if everything stays consistent, that would be what we're looking at as far as an in-person type model or a hybrid type model. Can you go into that maybe a little bit more?
Yeah, I think that captures what my thinking is on it, is hitting that 100 per 100 cases, new cases per 100,000 over 14 days. And then 14 days after that to reopen. That would give some time for hopefully some continued decline. It would give you time to get ramped up. Hopefully that's time. That's a heavy lift, I'm sure, to get ramped up. And I guess I wouldn't be proposing complete reopening. I think the hybrid model that you have makes a lot of sense, and provides more protection for moving forward. So that's what I would recommend.
Okay. And then, and I absolutely appreciate the public comment from Chair Lucy, because those are significant concerns. I know they're concerns for our 8,000 employees as far as the testing and the contact tracing, and to make sure that we have that in place. And so I truly appreciate that. And we know that the governor has designated all of us, educational personnel under his directive 005 as essential employees. And I appreciate, Heather, that you actually mentioned that earlier as far as essential employees. But Kevin, I noticed in your recommendation that you were talking about if the board were to decide to go to a full distance learning model, that it would be appropriate to have educators, teachers within the classrooms. Can you go a little bit more into the reasoning for your recommendation on that particular area?
Yeah, thanks. And thanks for following up on that one, because I didn't really mention that when I was doing my presentation. We feel that the school district has got has good plans in place, and they have, without the students at the schools, quite a lot of space for the teachers to be able to occupy safely, social distanced. And we've, from discussions with Superintendent McNeil and her staff, also believe that the quality of the distance education that could be provided would be enhanced if the teachers are doing that from a classroom setting with other resources available there than doing it from their residences, et cetera. And so, the recommendation was if you're doing distance learning, not that the schools needed to be closed to your teaching staff or support staff for them, but they'd be able to utilize the school facilities and the resources in the classroom to provide that distance education.
Okay, thank you for that clarity. I appreciate that. And those are all the questions that I have, President Raymond. Thank you again, Kevin and Heather. Truly appreciate it.
Thank you.
Right. I will ask our clerk. We did get some public comment on this item during your presentation. And so I'm going to ask our clerk to read the names of those individuals that submitted public comment during the presentation. I will just take a moment to remind everyone that you can submit public comment to the email address publiccomments@washoschools.net. Those public comments will be read by the trustees during the meeting. They were read prior to the meeting, and they will be made public on the homepage of our website. We already have a number up there over, I think, well over 200 of the public comments we received prior to the meeting are already posted, and the rest will be up tomorrow. I would like to remind everyone that when we receive public comment, we don't directly reply with a response to your questions. If you're asking a question on public comment, we do our best during the meeting to try to address as many questions as we possibly can, but we will not be responding with a direct public comment. I would also mention that if you are emailing board members that will not be part of the public record. That is an email that we receive as board members, and we will respond, but it is not technically included as part of the public record unless you send it to publiccomments@washoschools.net. All right, JJ, if you could please read the names and fellow trustees if you haven't already. I know we were all kind of trying to keep up during the presentation, but take a moment to look through your public comment emails, please.
We received public comments from Washoe County Commission Chair Bob Lucy, Michelle O'Connell, Jacqueline Klukowski, Dawn Curry, Christy Grayson, Katiana Taylor, Jennifer Delaney, Jennifer Bowen, Brianna Stack, Amanda Jones, Elizabeth Nodolo, Kim Hedges, Amy Lee, Andrew Cristancho, Christine Barrett, John Clymer, Hillary Wilson, and Ryan Doster.
All right, thank you very much, JJ. And I will just check with my fellow trustees to see if anyone has any last burning questions for Kevin or Heather. All right. Well, thank you both again for making the time. I hope you have heard us and our appreciation for your taking the time and answering these questions and being so open and forthcoming. We know that this is hard on you as well, and these aren't easy decisions for you to come to us with either. So, a recommendation.
Well, thanks very much
Thank
for your
you.
time, and appreciate the close collaboration we have with the school district. Thanks very much.
All right, it is 4 o'clock, and I know that the next agenda item will be a lengthy one. So I will be asking for a 15-minute recess. It is technically 4:08. So if everyone could be back in 15 minutes, and we will move on to the next item on our agenda. Please mute and turn off your video. All right, it looks like we have almost everybody. I will wait just a moment for our last few people to join us. Okay. I will call the meeting back to order, the regular meeting of the Washoe County School District Board of Trustees. And our next agenda item is number 4.03, which is presentation, discussion, and possible action on the options of in-person, distance education, and hybrid learning submitted to the Nevada Department of Education for the reopening of schools for the 2020-21 school year based on directives and guidance from the federal government, state government, and Washoe County Health District to ensure the health and safety of students, staff, families, and visitors to district buildings and facilities, to include information on surveys provided to district staff and families regarding distance learning during the 2019-20 school year and the reopening of schools for the 2020-21 school year. This is for possible action. Before I turn it over, I will just say that we have a lengthy presentation from staff. Please feel free to ask questions throughout the presentations. I'll be just keeping my eye out for raised hands or waving hands. The plan is we'll get through the entire presentation, including a presentation on what our possible action items are for the afternoon. And then we will, at that time, go back and go through each action item in order of their presentation. So we'll get through just, a presentation about what those action items are. Then we'll go back and actually consider each item. With that, I will turn it over to our superintendent, Dr. Kristen McNeil.
Thank you so much, President Raymond, members of the board. What I would like to do is I'm going to ask our fabulous JJ Batchelder. She is going to bring up on screen the actual PowerPoint presentation. And before we get into the presentation, what I would like to do, we have a letter from Dr. Trudy Larson, who is a member of the governor's medical advisory team. And so she has written a letter to the board as well as to myself. And so I think it's important, just within context of what we're talking about today, to make sure that we are able to read that letter. And the reason that I'm reading the letter is because we do rely on the medical advisory team. I have participated in phone calls with them as well, and they actually do provide guidance to the governor's office, and we know that we rely on the governor's office for that information. So to the Washoe County School Board and Superintendent McNeil, from Trudy Larson, MD, Professor and Dean, School of Community Health Sciences. I have had the privilege of being a member of the governor's medical advisory team for COVID since March. As a pediatrician initially, and then as an infectious disease physician, I feel my expertise has been important to the decisions and advice our team has given to the governor. As an emerging disease, COVID-19 has made it essential to be able to pivot and respond in rapid fashion. All of us are concerned with the surge of cases in Washoe County. I concurred with Kevin Dick when we spoke last week that the surge makes it difficult to support fully reopening the schools. 10 days prior, our MAT, again, MAT stands for Medical Advisory Team, had an intense and deliberate conversation with Dr. McNeil and representatives from the Nevada Department of Education that laid out recommendations how to handle in-person classes and bus transportation. We used scientific and psychological evidence in discussing and voting on those recommendations. The numbers have surged since that conversation. After my discussion with Mr. Dick, I went back to the literature and noted a number of new articles and commentaries from important national groups. From that review of the literature, I revised my thinking and now recommend that K through 5 grades should reopen in person while middle and high school remain distance learning. 2 pieces of evidence support my opinion. Number 1, children less than 10 years of age have many fewer ACE2 genes in their nasal epithelium. ACE2 proteins are the receptor for COVID particles. 2, children have been shown in studies to have less serious disease that is not readily transmitted to others. Unlike influenza, children are not the primary transmitters, adults are. Our current surge numbers represent adult cases primarily. Given the science of COVID in children, my opinion is that the risk to children is far lower than the risk of delaying school. So many benefits accrue to children participating in all of the experiences of school. I think the recommendations of the MAT for how to safely bring students and teachers back is thorough and fully incorporated in the Washoe plan. It is my opinion that the benefit to children being in school is greater than the risk that the plan proposed for schools is as safe as available evidence can make it. Having a choice for parents is important. Again, the letter submitted by Dr. Trudy Larson, Professor and Dean, School of Community Health Sciences. All right, so JJ, would you please advance the slide? So again, I just want to reorient our trustees and the public to what are guiding principles when we're talking about the reopening of schools. Importantly, all decisions are based on a foundation of do no harm. So when we went into a first distance learning model, if you remember, one of the examples of do no harm was our grading policy. We did not provide new content in the last iteration of distance learning. However, we know for our plan that has been submitted, if the district were to go into a full distance learning, that is not the case. We will be providing new content covering the content standards. However, an important part of do no harm was a great example at your last trustee meeting when we talked about the attendance policy and the revision to the attendance policy and making sure that students are not in any way, shape, or form harmed because of having to miss for a possible exclusion due to COVID. Again, ensuring our student, family, and staff, their basic needs are being met. Ensure equitable access for students. We're going to talk a little bit more about that when we get into the technology. Maintain high academic expectations for all of our students and follow as practical all federal, state, and local health related guidance. If you would advance the slide, JJ. So reopening schools. So where are we currently? Even though the governor had spoken briefly about the phases and that we will be moving away from phases, the guidance currently right now is Directive 022, talks about less than 50% occupancy within a particular space, not necessarily a building, but a particular space on the occupancy level. And then 20 days notice to families as far as a public meeting. Face coverings, as the public knows, the Board of Trustees has made it mandatory for face coverings on any district property, schools or district buildings. And then districts must submit multiple learning plans to the Board of Trustees and the Department of Education, which we have, and those have been approved currently, the distance learning in person, and then the hybrid learning model. If you'd advance, JJ. So today, as we walk through our presentation, we thought that it was also important to review the plans that have been approved by the Board of Trustees back on July 7th, just to reorient the trustees as well as the public, and then go very, very deep into a discussion of what distance learning would look like going into the 2021 school year. We're going to be presenting survey findings from our family and staff. We've wanted to make sure that we presented these survey findings in particular into the decisions that the trustees are going to have to make today. So 2 survey findings will be gone over the distance learning plan from last school year, as well as information regarding our staff survey. And then we really want to do an update where we are in technology, where we are with devices, where are we with connectivity. And then also make sure that we have key updates both on the academic and importantly around the operational levels. So personal protective equipment, what our supply chain is, where are we at with our PPE, face masks. Our Director of Student Services will be going deep into screening and temporary exclusions. We will be talking about heating, ventilation, and air conditioning systems. We know that we've received several questions regarding our ability to make sure that we have fresh air into our school buildings. And then finally, taking a closer look at distance learning at the elementary, middle, and high schools. You would advance, JJ. And I believe we are going to turn this over now to our Deputy Superintendent, Debbie Beiersdorf.
Thank you, Dr. McNeil. President Raymond and trustees. So I'd like to, as Dr. McNeil stated, just kind of remind you of decisions that were made back on July 7th, starting with the in-person learning model that was decided upon for our elementary schools. And again, all elementary age students will attend school throughout the week, 5 days a week, receiving all of their instruction within the school building. And also as a reminder, in order to bring our elementary students back into the buildings, plans have been put in place that adhere to current phase 2 requirements that have been directed to us by the state, including such things as screening. So guidance around expectations for daily screening for both our students and staff, social distancing requirements in a classroom, for example, 6 feet between students. And I wanted to emphasize here as well that as our principals have been working on plans along with our area superintendents and also staff from various district departments such as facilities, putting plans in place that would maintain that social distancing based on the size of the classroom or learning area. Use of PPE, personal protective equipment, such as face coverings, restrictions to close contact activities, such as recess and lunch times, and then also to enhance cleaning and hygiene protocols, use of hand sanitizer, breaks for students to wash their hands, etc. And then I also wanted to remind you, trustees, that in addition to the in-person learning model for elementary school, our families have also been given the choice for full distance learning, and we'll talk about that here in just a moment. And then also too, that full distance would be used in the case of temporary exclusions for our students. JJ? So the second learning model is our hybrid learning model. And again, back on July the 7th, decisions were made that our middle school students and our high school students would return to our school buildings in a hybrid model. And again, if you remember, we talked about the A and B rotation days. So this uses both an in-person and a distance learning model for when students are receiving instruction in the school building and when they are away from the school building. We also talked about certain vulnerable populations being in our secondary schools, our middle schools, and our high schools every day, all week. So for example, if you remember, we talked about our students that are receiving special education services, our students who are newcomers to our country and are receiving English learning instruction as well. Also students that are in foster care, students that are considered children in transition, and then also our students who are gifted and talented and have unique learning needs as well. So while students are in school, again, all provisions that I talked about on the previous slide, such as social distancing, use of PPE, screening before students would come into our buildings would remain the same. And then while on distance learning, all provisions of distance learning, again, access to certified teachers, access to food, we'll talk more about this, would remain the same as well. And then also our middle school and high school families have also been given the choice for full distance learning, including full distance learning that we would be using for temporary exclusions. JJ, thank you. I wanted to take a moment here to update our trustees and our public about the work that has been happening since the July 7th Board of Trustees meetings in order to prepare our schools for the return of our students. There have been many meetings with our school principals, with our area superintendents, and our area superintendents, as you know, directly supervise our principals and work very closely with them, and also with various departments and offices within the school district. These meetings have taken place on Zoom. They have included meetings with all high school principals, all middle school principals, elementary principals, and then there's also been meetings that have been scheduled in person with our principals as well. So I wanted to talk about the next two bullets in relation to that. So there have been many walks of our schools that have been conducted by members of our leadership team, and also our facility staff under the leadership of Adam Searcy, who is our Chief Facilities Management Officer. And the purpose of these walks or visits to the campus is to take a look at all spaces within the school that would need to be used as learning spaces. So classroom spaces, perhaps multi-purpose room spaces, library spaces, computer lab spaces as well, to help our principals plan for the return of students, to make sure again that we are following the phase 2 expectations around social distancing, for example. I want to also quickly give a shout out here to our facilities department and also our nutrition services department. A challenge for our schools has been thinking about how we will feed students. How we've done lunch in the past is not what it's going to be looking like in the near future. So again, thank you to both of those departments for working closely with our principals and putting plans in place. We've also been hard at work building up and fleshing out distance learning plans for our families who may choose to have their children stay at home, or as I mentioned previously, students that may be at home, need to be at home learning due to temporary exclusions. Our principals, our area superintendents, myself, our Office of Academics, many offices in the school district have been working together to build up plans for each of our sites. And you're going to be hearing more about these plans later on in this presentation. But using the tools that we have at our disposal as a school district, such as Microsoft Teams to deliver teacher-developed standards-based instruction. Principals are working with families right now to better determine which families may choose to have their students staying at home, or which families are wanting their students to return to our buildings. Our high school and middle school principals are working closely with our Edgenuity, our extended studies department under the leadership of Dr. Paul Lamarca, to better understand the power, I would say, of our Edgenuity program in providing distance learning to our middle school and our high school students. And then also, you'll remember at the July 7th meeting, we've got the opportunity, and we've definitely taken advantage of that opportunity to have an additional 5 days of professional learning. And you'll hear more about those plans as well, but they do include extra support for our teachers with Microsoft Teams, Edgenuity, and then also Infinite Campus updates that are happening right now, so that we can better take attendance of our students who are on a distance learning model. JJ? So we wanted to break down a little bit more specifics by buildings or by grade level as well. So work that has happened to move along our plans for the in-person model at elementary as it currently sits is, again, working with our schools for the safe return of students and staff to the building, being very mindful of, again, those phase 2 requirements, social distancing, et cetera, in different learning areas. And then how we will be able to utilize all staff. You've heard us say all hands on deck, but how we will be able to utilize all staff to reduce the number of students in one area. Our principals and our front office staff in our schools have been very busy too, working with families in answering questions to the best of their ability. For the middle and high school, we've talked in the past as well about the importance of a master schedule and how that drives student learning at the middle school level, absolutely. And I would say even more so at the high school level as we're preparing students for graduation, on-time graduation. So our area superintendents have been working with principals. Our principals have also been working with each other. The collaboration has been pretty amazing in order to see where changes might need to be made to master schedules to better support distance learning or the hybrid model as well. And then other school-based updates, I've talked a little bit of these. You'll hear more in a little bit about recent surveys for students or families that may choose to go full distance learning, engaging with parents, engaging with our school communities, after school programming, looking at plans for after school planning or programming, such as our Team Up program that's in a number of our elementary and some of our middle schools as well. And then later on in the presentation, you will hear more about North Star Online School, but North Star is continuing to enroll students and has seen a pretty good number of families that want to take advantage of this, this pretty amazing program. And I wanted to talk a bit about the plans that have been moving forward since July 7th for full distance learning. If you'll remember, again, we've talked about North Star. North Star Online School is a program available to all students in grades kindergarten through 12th year, through the senior year. Edgenuity is a program, an online program that is built on Nevada academic content standards, available to students in middle and high schools. And then the online curriculum planning guides, that is our teacher developed and teacher delivered curriculum to students, again, based on Nevada academic content standards and also the adopted curriculum that our school district uses right now. So full distance learning, again, our commitment is it's instruction that is supported by qualified and certified teachers. It does require that our kids have access to devices in the internet. And as Dr. McNeil mentioned earlier, you'll hear more about that a little further in the presentation as well. We absolutely understand the need for ongoing professional learning support for our teachers. I would even expand that out and say also for our administrators and other site-based staff to support full distance learning. We'll also hear a little further in the presentation about our plans to make sure that we are compliant with the individual education plans or our IEPs for some of our students. And that how do we also meet the needs of students that are eligible for free and reduced price lunch and having access to nutritional food. And you will hear from our nutrition services leadership about that a little later in the presentation as well. Actually, I think you're going to hear about that right now because I'm turning it over to Lianca Solis to take it from here.
Thanks, Debbie. Lianca Solis, Director of Nutrition Services, for the record. So since mid-March, since the district closed, we've been working diligently to continue to provide meals to our students in our community. With our partners at the Food Bank of Northern Nevada, we've served over 500,000 meals so far. We've been concurrently focused on our reopening planning efforts as well, planning menus, staffing needs, meeting with vendors and school site administrators, as Debbie had mentioned. Although we've made quite a bit of progress in planning for the hybrid reopening, we've also been simultaneously planning for a full distance model. And just as with the hybrid models, safety of our employees, the meals we serve, and our students is our #1 priority. We have created simplified menus that can be served grab and go style, breakfast, lunch menus, and with a preference to offer multi-day packs. We are also currently evaluating sites and pickup times that would be the most accessible to our community. In these assessments, we are looking at FRL data, socioeconomic data of various areas, as well as current participation trends with the pandemic feedings that we're currently doing. We are also looking at adding some early morning and late afternoon pickup times, again, just to make it more accessible for our families. We are also looking at the actual distribution models. And again, just to make it as convenient as possible in a full distance model, we are looking at revising some of those distribution processes to make that curbside service as efficient as possible. So despite all this planning, I do feel it's important to note that both the hybrid and full distance model present some major fiscal impacts to the Nutrition Services Enterprise Fund. And if we could just go to the next. So last year, with normal operations prior to COVID, we were averaging about 48,000 meals per day. Since our closure last March, our best week of community feeding has averaged 9,000 meals per day. And really our day-to-day average is around 3,500 meals per day. So with that decrease in participation, the result is, as we look forward, an estimated fiscal impact to the enterprise fund ranging between $25,000 to $30,000 a day loss in a hybrid model, and $65,000 to $70,000 a day loss in a full distance model. We're obviously working to mediate these losses. We're reviewing every expenditure line item in our budget. We're revising our operational practices, and we are very actively communicating the need for some federal waivers that we feel will allow us to operate more efficiently. The main one that we are looking for is a waiver to extend the current summer feeding process model that we are operating under. This allows students to access meals at any school site for free. Without this waiver, we would need to provide meals based on a student's eligibility, and we would need to tie them back to their enrolled site. And what that looks like operationally is curbside point of sales and rosters at pretty much all of our school sites, or the majority of them. And so when we talk about having an expedited process to get people through, you can see where that could have some issues. So we have certainly been communicating that with USDA and NDA that would present an operational roadblock for us to provide meals efficiently in any curbside model, not to mention during a pandemic. We're also continuing to meet regularly with the Nevada Department of Agriculture to voice our concerns and talk through some options with them. Continuing to meet with the Food Bank of Northern Nevada to assess our community needs and make sure that those are being met. And we're communicating regularly with like districts to explore opportunities for more efficient processes, since this is really the first time for all of us going through something like this. We're going to continue to work with all of our partners as well as we provide vended meal services to Head Start programs, Team Up, and small charter schools throughout the county. So we want to be able to continue to meet their needs. Ultimately, regardless of the direction that's taken, we're here to support. We'll continue to do so. And with that, I will pass it to our Director of Transportation, Mr. Rick Martin.
Good afternoon, President Raymond, Superintendent McNeil. For the record, Rick Martin, Director of Transportation, and thank you for the opportunity to come forward today on this interesting day, to say the least. From the standpoint of where we are with the hybrid model, we are in good shape, preparing for that, for moving forward from the transportation standpoint. We'll continue to do so as we get closer to the date. For a full distance model, these would be the items that we would look at from a transportation standpoint to support the full distance opportunities. Food distribution is needed, working with nutrition services in that area. Curriculum and materials distribution is needed. And again, from the materials, that could be any number of things, including assisting IT with technology distribution and the like. The bus Wi-Fi hotspots, they already have those in place. We would be working with the IT department as far as how those would be placed, where they would want those placed, and what we would require of our staff to assist in that area. And then potentially at the end to work as an assistant to teachers, to other services throughout the district to help with students who might be having issues, particularly vulnerable students, working as possibly mentor coaches, those types of things. So that's what we're looking to do to help support any decision that's made. And we will continue, as Leonka said, to be responsive in that. Thank you.
Good afternoon again. Ben Hayes, for the record, Chief Accountability Officer. So we call it a survey, but really it was a form. It was more than anything to help. This is about a week prior to the health department coming out with their recommendation last week. So it was really intended to help our schools get information on what families were going to do, given the options of distance learning, hybrid model, and kind of full, for vulnerable populations, a full return to school. So right away we got a team working, and we're able to do phone and online surveys in Spanish and English. And so email and kind of a web form survey, and then again, a phone poll. We were able to get almost 38,000 responses. So 37,848, it turned out to be about 61% of our kids that we were able to account for. And again, the survey or the form ran from July 14th through yesterday is when I kind of picked up some more data from it. I should say there are a lot of schools still working with families to try to figure out who all is missing and what their plans are. So the survey itself isn't ending. This is where we are through yesterday. And again, like I said, since it was intended really for planning and what we're going to do, we didn't ask any questions on attitudes or perceptions. It was, given these options, what is your plan for coming back? So if we go to the next slide, you can see the results, and I broke them out by elementary, middle, and high school. And you can see the trends aren't too different, but there are some slight differences. So a little over 2/3 in elementary school of the students, their families are planning on having them come back in person. And then if you add up distance learning, that option, the 28%, is distance learning, as Deputy Beiersdorf alluded to earlier, distance learning within the school. So stay enrolled in your school and you do kind of online learning with the district curriculum and resources. And then another 2% we're going to go to North Star Online School with their curriculum. So that's about 30% distance learning. And then the non-WCSD row down here, just there was an option that my child will not be enrolled in Washington County School District next year. So that could be private school, it could be a different charter, or something to that effect. So again, a little over in the elementary schools, 2/3 of the students, their families say that they're planning on going back, and then about 30% distance learning. Going over to middle school, that in-person, the hybrid model, that drops to 62%. But then if you add in two kind of cells down, that 10%, those are students that would go every day, would plan on going every day. And those were the vulnerable populations that Debbie Beiersdorf alluded to a little bit earlier. So 27% in the middle school would do full distance learning. And then if you go over to the high school, you can see the numbers there. About 22% would want to do pure online distance learning. And between the in-person hybrid and in-person every day, that's about a little over 3/4 of our kids at 77%. So I am happy to answer any questions and now or later. But I'll hand it over to Emily Ellison, our HR chief. She's got the employee survey results.
Ben, I think we do have a few questions on this slide. So if you wouldn't mind hanging around, I'll start with Trustee Cottle and then Vice President Taylor.
Thank you, Madam President, and thanks, Ben. And looking at the numbers, I don't see North Star under middle school and high school. So do we have a percentage for North Star enrollment for those two groups?
True. So in the secondary and middle and high school, our Curriculum and Instruction Office of Academics and our schools were very certain that they would want to do any distance learning for students that aren't already enrolled in North Star, that they could do it better through their own school. So let's say it's a Sky Ranch and a student wants to do distance learning, stay enrolled in Sky Ranch and do it with the school's online relationships and distance materials and all of that. So to answer your question in a long way, it wasn't really an option. It was fewer than 1% in middle school, and in high school, again, virtually non-existent because folks wanted to stay with the school.
Okay, so what you're saying is if students that are going to be at North Star in those grades have generally already been there, and students for this year, their families would rather just keep them enrolled their own school, do distance learning so they don't have to change schools.
Correct. And that's not to say that North Star is not honoring that option, or schools won't let that option take place, but that's where the default is right now.
Perfect, thank you.
Vice President Taylor.
Thank you, Madam President. And thank you, Ben. As always, your team always does a great job. Just one question. Was there any opportunity, and I know this was really kind of a quick down and dirty, sometimes phone call, people press a button, kind of a survey, but I was wondering if there's anything that that would allow us to disaggregate this data by ethnicity or anything like that?
Yeah, I mean, so we're able to get probably 90% or 95%. Well, let's see, 96% of the responses tied to a student ID for the most part. So upon request, we can disaggregate it however we'd like into any number of our student populations. Again, it was originally intended as kind of a registration planning tool, so we didn't break it up by that, but I can most certainly do that.
I was just wondering if we saw any trends based upon any of those ways that we can break out data. So I guess let's see how it goes, but that would be something that I would, if it continues to be relevant, because if it isn't relevant, it wouldn't matter. But if it continues to be relevant, I will be interested to see if there are any trends based upon any of those areas that may be of interest to us.
Okay, yes, so I plan on posting just these quick summary slides tomorrow onto the washofschools.net/survey site. And I'll put a few slides or tables in with some quick disaggregations. And then again, we're always able to provide more.
Thank you very much.
Mm-hmm.
Thank you, Madam President.
Trustee Simon Holland.
Thank you, Madam President, and Ben and team, thank you for doing this hard work. I know there were a lot of hours put into all of the phone calls and all of the processing the information. We've had emails from folks who say, gosh, I didn't have the benefit of the district health officer's recommendation that we don't close or that we don't open when I answered this. And I just wanted to give you an opportunity. These are pretty distinct percentages, and I just wanted to give you an opportunity to tell us your confidence level, reliability in general with these percentages.
So I don't want to overcomplicate it. I'm very confident in the numbers, but there's always, you saw the last presentation I gave a month ago, and there's sometimes some of our populations that we haven't been able to engage so much with survey data collection. They haven't had a full, let's say, population access to answer it, or at least commitment to answering it. So with all of that said, I'm still very confident we're over 37,000. And I've been watching the trends in these particular numbers since about 15,000 students in, and they have barely changed at all. And then to get to your your first point that you made, that they didn't have the benefit, we've had close to 1,000 families retake the survey because they may have changed their mind. And in each case, we're able to take the latest response. So, and we'll keep doing that.
That's great. Thank you. I wasn't aware you were letting people retake it, and I don't know that the public generally knows that either. So that's great to know. Thank you.
Yeah, thank you. Trustee Cottle.
Thank you, Madam President. Just kind of go off of what Trustee Simon Holland said. To reiterate, before we take our action, based on the July 7th action, it's very important to the board that families knew that at any point during this school year, families can change their mind. If they've committed to in-person learning and they are uncomfortable with that, they can get in touch with the school and change the distance learning. So because we've heard some comments from families that I took the survey before the health district made a recommendation. We really want to make it clear to families that you are not stuck with your initial decision for the school year. Now, I know the district has said North Star enrollment is best at the semester break, but if you're at Shaw Middle School and you committed in person, the hybrid, and you want to go distance, you can do that. So, because I think there's some unease in the community that, man, I've committed too soon, and there's really no such thing as an absolute commitment. You can change your mind. So we may want to, with our schools, have them work with families that committed to in person and just make sure that if they're concerned about anything, that option is there. We don't want families stressing out about that. So I think it might be something we want to emphasize with our families and our schools as we get closer to the start of school.
For sure, yeah. And I'll just tell you from recent quick experience, all of our principals have been really good working with the families if they change their mind and explaining kind of what this option means, if it's edgenuity and distance, what this option means. And I do have empathy for the families that feel like they're committing too early or not. So we've made pretty clear, hopefully, on the introduction to the survey and on the phone call that your choice tonight or when you answer is not binding at all. You can change your mind.
Great, thank you. Trustee Minetto.
Thank you, Madam President. This might be a really abstract question, but now if we have the little kids or big kids who refuse to wear masks and their parents even back them on that, and they're in person school, do we after the process of teaching and reteaching and the restorative practices, will we be moving them to in the school distant learning? But that doesn't make sense because they still won't have their mask on. So there's an interesting question for you because you know what's going to happen.
Yeah, I'm going to claim my survey guy status and not answer that question. If Deputy or Superintendent McNeil want to jump in, they can. I know that I'll say, I'm not trying to kind of run away from the question. That's something that is being worked on. There's a teaching and learning committee. There's reopening and relaunching committees that are dealing with that same exact question. And I know lots of schools are dealing with it every day too.
And I could maybe jump in there. Trustee Minetto, again, Deborah Beiersdorf, Deputy Superintendent. I think our superintendent's been very clear around the expectations for our staff and students to wear face coverings. I will say though that it's very important that, as you said, that we do reteach and we work closely with our families, our school communities. But then I would also then say too that distance learning might be an option in situations like that. And our school principals are very aware of that.
Okay, thank you.
Trustee Kelly.
Thank you, Madam President. I don't know if my question necessarily has to do with this particular slide, or maybe it would be one of the previous slides. But we've seen a lot of, we've seen some criticism of the current school district plan for in-person learning. And we've seen a lot of people that have said that they like the plan, they think it's a good plan, but I want to focus my question more on some of the criticisms that we've seen of it. If somebody, so let's say the board were to vote on the current hybrid where we have some in person, we have switching of in person at the middle and high school level. And if somebody, whether it's a student, a member of our staff, or a visitor, like a parent bringing their student to school, if somebody spots a weakness in the plan, and it could be a weakness with the procedure, it could be a lack of personal protective equipment, it can be something that somebody just feels, this is something that needs to be addressed quickly if we want in-person learning to continue to move forward, to continue to be safe. What's the procedure for somebody like that to let that concern be known so that it gets up to the level where we can say, okay, we need to get this school something. We need to allocate some resources so that this school can get more of this. Can somebody explain kind of what that procedure looks like now? And could it evolve over time? Just again, to make it so that people feel like if they spot an issue or a concern or a weakness, it can get addressed as quickly as possible.
Trustee Kelly, I'll go ahead and take that. And then if Deputy Superintendent Beiersdorf wants to chime in. I think it's going to depend, Trustee Kelly, on what the particular weakness may be. So if it's an operational weakness, so let's say, for example, somebody notices that a school may be running low on hand sanitizer or something such as that, then it would be on the operational side. And that's where our administrators work very closely with the area superintendents and our facilities department on, okay, so we need to, get more hand sanitizer out to the school. If it has to do with social distancing or the number of students that may be in a particular area and there's concerns, we've all received emails regarding athletics, and somebody may be driving by a field and see some of our athletes that may be out on the field and whether they're wearing face coverings or not. So I think that there's ways that the public, that our employees, even our students are able to reach out and make sure that they're getting their voices heard. And whether that's to their particular teacher or to the to the administrator. And then it would, if it's not being addressed, to make sure that our area superintendents know that as well. So Deputy Superintendent, I'm not sure if you want to chime in.
Oh, those were all points I was thinking of, Dr. McNeil, but I think it's also important too that our building leaders, our administrators, and our teachers understand what the guidance is as well. There's a lot of information that's coming to all of us in a very quick pace, a very fast pace. So that's incumbent on us to make sure that our schools know too, whether it's social distancing, what changes may happen or may not happen around that will be very, very important as well. So close collaboration, close communication, making sure that we're getting information out to our schools and our other district buildings as well, with very clear guidance is going to be very, very important. Will continue to be very, very important as we move forward.
Okay, yeah, I appreciate you saying that. And again, I would stress that, specifics, if we can, the sooner that we can let people know specifically, these are the steps that they would need to follow in order to report something. And if you're a staff member, you would go to your principal. If you're a parent, you would go to your teacher, or you would write the school board. I mean, the more specifics that we can give people, I think it'll allay some of the concerns people have with the plan, because they know, okay, we know plans can't be perfect. I personally believe our plan is a good one, but if we can give people the opportunity to let us know, hey, this is where I've seen some issues, then we can work harder and harder to try to get our plan more and more perfect over time. So I appreciate you, both of you, mentioning that.
Absolutely.
Are those all your questions, Trustee Kelly? Great. I will move on to Vice President Taylor.
Thank you, Madam President. Just a quick question. I know we've discussed this before, but we've gotten some recent questions regarding it. If a family has a child in middle school and in high school, and if we were to continue with the hybrid plan that we've currently approved, if we continue in that direction, can that family be assured that their middle school kid and their high school kid would be on the same track, either A or B, so that they can go together if that's what they want to do? I know, again, we've discussed it before, but can we assure our families of that? Should we go in that direction?
Dr. Taylor, I can jump in there and answer that. Yes, and we can pull that information fairly easily out of our Infinite Campus student management system that we use. And then in all likelihood, and I know it's not going to be true for every student or every family, the students are probably within the same vertical pattern of schools, how we organize the supervision of our schools. So for example, may have a student at Shaw Middle School and up at Spanish Springs High School, And then the principals would work together as well. And that's been something that our area superintendents have been talking about with principals for quite a while now. Again, trying to minimize as much as we possibly can challenges for families. So yes.
I appreciate that, Deputy Beiersdorf. This is, I mean, this, whatever we end up doing, it's so disruptive to families one way or another. So anything that we can do to help to, we can't mitigate it, but to help to minimize it, I'm sure families would really appreciate it. So thank you very much.
Right. I have one question, and you may not have the answer right in front of you, Ben. I was just curious if there were any particular schools where you saw, a great difference in that kind of trend, where you might have a closer to 100%, return rate, or a less than, 60% return rate.
I noticed a few. None of the patterns kind of substantially different. Sorry, I can't speak. Substantially different from this pattern, but there were. I can think of a couple middle schools offhand that were a little bit more, let's say, careful, or substantially more wanted to do distance learning, but the same pattern that you see here held across the board. And I can get a table of schools for the trustees and definitely for our leadership team.
Well, and I really am primarily asking if we're thinking about, moving forward with the models we have, if we would be looking at a school that would just be way out of whack with teachers, allocations of teachers that there aren't enough students to meet, or vice versa. So, and I know that will maybe be a segue into our next slide with Emily taking over, if everyone is ready for that. All right.
All right, good afternoon. President Raymond, can you hear me okay?
Yep.
Okay, great, thank you. For the record, Emily Ellison, Chief Human Resources Officer, and I'm here to share more information, as the slide indicates, about the polling that we did with our certified staff after trustees approved the reopening models on July 7th. The goal for this data gathering was to better understand employee needs and plans as we approach the reopening of schools. To provide a little bit of context, you may be wondering why we only focused on certified staff to begin with, and there were really two primary reasons for that. First, we anticipated that the process of identifying educators for distance learning positions would be somewhat complex, and we're faced with very abbreviated timelines. So we wanted to try and get a jump on that as soon as possible. That said, we also knew that we couldn't do this step and ask employees to provide information on their return to work plans without reopening plans being determined and approved. So this wasn't something at this level that could necessarily be done earlier. And second, there really isn't a playbook for this type of data gathering or decision making. And so we worked hard to design a questionnaire that would provide the information that we needed, but also provide employees some assurances about providing sensitive personal information in this way. Based on the questions, comments, and concerns that employees had during this process, we learned a lot about what worked and what didn't in this data gathering, and we feel prepared to use those lessons as we move forward in understanding the needs of our other employee groups as well. As we designed the questionnaire, we contemplated the various scenarios that employees may be facing and tried to create a balance between choices broad enough to apply to a variety of circumstances, but narrow enough to provide for effective data gathering. As you can see from the way that we've bucketed the results, there were 5 kind of broad categories. I'm planning to return. I personally may be high risk and may need some accommodations, which could include distance learning as an accommodation. I have high risk concerns about others in my care. High risk doesn't necessarily apply to my situation, but I'm concerned about exposure to the virus, and I do not plan to return. Within the high risk categories, we got a little bit more granular to better understand who could work on site with some type of accommodation versus those who felt like they could only return if distance learning was available. As you can see, there are a substantial number of people who have high-risk concerns and may need some form of accommodation. So our next steps in this process, which will likely begin tomorrow, and some of these things are already underway, is to marry this data with student response data in order to determine what the need for distance learning educators is. In all of our personnel decision making, obviously student needs and demand drive our personnel decision making. Then we need to dive a little bit further into this data to better understand the accommodations that may be necessary outside of distance learning positions, and to understand how we might support employees in being able to return to work on site if there aren't opportunities for distance learning available. And then finally, to follow up with our other employee groups, as I mentioned before. And with that, I'd be happy to pause and answer any questions that you might have about the data at this point.
Dr. McNeil.
There we go. Sorry about that. Emily, and I know you just said it, but we've received a public comment as far as employees, other employee groups taking the survey. Can you once again, just for the record, talk about other employee groups having the ability to take surveys to answer their concerns?
Absolutely. So like I said, we started with certified first just because of the complexity that we knew we would have in matching to distance learning positions. We've learned a lot of lessons from this particular data gathering process. And so we will be reaching out to our other employee groups as a part of our next steps to gather that feedback. Obviously, the questions will be a little bit different because when we think about ESP employees, for example, there may not be distance learning opportunities for all of our employees. So the options that they can expect to see on a questionnaire of this sort will vary by the employee group that we're reaching out to, but we absolutely need to understand what the needs and potential supports are for all of our employees.
Thank you very much. I appreciate that.
Absolutely.
Trustee Calvert.
Emily, could you explain the first one? Would that be for the distance learning and for the other module, or could you just explain that a little bit more, please?
Yeah, the I plan to return option.
Yes, please. The first. Okay.
Yeah, that's the option that an employee could utilize to indicate that they plan to return without any need for additional accommodation or a distance learning position. So those are folks who are ready to return kind of as the plan is approved.
All right, any other questions for Emily Ellison? Thank you so much. We will move on. I believe Mr. Turner is up next. Oh, I'm sorry, I apologize. Maybe I moved too fast. Trustee Minetto? Nope.
So, sorry, I couldn't get to my button fast enough. So you probably said this. The survey probably went out to the whole certified staff, right?
It did.
Yes, and this was our response.
Yeah, so about 75% of our certified workforce responded.
Right, and the survey is just, preliminary, but when do we find out the numbers for real? You know what I'm saying? The concrete numbers.
So the concrete numbers in terms of the number of distance learning positions that we'll need?
Of kind of the big picture of the whole thing, because we're going to need so many in the classroom and so many in school district learning and so many in, because time is, daylight's burning.
You are correct. That's certainly something that weighs heavy on my mind. Luckily, I have an amazing staff. And so our plan at this point is to triage these responses and then reach out with information to the roughly 1,000 employees that did not respond about how to go about completing this process. But that follow-up that I touched on, that additional outreach, really that is our opportunity to drive further into the details and to understand at the employee level what's necessary. Because as you might imagine, there is probably a spectrum of perspectives represented in this data. So there could be everyone from, you know, I have high blood pressure, but if you make sure that I have PPE and cleaning products in my room, then I'm comfortable returning, all the way up to I don't plan to step foot outside my home until a vaccine is developed, right? And a lot of territory in between. So that follow-up will help us to know what kind of further buckets to divide our workforce into, so that then we can begin to make some decisions. And I mentioned a moment ago that we're marrying this data up with student data to try and project what our need is, so that we know we need X number of distance learning teachers at the elementary, and then by content area. And then of course, electives added another layer of complexity to that. So there's a lot of things happening in parallel. And the bulk of my staff will be supporting this follow-up effort, because you're right, it is a very, very large task.
Thank you.
All right, now I think we can turn it over to Mr. Turner.
Okay, thank you. Thank you, President Raymond and the board and Superintendent McNeil. I'm Chris Turner, Chief Information Officer, and I'm here to talk about the student devices update. On July 16th, after board approval, we ordered 2,390 HP ProBook X360s at a total cost of $860,400. We were just informed last Friday by our distribution vendor, CDWG, that the shipping date is September 30th and the delivery date is October 9th. We also had a subsequent order go out on July 24th after board approval of 1,710 of the same devices at a total cost of $600. And as of this afternoon at 2:45 p.m., we still do not have a shipping date quote for those devices. So we're waiting until the beginning of October for just a little over half of the devices that we've requested. But in the interim, we're trying to streamline as many of our processes as possible. We've developed a new onboarding process for our student laptops that will be arriving, where they will be quickly asset tagged when they're delivered and then immediately shipped out to the schools. We will no longer be imaging student laptops. The laptops will be distributed straight to the students. The students will log in, and then we'll push the applications directly to the machine. That saves us a significant amount of time and effort on the department's behalf, and also on it saves considerable time and gets the devices in the students' hands as soon as possible. I've also been in contact with the Nevada Department of Education for their insight and perhaps any potential access to what we know as 7,000 additional Windows devices that we need for our students. And we're looking to supplement our hotspot order with 3,000 additional hotspots. But they are informing us that they have the same information that we do. The entire country is trying to pivot to be responsive to online learning, and the entire country is suffering at the supply shortage of Intel processors. And so everybody's being quoted several months out. In fact, I heard anecdotally that Dell is quoting 2021, January and February of next year. So that's unfortunate for supply and demand purposes. Locally, though, our plan has been, in the interim, we are collaborating with school principals on the distribution of the existing inventory that each school has, all the student devices that are already in schools. So we're coordinating that effort with our user services division and Laurel Inuma. We're advocating that these devices be distributed using our established criteria, which prioritizes the neediest families. And the principals know best who our neediest families are, so we're relying on their insight for that. And we're also in the process of distributing those student devices. We're also distributing recommendation documents that discuss the cleaning and care of the student devices, and also a parent-student agreement on how to care for, the borrower's agreement, as sort of stated. Next slide, please. Thank you. Technology connectivity updates. So the big picture is we recognize the importance of connectivity as just as high as the device need. And we recognize that not every household not only doesn't have a device, but may also not have broadband internet connection. So we're prioritizing, it's sort of co-equal prioritization between devices and connectivity. So let me begin by saying that we've been asked to contribute to the our Washoe County view on broadband access to the state of Nevada and participate in their statewide expanding broadband access committee. So that's being formed as we speak. Additionally, we were invited to contribute to Senator Cortez Masto's Innovation State Initiative. She's very active in bringing broadband to the country, notably to Nevada, because of our large, significant rural areas that aren't covered by broadband connectivity. And so, and that initiative, Senator Cortez Masto's initiative on broadband, is especially important now that we're finding in this pandemic period. So specific to the smart bus units, we're working with our GIS analyst, Brett Rodella, to align the Title I schools, the neediest schools, with the best mobile coverage. We're overlaying maps to find out which neighborhoods are best served by these bus units and by our student population. And we're also collaborating with Transportation Director Rick Martin, and we appreciate both of their efforts on this behalf. We're prioritizing, like I said, both our neediest and highest need and most densely populated areas. For example, Sun Valley and the Nixon regions. And we'll be publishing, to support this effort, we'll be publishing a weekly schedule for when those smart bus units will be parked in their rotating locations, their rotating weekly locations, to ensure that our families are informed of when the access to the local Wi-Fi will be available to them. Moving on to the mobile hotspots, thankfully, we've already taken delivery of all 3,000 T-Mobile devices, and they are awaiting distribution. We're going to match the distribution criteria of the mobile hotspots with our computer plan, which again prioritizes areas of the most critical need. So our English language newcomers, our refugee students, gifted and talented, special education students, students in foster care, those are the populations that we're prioritizing. We're working with principals to prioritize those populations to get both the mobile hotspots and the computers. Also, please understand that these T-Mobile devices, the hotspots, come to us Children's Internet Protection Act compliant. It's very important to us that they're internet content filtered. So we're compliant with, we're SEPA compliant with federal mandates. Both the mobile hotspots and the smart bus units are internet content filtered. So we want to emphasize that we're exploring all creative options in seeking a solution to our technology deficit, both computers and connectivity. And that includes, we continue to solicit and receive donated items and services. And we're also creatively looking at other ideas that involve our facilities. And that's my piece.
Well, thank you very much. I don't see any hands. I think we're good to move on.
Okay, I'll take this one. My name is Adam Searcy, for the record. I'm the Chief Facilities Management Officer for the school district. Thank you. So this slide is just intended to reinforce and convey our multi-layered approach to health and safety within our facilities. These primary layers include, of course, face coverings, hand hygiene, social distancing, as well as other measures that we've discussed extensively and have been firmly identified in our plans for months now. Our orders have been placed and our supply chains have really been opening up, fortunately. Our team began widespread distribution of PPE elements to our schools, such as hand sanitizer and disinfectant, for every single classroom just last week. And to date, we have completed distribution to all elementary schools and anticipate distribution to middle schools and all high schools to be completed before the end of next week. So as we continue to navigate these unprecedented developments and new information and solutions are found daily, I wanted to take this opportunity to clarify some information around the HVAC systems in particular within our schools. We are continuing, we've discussed this previously, we are continuing to proceed with increased fresh air intake actions into our schools. But I have confirmed in detail that the HVAC systems in all of our portables and our permanent classrooms are that they currently meet or exceed the requirements of the American Society of Heating, Refrigeration, and Air Conditioning Engineers, or ASHRAE, the threshold of 6 air changes per hour, as it's termed, at a minimum of 20% outdoor air ratio. So this is actually a very similar level of air changes per hour as is required in hospital patient rooms. And at this fraction of 20% outdoor air within each air change, this equates to a complete replacement of all air within every classroom in every school with fresh outside air at least once per hour. These are the existing conditions within our schools. We're actually enhancing that with minor adjustments as we go forward, but this is an important detail that I really wanted to impress upon the public and reassure everyone on this point. But moving on, I also wanted to sort of reiterate what Deputy Superintendent Beiersdorf graciously emphasized earlier on, that we've been moving into the sites diligently and working with the principals. It's one thing to distribute thousands of bottles of hand sanitizer, but now we're really trying to roll up our sleeves, meet with the principals, help them troubleshoot individual questions and unique challenges within widely different building layouts. And this is, of course, a highly collaborative, multidisciplinary effort across academics, facilities, nutrition services, and of course, the principals in these buildings who know their operations best, to share information and solutions as we all work through what this is exactly going to look like in detail. So overall, this multi-layered approach to health and safety has not changed significantly over the past several times that we've discussed it, but continuously adapting to the details and changing information and moving forward now successfully in implementation and preparation for safe and healthy reopening. So those are my remarks and updates. I'd certainly welcome any questions or discussions, or I believe hand it off to Margaret Allen, Director of Student Health Services. Thank you.
Thank you, Adam. We do have a few questions for you. I will start with Trustee Kelly and then Vice President Taylor.
Thank you, Madam President. And Adam, thank you for the presentation. It's good to see some of these personal protective equipment and other things that you've got going on. I had 2 quick questions specific to the ventilation, which I think for a lot of people, that might be the first time that they've heard that we have such good ventilation systems. My 2 questions are, first off, does weather affect the ability of these machines to circulate the air? So for instance, if it's 95 degrees outside, or if it's in the 40s and snowing like that, does that have any bearing on what these machines can do? And then the second question I have is, like you said that you're already starting to retool this equipment to make it work a little bit harder to maybe circulate the air, not just every hour, perhaps every 50 minutes or 45 minutes. And as we all know, when you run equipment a little bit harder, then it's more likely to at some point break down. So are you going to have maybe some additional of these machines, these ventilators on hand, so that if something your team can quickly switch it out so that school doesn't have less ventilation for a couple days. Like it can happen a lot quicker than that.
Sure. No, I appreciate the question. The requirement, this, as I described, this was pretty far in the weeds with our ventilation systems that we've gone, and we've consulted with a number of consultants, mechanical engineers, to really ensure that we're making accurate statements to the public on this. And you know, the bottom line is that all of our buildings are in compliance with this code required continuous circulation. So different from our homes, where if your thermostat is set at 72 degrees and it happens to be 72 degrees outside, it may cease to circulate, you know, unless you have it set to a, you know, continuous fan setting, something like that. The continuous fan setting is more analogous to the environment in our schools. So whether it's 90 degrees outside or 15 degrees outside, our systems are set up by code requirements to circulate air at a rate equivalent to 6 air changes per hour. Now, if the outside temperature is 70 degrees, the boiler or chiller needs to work less hard than if it's cold outside or hot outside, but nevertheless, fresh air is being taken in and circulated throughout our building continuously throughout the day, regardless of the outdoor ambient temperature. Now, to your second point, as I said, if it's hot outside or cold outside, certainly those pieces of equipment will have to cool or heat that continuous influx of outside air appropriately and may have to work harder. That was another point that we worked very closely with our consulting partners, mechanical engineers, and other teams, both internal and external, who work on our systems, to basically ensure that we did not overtax our equipment. Whether we're opening the dampers, the fresh air intake modulators, to 30% or 50%, something along those lines, that was a detailed conversation. And, you know, as opposed to many other supply chains, these are not supply chains that we have seen impacts from the pandemic on. So while we don't have a stockpile anticipating failures, we have considered overtaxing of our equipment and believe we would be able to, you know, make any repairs necessary in a timely manner. I hope that helps.
Okay, Vice President Taylor.
Thank you, Madam President. And Adam, thank you for just being so thorough and jumping in and really helping with this. This is, you know, I mean, to me, this whole thing is primarily, certainly not solely, but primarily about medical health. But we know there are a lot of other components that are involved with this. You know, speaking as one person, the medical health is the barrier for me. I would like nothing better than for everyone to be able to go back to school as quote unquote normal, but they have to be able to do so safely. So this slide may be one of the most important ones I've seen in this presentation. No offense to anybody else, but so let me just dig a little bit and ask a few questions. Just some of this may be review, but I think it's important for the public to know, and I need to be reminded as I really consider, am I comfortable, or what level am I comfortable with? Now, will there be, I know you said there's going to be, there'll be sanitizer in every room. I know there'll be teachers will be disinfecting throughout the day. You may not know this, maybe Deputy Soup, Beiersdorf, or someone may need to jump in. Is that scheduled time, like scheduled hand washing, scheduled time for teachers to disinfect? We've gotten some questions on that as well. Is that just as they think necessary, or is that something they're being really, there's kind of a schedule that we're expecting our teachers to follow, whether they're hybrid or whether they're, you know, in the elementary school and they're going to school every day? If those things are, I mean, what would that kind of walk me through? What does that look like?
You know, if I could just say my piece on that from operations, our primary objective has been to make these resources available as ubiquitously as possible in every classroom, in every hallway, make it readily available, whether it's soap and hand washing or hand sanitizer, make that disinfectant product available for use by any adult who has the time and ability to do so. From our custodial standpoint, we will be reprioritizing some of our standard custodial activities, such as vacuum cleaning or even outdoor grounds maintenance, to juggle our staff throughout the day and create an increased frequency of disinfecting on the part of custodial staff. To your point, additional high-touch disinfecting on the part of other adult student staff or supervised scheduled hand washing is really going to have to be a site-based scheduled activity, along with all of the other daily activities they have to schedule. So I can't speak to that part, but we're well on our way to make those resources available for everybody in the school.
Okay, I appreciate that, Adam. And so perhaps maybe someone else can speak to that a little bit, or will the schools get receive some direction or some kind of suggested schedule for what would be appropriate or what it would take, so that there's a level or standard of a cleanliness that we're looking for? Just trying to find the place to land in terms of what does that look like? And I've been asked, and my response has been, I know teachers are going to disinfect throughout the day, but I don't know what that looks like. And I've been asked, and I can't go further than that. So is there anyone, maybe Dr. McNeil, that you may ask to respond to this, so we'll know what that looks like?
Yeah, and I know the area superintendents, Dr. Taylor, they're going to be getting into what a typical day is going to look like. It's going to look very different within an elementary versus a middle or high school. And depending if the students are going to be moving or the teachers are going to be moving, it's going to be looking a little bit different. So if you're okay,
I can wait until then. Yeah, I can wait until we look at this typical day. I'm sorry. Yeah, I got ahead of myself. I knew that was coming. Sorry, but we started talking about the PPE, So thank you, Dr. McNeil, and thank you, Adam. Let's see, I have another question. Just on cleaning supplies, and this may also go to what a teacher may do in there. This may also go to what happens on the day-to-day. If you're a teacher in a classroom and you feel like you need more, so let's say, for an example, pumping of sanitizer, and I really think I need 2 in this class. Is there a mechanism so if a teacher can say, look, you know what, I think I need more, and I know you've done the great work of getting the supplies. Is that allowable basically for a teacher? Hey, look, I need some more stuff, that we'll be able to help them out. And do we have do we have the inventory to do something like that if needed?
So we're going to be managing all of these items, specifically, like in your example, hand sanitizer, but also definitely the disinfectant product through our custodians. So it's an additional responsibility that we're placing on them, but to help manage those resources, they'll be placing orders similar to how they order hand soap or toilet paper, things like that, in normal times. As I mentioned, we have seen very healthy supply chains, particularly on these products. So I am optimistic that we will be able to meet whatever the demand results in. That said, we've had to make assumptions around consumption rates. We don't know exactly how many students will return to the classrooms, and we don't really know how quickly a 16-ounce bottle of hand sanitizer will be consumed within a classroom. I know what we assumed, but I know we will have to adapt to realities. If they are slower to be consumed than anticipated, the stuff doesn't spoil, that's fine. If we find that we need it more faster than we have inventory beyond our initial distribution, and we have a healthy supply chain, we'll be able to respond very swiftly. So that timely feedback from the sites will be critical. I think Trustee Kelly had a comment along those lines previously. How do we get that sort of customer feedback? That's going to be very important, that flow back to facilities and operations, and make sure, we're able to respond to any and all needs that we see in the schools as quickly as we start to receive the info.
I appreciate that, Adam, because regardless of when there's some in-person teaching that resumes, whether it's now, whether it's 6 months from now, there's still going to be we're still going to have to take safety measures and precautions, and these needs are still going to be there regardless of when it is. And so I think this is just important information to know that, you know, as we figure it out, because like you said, we've never been here before, there's no playbook, I think Emily said earlier, but as we figure it out, they will be able to get the PPE that they need. I think that's an important factor whenever somebody, you know, walks back into the classroom. So thank you so much. And thank you, Madam President.
Thank you, Vice President Taylor. Trustee Mineta.
Thank you, Madam President. Now, I'm hearing you say that adults only are the ones who can clean the surfaces. Is that correct?
That's right. I'm very deliberately phrasing it that way. This is a very safe disinfectant product, one that is highly diluted. It has been used in our classrooms for multiple years. It's been re-reviewed in detail by the health district in this context, in this light, and approved for use in this manner. It is not necessary to use even gloves while you use this disinfectant. Just wet a paper towel and wipe down the surfaces and allow it to air dry, and it will comprehensively disinfect the surface. However, just really as a standard matter of practice, we are discouraging any teachers at any levels from asking their students to aid in that. It's just really something that we don't feel is appropriate, despite the safety that I just articulated about the product. It is a chemical. The custodians will be managing it and distributing it exclusively to teachers for their use. And we will be offering, albeit brief, but similar to as I just described, basically training to the teachers on do's and don'ts. And one of the don'ts is please don't ask your students to handle the disinfectant at all. Thank you.
Yeah, I think that's a good idea. Now, I have another interesting question. I like your little pictures of self-screening and physical distance and wearing the mask and cleaning our hands. Are we going to have little signs that show and say that stuff?
Love the question. Yes, we absolutely are. The communications department has developed a whole suite of different posters, and we are strongly encouraging all of our schools to use them in as many locations as possible. We feel like it is a very powerful element of how we are going to teach our students and staff to change their behaviors and do it in a positive way that doesn't feel alarming or disruptive, but just, hi, welcome to our school. We wear masks and observe social distancing at all times. So absolutely, that's a huge part of our multi-layered safety and health response. And I appreciate you asking that.
And just on the sign for clean hands, I think just washing your hands well is too, now I'm nitpicking, it's too general, because some people go, and then, so maybe sing happy birthday, sing, that's
this
the
is
kind of
the
thing.
Reader's Digest version of some of these signs. There is a full one-page sign on wash your hands, and it's going to be on the bathroom wall next to every sink. There's a one-page sign for all sorts of different things available online for all of our teachers to just print off and paste around their schools.
That's wonderful. Thank you.
Melina?
Yep, go ahead, Trustee Calvert.
Hi, Adam, and thank you. What happens if you have a student that is not able to use your soap? Say they're allergic to it. Would you allow them to just use sanitizer, or how would that work?
Yeah, great question. As with really any sort of sensitivities or allergic conditions, we'll work through an accommodation through the school and health services to provide an alternative product, whether it is a hand sanitizer or an alternative soap. There's typically solutions, and we're prepared to adapt to that as needed.
Thank you.
Sorry, I'm on mute. I do have a couple of questions as well. I'll start with the clean surfaces. So I just want to make sure I really understand this, that the plan is for the teacher to clean the high touch surfaces in their classroom throughout the day.
Well, again, the approach that facilities has taken is to make the tools available in the classroom. We also will be disinfecting the high touch surfaces at least once a day throughout the school, in the classrooms, in the common areas with the custodial staff. So again, leaving it up to the principals and the individual teachers, if they have time throughout the day to wipe down the desks, go beyond that with other high touch surfaces, the tools will be available to them. But that's getting outside of my lane a little bit.
Adam, maybe I could jump in here, President Raymond. So we are also, when our students are in our building and working with principals on their schedules, so whether it's elementary, middle, or high, going to do everything we can to mitigate movement of students around the school buildings to help with just some of these questions that are being asked. So we're working hard at that. It is going to look very different from an elementary school to a middle and to a high school. We know that, but that's part of what our area superintendents are working with principals. And then also too, and one of our area superintendents, maybe co-lead area superintendent Joe Ernst or co-lead area superintendent Lauren Ford may want to jump in here. But also plans that our principals are putting together for frequent reminders throughout the school day. So the signs that Adam talked about, most definitely, but for our little guys, our kindergartners, and that, teachers reminding, the principal may be coming over the PA, the public address system, to remind students as well about their face coverings, washing their hands, and things like that. Those plans are being built as well.
Okay, yeah. Oh, go ahead, Mr. Ernst.
Pardon me, Joe Ernst, area superintendent, for the record. As Mrs. Beiersdorf had mentioned there, I think when we look at these schedules that are being developed at the schools, once we get better ideas of what the day-to-day and moment-to-moment logistics will be in the school, then we'll be able to match that with the hand washing schedules so that we're really being considerate of the times that it's most in need, prior to lunch, upon entering the room, those types of things. And as Debbie said, it'll look different at each of the levels that we have.
Great. I think we've gotten a few emails in the past few weeks just with concerns from teachers about just if there was going to be some expectation that they be wiping everything down a certain amount of time each day, that consumes time that they would have typically been doing instruction or some other thing, a break. And so what I'm hearing you say is, as a parent, I have frequently provided the class with a tub of Clorox wipes at the beginning of the school year. And so what I'm hearing you say in this year, looking ahead, instead of looking to our families to contribute those tubs of Clorox wipes, the district is supplying every classroom with this disinfectant. It's not so much that we're having some specific checklist requirement of a certain number of times a day that the teacher is taking a break and wiping everything down. That's a question I'm asking.
Adam, you want to take that one first?
I mean, you're certainly accurate in the sense that the district will be providing an in-classroom disinfectant product that we have not previously. So to that example, what this precise expectation of teachers or accommodations therein will be is still a matter being developed at each of the levels, but the tools will be in place. Even if it's once per day, I think it continues to reduce the level of risk. I think it's always important for me to remind that, the hand hygiene and the face coverings are arguably more important levels of protection, that just touching the surface doesn't transmit the virus. You can wash your hands after you've touched the surface and still be protected. So, it's outside of my lane to describe exactly what will be expected of teachers, but the tools are available if the opportunity presents itself.
And certainly recognizing the need to try to make sure that we're keeping high touch areas clean and trying to sanitize as much as possible. And so again, as principals are developing their schedules, these same type of hygiene schedules will be put in alongside with the instructional schedules.
And I'll just add really quick, President Raymond, I mean, this is very similar to when, we've had schools in the past when we've had norovirus outbreaks, and there's additional protocols put into place actually in conjunction with the health district as far as what those protocols are. So more frequent cleaning. And so, I know we've received some emails from teachers as far as, now we're asking them to be custodians, and no. However, I will say that our custodians are highly professional. They are extremely brilliant at what they do. They jump into so many different types of situations and help our teachers out. And I know that's what Mr. Searcy and his team, have their expectations too. So I'll just say, on the record, obviously, this is in the midst of a pandemic, and we're working very, very hard to put all of the protections in place for our employees and our students as well. And just as we, have protocols within our office building, more frequent cleanings throughout the day in high touch areas.
Thank you. I appreciate you taking the time to provide clarity around that one. Okay, my next one is physically distance on the chart here. We also received a number of emails today and prior to today about what exactly that 6 foot distance, kind of what are we talking about here? And more specifically today, we received a few emails that I just would like some clarity around kind of the difference between, I guess, that distance, the 6 foot distance versus the capacity in the room. And we received some emails from teachers and families that have been told that they'll have the regular number of students in their classroom come whatever time we decide to go in person, that if they were supposed to have 25 kids, they're still going to have 25 kids. So can you help clarify the difference, I guess, between that 50% capacity and kind of what the 6 foot distancing? I think when we talked about this 2 weeks ago or on July 7th, my understanding was that the class sizes would be smaller just because of that physical distancing required to keep with that 6 feet area.
So there's a few different layers to this this aspect. So you mentioned the 50%. Right now, we are still governed by the state's emergency directive 22 that speaks to the safe reopening of schools. And right now, our room occupancy levels are limited to 50% of the fire code maximums. So the facilities department actually has gone through and measured the square footage of every single classroom in every single building and calculated as a ratio of persons per square foot the maximum number of persons that each of those spaces can hold given this current directive. And we've sent that out to all of the principals in all of our schools. Now that is a maximum number based on the total floor square footage, excluding only fixed cabinetry. So everybody knows there's not only desks, but other cabinets, bookshelves, and plenty of other stuff often in our classrooms. The average number of maximum student or person occupancy across really all levels, some classrooms are 800 square feet, some are 900, etc. The rough average is about 20 persons per space maximum. Now, we also calculated the areas of libraries and music rooms and multi-purpose rooms and other larger spaces. And some of those, can accommodate 25 and 30 people in this same, given these same constraints. So we've had conversations with principals and area superintendents about potentially moving some of that flexible furniture out of classrooms into other spaces that will be used in the buildings, such as cafeterias, in a different way to maximize the opportunity to spread out within a classroom while still making those bookshelves and whatnot available within the school. This current emergency directive also limits the maximum capacity in any space at a total of 50. Now that's where we're at today. These rules and best practices are evolving, but those are the constraints that we've calculated and are working within our classrooms. Now, in addition to just that alone, limiting the maximum population of any space, we're also requiring face coverings to be worn of all of the individuals in our buildings. So that does provide an additional layer of protection against the inevitable instance where students are walking amongst one another in a classroom, in a hallway, in a restroom for a short period of time, and perhaps 6 foot of distancing is not possible to achieve, but because we have face coverings on, we feel additionally reassured on their health and safety. Inside a classroom, we're working closely with the teachers to maximize the flexibility of their desks, their furniture. We're working through solutions around many schools that have tables rather than desks that don't allow for the same level of flexibility, and exploring different solutions there, whether it be temporary dividers or limiting the number of students that are sitting at the desks, or actually redistributing some of the furniture across our district to help maximize the time and the distance that we can achieve that social distancing. I apologize for the imprecise response to your question, but to be fair, there are almost an infinite number of classroom scenarios here, right? The kids are constantly moving. We know how many students are allowed to be in a space based on the size of the space. We're taking a wide range of measures to try to maximize their ability to socially distance while they're in that space, up to and including further limiting the total population of that classroom. If the maximum allowable population by square footage, say, is 20, but we lay out all the desks and feel that we can only put the desks exactly 6 feet apart and fit 16 students in that classroom, then that is honestly a puzzle that all the principals and facility staff and administrators are working together to try and solve, to create the safest environment we can in the classrooms and still accommodate the students that we need to accommodate in person.
All right, well, thank you very much for that. I would like to actually ask that the board now take a recess. We just received a new directive from the governor that does impact education. I want to make sure that we give time for all the trustees to read through that letter. We have also received quite a bit of public comment in the meantime. So if you finish reading the NDE letter, you can take a moment to read the public comment that's coming through. So it is 6:08, and I do think we probably need about 20 minutes to be sure that we can get through each of us reading through this new directive from the governor. And I believe that the superintendent has sent it to each of you. So we will reconvene in 20 minutes at 6:29. Thank you. Yeah, a few of us have rejoined. Thank you all for your patience. I will call the meeting back to order. And I would like to ask our superintendent to provide the board and the audience with a brief summary of the directive that the governor just issued this evening.
Absolutely. Thank you very much, President Raymer, members of the board. For the record, Kristen McNeil, superintendent. So we have uploaded the directive into board docs. We are in the process of placing the actual directive 028 from Governor Sisolak on our website. So our communications is doing that at this point in time. I'm going to read just a few of the components of the emergency directive by Governor Sisolak. It was in a communication by State Public Superintendent Joan Ebert, received at 6:04 p.m. today. Part of the directive adopts the American Association of Pediatricians and the Governor's Medical Advisory Team's recommendations of 3 feet of social distancing for pre-K through 8th students and on school buses. 6 feet remains in effect in high schools and for all adults. In addition to the face covering requirement in Directive 024, cloth face coverings are now mandatory for all kindergarten through grade 12 students and all school staff, except with a documented medical vulnerability and approval of the building leader. It puts into place a process for districts and schools to request a variance for health and safety protocols under certain conditions. It carry forwards aspects of distance education flexibility for from the 2019-20 school year, including paper correspondence. It ensures continued access to the Nevada Ready State pre-kindergarten programs through providing through early childhood education. Also, the Nevada Department of Education will be having a frequently asked questions document. And those will be forthcoming from the Nevada Department of Education. The directive also reiterates what I was referencing earlier around Directive 005 on essential employees for school districts, as school districts have employees who are essential. And that is in Directive 005, reiterated in Directive 028. So again, we will be posting the directive on our website so that the public can see the directive.
All right, thank you very much, Dr. McNeil. I think if the board is okay with it, we would move forward unless there are any really urgent pressing questions related to the directive. I think there are components of the directive that now are going to come into play with some of the future decisions, but if we can kind of go through those as they come if the board is all right. And I don't see any hands, so I will turn it back over. I think Adam Searcy, we were still with you, and now we're on face coverings.
Yeah, I believe Margaret Allen, Director of Student Health Services, was going to cover this slide. If she's ready to pop back on. If not, I can certainly work through this. There's a extensive amount of text on this slide. This has been a more active area of development with regards to our health and safety response since the July 7th meeting, where these face coverings were required of all building occupants by the school board. You know, I mean, speaking more so from my standpoint, we have ordered, received, and distributed a large number of cloth face coverings, both youth sizes and adult sizes at many of our schools. This slide now talks about possible medical or other exemptions regarding face shields that I believe is similarly echoed in the most recent emergency directive. So now our stance, or the board's stance, on these topics are further reinforced by the governor's directive. We are working closely with our academic administrators to better understand what types of activities and periods, such as recess, it may be appropriate or necessary to remove face coverings, and what the specific logistics around that might look like, right? I mean, if a child, young child, has a cloth face covering, are they going to be asked to remove it, place it on their desk while they go out to recess, put it in their backpack, carry it on their person, etc.? So not sure, Margaret, if you're ready to jump in. I'm doing a poor job likely of going through this. I was looking forward to saying good evening. President, let me turn off my phone because I had to try to connect with that. Good evening, President Raymond, Superintendent McNeil, and trustees. I lost connection there, I'm sorry, but thank you for having me, Margaret Allen, for the record, and Adam, you've done a great job. Yeah, I was just reading the governor's directive as well, and so there shouldn't be any change in this slide with face coverings. We had chosen to do the more restrictive face coverings with pre-K and older, and it seems like the governor just supported that with direction from the MAT. As Adam said, we do know that in controlled settings, we will have to allow for students to take off their face coverings, as well as teachers. It is important that we maintain that social distance, especially adult to students, as much as possible, and then limit the contact. The fourth bullet will change just because of the governor's directive in needing a medical note if a student is unable to wear a mask. But we have reviewed that closely and will follow the directives that the governor has just put into effect for pre-K, because previously it was 9 years and older. We have ordered face shields when a face shield is more appropriate, such as teaching a hearing impaired child, or for students who cannot wear a face covering. And so we do want to note, though, that each of these personal protective equipment do provide various types of protection. Any questions on this slide?
Thank you very much, Margaret and Adam, for pinch hitting there. I don't have a question, but I did want to just point out too, for me, one of the highlights of this new directive is section 4, number 2, which says parents, vendors, volunteers, visitors, and guests who are unable or unwilling to wear cloth face coverings under any circumstances or exemptions should not be allowed on school buses, in school buildings, or on school campuses. You know, this has been such a huge concern, I know, for all of us as trustees, but for the community as well. And how are we going to manage this? I think this direction from the governor clearly states the priority level for this, and it just is as exactly as it's stated here, that they are not allowed on school property. So I will turn it over now to Trustee Cottle and then Trustee Minetto.
Thank you, Madam President, and thank you, Margaret. I just have two questions for you that came in from constituents. The first one talks about the kind of mask that can be worn, specifically the mask that has the valve in it that doesn't stop some of the air that's breathed out. And there's some places, like the examples given with Delta, they're not allowing people to wear those masks. So do we have guidance for families on what masks are allowed and what masks are not allowed?
We do not. We want to discourage any N95 mask just because we cannot manage those from a OSHA standpoint. We want to encourage face coverings, anything, I've seen a lot of disposable ones. The issue with masks is they have to be, if they're cloth, they have to be washed. And if they're disposable, they have to be thrown away and not reused. So I have not seen any restriction on the type of face covering other than it has to be a face covering. I haven't seen any restriction on the valves from our team.
Okay, and then the second question came from a kindergarten teacher about what's guidance is being given to staff on how to make sure that masks are, when they're taken off, they're placed appropriately where they can be put right back on. So what guidance are we going to give to especially the elementary teachers and with the younger kids on making sure when they're putting masks, taking masks off, putting them on, storing them, that it's done appropriately? How are we going to help guide teachers on that?
We have an opportunity next week to meet with principals and to go over things like this, to answer questions. And certainly we'll be doing a lot of education around putting on a mask, taking it off, what is the appropriate mask etiquette. We'll have signs, as Adam alluded to earlier, that will help children and families to understand that. So hopefully next week when we're meeting with the principals, we can push that education out. Again, we did some extensive education to over 200 athletic directors and coaches, and that was very helpful to them when they were opening up for practice.
Perfect, thank you. So I know the concern is the young kids just won't understand it. And
yes,
teacher support will be much higher than at the older grades because the kids are more mature, can, well, hopefully follow the instructions a little bit better than maybe a young kid would be able to understand. So I appreciate any guidance that we can push out. The more guidance, I think, especially early on, the better. So thank you.
You're welcome. And we'll be also educating people in what to look for with, signs that children are struggling with, counseling and medical staff. What are we looking at? Are they having opportunity to take their masks off? And do they understand the reason? So we will make sure we push that education out.
Thank you, Trustee Cottle. Trustee Minetto.
Thank you, Madam President. So I don't know if this is for, and like you were saying, Margaret, that practice is everything. Practice, practice, practice of what to do with those masks and exactly where they go. And then they're there and then they're, this question might be more for Adam, because I just have to ask what happened. Will we have enough masks? And I know we can get things quickly now, and that's a good thing. There will be kids who knows what happened to their mask. And hopefully not a lot, especially after we train them. Or they swap masks by accident. And then it's, oh, I have his mask. So will we have quite a supply so that we can make sure everybody's got a mask all the time?
So not dissimilar from the hand sanitizer, soap, and disinfectant chemical, we have seen a relatively positive supply chain in face coverings department. We have approximately 100,000, approximately 50,000 face coverings in inventory at this moment, and anticipate another 50,000 being received next week. Our order is for sufficient quantities for every student and staff member at this point, in addition to what we're providing to our school buses, to ensure that if someone does show up or someone does lose or damage their face covering throughout the day, this is not accounting for any assumption of individuals providing their own face coverings, which I would like to believe at this point. This is, you know, a longstanding mandate in the state of Nevada. So we'll see, I think, a significant volume of self-provided face coverings. But as you mentioned, there will be loss and breakage throughout the day, and we're going to have all of those quantities distributed to our schools before we bring anybody back into them.
Okay, thank you very much.
Vice President Taylor.
Thank you, Madam President. My question, I just forgot it. It was gonna be a good one too. What was my question? I didn't write it down. Come back to me. Come back to me. I have to remember my question. Come back to me. Dang it. Dang it, dang it, dang it. Oh, I got it.
Okay. Go ahead, Vice President Taylor.
Okay, thank you, Madam President. It was surrounding gosh dang it, now I forgot it again. Okay, I'll wait till I know it and I'll write it down. Dang it. Hey, it's a long day already, and we're on page 19 of 69, so it might get worse. I'm sorry.
Trustee Simon Holland, and then Trustee Cottle, and hopefully by then Trustee Taylor, Vice President Taylor will remember.
Thank you, President Raymond. And I feel your pain, Dr. Taylor. I feel your pain. We had previously talked about exemptions for behavioral issues, and the directive that we're getting is specific to medical and mental health issues. Just wanted to see what the comment is on that, because I think there are kids that may not be able to keep a mask on, and it's not necessarily a health issue or a mental health issue, but more of a you know, an IEP or something. So I just wanted to throw that out there. Is that going to be part of our policy if we are in schools?
I believe we have to address those issues, and we'll work with individual families because there are a number of kids, for whatever reason, will not be able to wear a mask. And if they have a 504 or an IEP, that's an easy fix. But according to what I read in our break, you know, we do need to get a medical reason for, you know, them not allowing it. In those cases where a student may not be able to wear a face covering or a mask, the staff will be trained in taking precautions with those students. For example, if a student has to have procedures done on them, a urinary catheterization or a G-tube feeding, we have ordered full protective PPE for our staff who will be working with those children. And I do want to stress, we met with a group today, concerns about face masks, and we certainly understand it. We will keep a close eye on this in, you know, concert with the local health department to see if there's other issues, you know, that arise. We know going in, things are going to change, and it's going to be new for all of us. And we're going to have to work together to try and make this a positive experience, because we really don't have a choice. Those are our mandates that are meant to help us get kids back in school and being educated in a more appropriate way, if possible.
Well, I'm thinking it might be something, Dr. McNeil, that you can flag for Superintendent Ebert, that there are other reasons besides medical reasons that we want to be able to address.
Yeah, we absolutely can, Trustee Simon Holland. And I'll just say, when we're working with parents and we're working through especially design instruction and looking at IEPs and what the goals and objectives are, I mean, there's avenues for that as well. But something that I've, consistently stated is that I don't want this to become a management issue for our principals and our teachers. And, this was also part of the reason why I asked Chair Lucy to help us get the information out. And, working with families and making sure that we had, public service announcements. And, if we can get families to, get used to this now, it helps our schools out once we come back into session. And as I've been to the grocery store, and I've been very, very happy to see little ones with the face coverings, and the parents taking this very, very seriously as well.
And they do have an alternate route to education if they choose full distance learning for those reasons, which I think is good that we have that to offer.
Thank you. I think those are all great points. As Trustee Simon Holland pointed out, I think it is worth discussing with Superintendent Ebert, as the directive is stated now, and we can be more restrictive than the directive suggests, but we can't be less restrictive. And right now you do need a letter from a medical physician or such to get that exemption. So I think that is worth getting more information around. Trustee Cottle, and then Vice President Taylor. I hope she wrote it down.
I'll be quick.
No, I did, but if I may, Trustee Cobble, just because it's related to what was just said.
Go ahead.
I did write it down, but it's related. So I was a little before the game, but I just didn't remember. And my comment was, perhaps as decisions are made here tonight, and whenever it is that the students go back to in-person instruction, we know a mask is going to be involved based upon this. So maybe there are things that we can do in terms of putting out information, notifying parents that we want them to begin to practice with their kids now. We know, all of us, as you said, Dr. McNeil, you go in stores, you see little ones with masks, and they aren't ripping them off and throwing, because they're used to doing it. I have younger family members that are, my niece was 4 years old, and she was wearing her mask because, it's uncomfortable at first, but in their home, that's what they do. And so she knows whenever they go out, they have these little masks. They're so dang cute because they're so little, but she knows that's what they do. And kids are very resilient, and they can get used to it if they begin to practice it. So every opportunity, I don't know what opportunities we may have going forward in anticipation for, again, whenever in-person teaching happens, if students can be used to that a week or so, have it wear it around the house or whatever, if we can push that out through whatever our mechanisms are, and encourage our principals and teachers as they talk to parents, to encourage their parents to please practice this with their children. Because I'm with you. I don't believe they should be policing at school. That isn't, this whole situation is going to be difficult enough, whether it's in person, distance, or both, or whatever, that anything we can take off of their plates. And we know that this makes a difference. Thank you, Trustee Caldwell.
You're welcome, Dr. Taylor. Am I good, Madam President?
You are. Go ahead.
Okay. Thank you, and thank you, Margaret. Question around travel. What guidance are we going to give staff and families that if they were to travel over the weekend, for example, on returning to school? For example, I'm going to visit family in Phoenix, and the university gave me my protocol to return to a building. So what are we going to do in that instance if a teacher wants to travel on the weekend, which they would have every right to do? what guidance are we going to provide on returning the building depending on where they're going? How are we going to handle that?
So the CDC, as well as the local health district, has put out recommendations, some really important points that people need to consider prior to travel. If you're going to a hot spot, such as Arizona, you might need to self-isolate for 14 days. And so that is, you know, again, dependent on people telling us that they are traveling and doing the right thing by seeking out information on the CDC or the local health district's webpage about recommendations on self-exclusion for 14 days after travel.
Okay, so so are we gonna put guidance out to our staff just so they know what is recommended?
Yes, and we're getting those questions now, and Emily and I are working together to give people feedback on what the recommendations are.
Perfect. And my follow-up is probably more for the academic side. So Deputy Sue Beiersdorf or Dr. McNeil, families that choose to do that. And then they contact their principal that, you know, we went to so-and-so place and it was recommended that we keep our child home for the next week. Then the school would then move that student into the exclusion because, or is it different because they're choosing to do that versus being told by a doctor like you have to? So how is that going to work?
So Trustee Cottle, I can jump in there. I'm going to first of all ask Margaret to help with the exclusion language because I don't believe an exclusion would be in that example you used, but she's the expert. So I'm going to defer to her on that.
Yes, I think that, you know, if a family finds themselves in that situation, we would rather have them do temporary exclusion and distance learning than to come back into the school and then we potentially have a problem. So I believe that that is an appropriate use of, you know, distance learning when exclusion is directed.
Okay, so in that case, parents should just work with the principal and we will encourage them. Because I think the more we can encourage communication and flexibility, that is obviously going to be preferred than trying to make the rules so strict that then parents aren't going to be willing to maybe disclose they're traveling because they don't want their student to be impacted negatively academically.
Yeah, and again, Trustee Cottle, Deborah Beiersdorf, yes, that we would be working with the families. But it also, I mean, it's got to be clear guidance for our principals as well, so they know what to do too. We can't, we want to be as consistent, obviously, as we possibly can throughout this. So that's guidance that would need to go to the schools as well.
Yeah, I would definitely agree with that because the last thing we need is have parent A in South Reno talk to their friends in North Valleys and it turns out two schools are doing two completely different things and that's going to cause a lot of issue. We got to make sure we're consistent. Well, thank you.
You're welcome.
Sorry, on mute. I don't see any other questions, so I think we can move on to the next slide. Thank you.
Okay, this next one, well, let's go back to that previous one that was up before I went over it. I did, the next slide is actually a protocol that it's a flow chart that we'll use in schools to manage kids that come to the health clinic. I do want to make sure that everybody understands exclusions are based on CDC guidelines and Washoe County School District guidelines, and they may change. So for example, the governor may put out a restriction on travel and, you know, that's a little bit more strict than just a recommendation. It took me quite a while to get to this point, to the third bullet point, to try and simplify it for people. And Kevin alluded today that we are still working on exclusion protocol. What we're working on is more clear direction from the health district is when are we going to close a class? When are we going to close a school? When will we close a district? This exclusion The CDC just changed less than a week ago. So again, it's a fluid situation, but we're trying to keep up with the current recommendations. And exclusion criteria is based on symptoms. We will exclude if somebody has 2 or more symptoms and a fever of 100.4 or higher. The flow chart may say 104. That's an error, and that chart has been corrected, but it is 100.4 or higher. We will exclude for 10 days, 10 calendar days. They must also be symptom-free for 24 hours without the use of fever-reducing medication before they return to school or work. And they've reduced that from 72 hours to 24 hours. So that's an important change. And then temporary exclusion based on close contact. There is some guidance around close contact and what is considered a close contact. So there are times where it's hard to give just a pat answer to somebody. You have to dig a little bit deeper and find out what is the close contact. So if an employee or student comes into close direct contact with an individual known to be COVID positive, the employee and or student should temporarily be excluded for 14 days. If at any time that they develop symptoms, they need to seek testing for COVID-19. This is an interesting note that the CDC put on their website. It says that the 14 days of quarantine after exposure is based on the time it develops it takes to develop the illness. It's just like for pertussis, the 21-day incubation period. In this instance, it's 14 days. So it is possible for somebody that has been infected to leave isolation earlier than somebody who's been in close contact with a positive case. And for a lot of people, it's hard to get your hands around that. And then again, you have people with severe illness or underlying comorbidities. Their physician or the health district might say, you need to exclude longer. Somebody with a health condition may need to be excluded for up to 20 days, but those are cases that vary. There is a hotline noted here for the health district, but I do want to remind people that what Kevin said and what Heather alluded to today is they are really having a hard time with case contact tracing. And so what we've been dealing with at the district with people who will call and say, well, I was told I could come back, at 10 days, even though I was in contact with a positive case. What we're having to do is then call the health district, find out, more information, and healthcare providers could be giving them this information. We really need to make sure that we're all on the same page throughout the community when we're excluding people, because we definitely don't want somebody that has been in contact with a positive case back sooner than 14 days. Any questions?
Thank you, Margaret. I do see Vice President Taylor has a question.
And I remember it and everything, Margaret. This is my question. If someone has been exposed, just as you're talking about, and they're going to be on the, where they need to have the 14-day self-quarantine, if we were able to test those people, say if there's a teacher, student, whatever, or someone has gotten exposed at a family event over the weekend or whatever, if we're able to test them, we could minimize, right, that 14 days if the test comes back negative or positive. Take negative, obviously, is what we're looking for, we're hoping for. So if I were exposed and then I knew I were exposed, if I get tested and it takes, say, 48 hours, and as they catch up to demonstrate, hey, I'm not exposed, I might only be out of school or work 3 or 4 days. Am I right? I wouldn't have to stay the whole 14 days if I were tested.
It depends on, the health district for a period of time was doing non or asymptomatic people who, just wanted to be tested. We are referring them to the health district, and they take the survey on the hotline, and that survey will determine whether or not they will test them. And again, the health district is struggling to keep up with case contacts. So we would err on the side of saying be excluded, get tested, but then we need to see a release from the health district that says this
Right.
is your period of exclusion.
Okay, so in the event that someone were exposed, whenever this is, right? Then if we, hopefully the health district will, eventually they'll catch up and so on. So this is during whatever, this could be December, right? Because this virus is going to be around for a while. If that were to happen, and if we were able to get our teacher tested or that student tested in a shorter period of time, we could minimize that missed instruction time or that missed classroom time.
Again, it depends on whether or not, how long was the contact they were in, what was the contact, what did that look like? Was the person really sick? If a person's really sick, it could take a few days for you. Maybe you were exposed 4 days ago. It could take up to, that 14 days for you to develop symptoms. And so what they say is during that 14 days, if you get sick, then you need to contact the health district and your healthcare provider to look at, what is the next step. We're hoping that we can come up. We've seen several flow charts on exclusions, and they're rather difficult to follow. We're trying to find one that really would guide you in understanding what is a close contact. A close contact, as defined by the CDC and the health district, is being in close contact within 6 feet of somebody for over 15 minutes. It was 10, now it's 15. And what was that contact like? Were you, passing in the hall? So I tell people it's really important to use your protective equipment, your mask, maintain social distance. When you can't, minimize the time you spend with somebody. But the most important thing we can do is wear a mask, good hand hygiene, and social distance.
No, I hear you, Margaret. I guess what I'm saying is if it's a known exposure that meets whatever that criteria may be, if there was some way that we could get that person tested, then that could help to shorten that 14 days when they may be out of the classroom or whatever. But I know that's up to the health district and so on. So I get you. And if we can't get them tested, certainly we know they have to go to 14 days in the protocol that the health district has. So.
Well, and it's taking quite a while for us to get results back. In some of the private labs, it's taking up to 10 days. And so then we go back to following the guidelines if for asymptomatic exposure. If you don't have your results back, we'll, look at that flow chart.
I understand, Margaret. Thank you so much.
You're welcome.
Thank you, Margaret. And this just might be a good time to remind, I know we've hit on this a few times before, that so if a student has to go into quarantine, they would immediately if they were in person, they would immediately revert into distance learning. And I see our Deputy Superintendent Beiersdorf has joined us, so I want to make sure I get those details right. And then if our Chief HR Officer is out there waiting, maybe then she could address what happens for our employees when they have to go into quarantine with their leave.
So President Raymond, yes, you are correct. We would put them into distance learning. Toward the beginning of the presentation this afternoon, I had stated distance learning for two situations: a family that may choose that option or an option that's being used in the case of exclusions.
Thank you. And so then if a staff member has to go into quarantine, and let's say, what if it were to happen multiple times in a school year by chance?
Yeah, thank you for the question, President Raymond. For the record, Emily Ellison. Under the Families First Coronavirus Response Act, employees are provided with emergency paid sick leave for up to 80 hours. So that would be 2 full work weeks for most employees. For our employees who work less than full-time, that could potentially extend longer. And beyond that, employees have leave accruals that they're afforded under the terms of their collective bargaining agreements. And so once emergency sick leave was exhausted, employees would utilize their sick leave accruals unless any changes to the collective bargaining agreements are made through the collective bargaining process.
Thank you for those clarifications. Trustee Minetto.
Ms. Allen. Oh, thank you, President Raymond. Ms. Allen, if somebody is asymptomatic, do we know how they then can transmit it? I mean, they're not sneezing, they're not coughing. Do we even know how it's transmitted? Maybe that's my question.
Usually, just by spread, maybe they've coughed. Again, it's close contact. And that's why the recommendation is that we wear masks. When I wear a mask, I'm not wearing it for myself. I'm wearing it for you. And you're wearing your mask to protect me in case you have it. And so it's, it usually by droplet, there are other forms, but it's usually by droplet, not using a mask and not maintaining social distance. Large crowds together, not using PPE, they're seeing a lot of those outbreaks.
Okay, thank you.
You're welcome.
Okay, any other questions on this slide before we move on? Okay, go ahead.
The next slide is in one of your attachments. And like I said, that is just a process to lead us through. If a child presents to the clinic, this is what happens. We want them escorted to the clinic. We will do an assessment there. And one of the things that we're working on with principals and nurses when they come back, the nurses have already been working on this, is trying to separate children who typically come to the clinic for medication versus, or a blood sugar check versus I'm feeling sick today, I'm being sent to the clinic because, somebody's noticed I'm not feeling well. So we'll do an in-depth assessment and we are going to try and isolate those kids from kids, find 2 locations for a well clinic and a clinic that potentially needs to be cleaned out. We will make sure that there is protective equipment. If a child comes to the clinic not wearing a mask, before they come in, we'll provide that to them. And we will educate staff on what that process looks like. And this is just a quick referral for a principal who is trying to educate his staff on what the process is. If there's no more questions, I believe it is Deborah Beiersdorf that takes this next slide.
Thank you very much, Margaret.
You're welcome.
So President Raymond and trustees, we're doing a bit of a shift here to come back over to conversation about distance learning plans moving forward, but wanted to take you to kind of where we were at back in March. So the purpose of this table is to actually show a comparison between the spring of our previous school year when our buildings were closed down and what happened then, and then what our plans are for distance learning for the new school year. So if I take you back to one of the first announcements our governor made, about public education and the closing of schools that happened on March 15th. And for the majority of our schools, we were heading into a 2-week spring break, if you remember that. So a team of folks came together very, very quickly to plan curriculum materials for the initial closure. At that time, we did not know it would go until the end of the school year. So I think you may remember that. Those materials were able to be shared with our students and our families via our internet, through Microsoft Teams, through our website, and then also through transportation. You'll remember the delivery of thousands and thousands of packets that we did several times throughout the spring. And it most certainly was a crisis response to the situation that we found ourselves in. Our teachers were asked to do regular check-ins with students. And also, I'm just going to kind of go down the left chart and then come over to the right side to do the comparison there. No new learning. We made a decision early on that the fourth quarter in distance learning would focus on reinforcing skills and concepts that had been taught during the third quarter. And that was in part, if you remember, to just very valid concerns that so many of us had about equitable access to new learning. Some of our students may have access to that. Many of our students did not. So that was the approach that we took with our packets, and then also what was shared on our website and through Teams. So you'll see there paper and pencil and some virtual lessons, materials that were used, the worksheets, the paper packets. We had many families that we heard that preferred the paper lesson plans. Materials for students might have been easier for our families to engage with their children. And again, that next bullet there, we focused on a review of, and it was third quarter learning for the majority of our students. Daily requirements were a bit flexible. Not only were we as a school district and teachers and principals, all of us really figuring out what this was all about and what it would mean for our students, but our families and our school and our community was figuring things out as well. Perhaps parents who found themselves at home or were scrambling for childcare if they were still reporting to work, etc. So we knew that we needed to be very flexible because of the challenges that our families were facing and our own employees were facing as well. You might remember, and Dr. McNeil talked about this at the very beginning of this presentation, under the do no harm clause, is we did not grade the work. Kids were held harmless, grades would not go down, but there eventually was an opportunity for students to be able to raise their grade as they completed their distance learning work. Attendance was taken weekly, and we did not conduct any kind of summative, so end of the school year assessments or tests, or formative, more teacher-driven kinds of assessments. So that's what it looked like back March through the end of the 1920 school year. So going forward, and we are now going to shift in the presentation to dig deeper into distance learning for the upcoming school year and what it will look like. So the expectation for distance learning moving forward is that there are daily teacher-led instruction utilizing our district adopted curriculum at all levels K-12. Essential standards for learning, so new learning will be taught. You've heard earlier this evening about technology integrated, and then there also may be a need for some paper pencil activities that our area superintendents will talk about here shortly. Materials that will be used for distance learning include laptops. Dr. Turner talked about plans moving forward to distribute laptops to our families and our students who need them. Standards-based curriculum. We're actually quite fortunate, in particular at the elementary level, that materials or curriculum that we've currently adopted does have an online learning component, such as online textbook resources. Digital curriculum, you're going to hear more about our plans for delivery of that, and then textbooks as well. And you will be hearing, especially at the secondary level, plans for distributing materials, textbooks to our students. So again, focusing on new learning, grade level essential standards, Nevada academic content standards, using district pacing guides. We're fortunate that we have these in place right now. But we're also, and Dr. Parks will talk a little later from the Office of Academics about pacing guides. Pacing is maybe going to need it to look a little different. When you think about the day in the life of a school, and we've talked about hand washing breaks, and we've talked about movement of students, and we know lunch will look different. The day is going to look different. The school day is going to look different. That's kind of that next bullet there. You're going to see examples of daily schedules for students who are engaging in distance learning for the elementary, middle, and high school level. We will be grading student work and providing feedback. Attendance will be taken daily. And earlier on in the presentation, I talked about upgrades or changes to our Infinite Campus student management system to allow for this. And then finally, assessments. We don't quite yet know what end of the year assessments might look like heading into this school year. Excuse me. You'll remember last year the SBAC tests were canceled, and that we don't know that yet. But the important thing about assessments is not just to gauge what a student knows at the end of a unit or class or semester, but how they're doing along the way. So that's what we talk about when we say common standards-based assessments, and you'll be hearing more about those shortly. So I'm going to now introduce Ben. Ben Hayes is going to come back on and talk about some more survey data relating to distance learning back in the spring.
Hi, good evening again, Ben Hayes for the record. Oops, am I on? Yeah. So I'll go quickly on this. So knowing the dramatic shift we had last spring and knowing that there's going to be some opportunity for distance learning in the future, at least in some part, we did put a survey into the field in May last spring just to find out, beyond the obvious, what kind of strategies and what kind of things could help us going forward. What were the kids feeling? What were the families feeling? What was the staff feeling? And Jennifer Harris on our team led a lot of this work. So she's working on getting a report, an overall report for the detailed report posted up for the district overall this week, along with one report for every single school so that they can kind of use it specifically for their school community and how they can best approach, given some form of distance learning, how they best can approach that. But I'll just do a quick 2-slide overview on this and go forward from there into kind of the meat of what distance learning or in-person learning would look like. So you can see on the left, there's a little over 5,000 student responses, 2,300 staff responses, and close to 9,000 family responses. And again, it was over about a 3-week period, or no, a 2-week period. And just real quickly, key insights, and there's more detail that will be posted on the website. This is an important thing to us. When I said earlier, it was just a basic kind of form of, are you coming back or not? We did ask more questions on this, and I think it'll be helpful to our educators and our families. So quickly, some of the key insights. Many students did not feel prepared for going into the next level, grade level, and their parents luckily did feel more optimistic. I think it was roughly 39% of students felt a little less, only 39% felt very or quite prepared going into the next level, whereas 60% of their parents thought it would be fine, and the staff thought it would be better. So just something to pay attention to, give students some confidence going into next year. Families were, and you've all seen this, we've all seen it a lot, families were concerned about the impact of school closure on things like the students being understimulated, things like physical exercise, interacting with other kids and their teachers, and of course their mental well-being. So that's something that I know we've been planning and working through for months now, but that's an important thing. Teachers, and I'll go into a little bit more on this one in the next slide, but teachers were confident in their ability to provide rigorous distance learning and new learning, but they're more confident with advanced students and less so with students with more complex learning needs. So English learners, students who have individualized education plans, things like that. So, students that are kind of needing interventions, intuitively obvious, but it's something that we have been paying attention to in our planning and need to kind of put some resources and time into. And then finally, families felt like, it was all kind of again, like the previous slide said, kind of crisis response versus distance learning. there was more opportunity to engage with families with kind of the goal setting and the interaction when it comes to learning from home. So if we could go to the next slide, this one, and this is the last slide. And again, I'll give one more sales pitch for these reports, not sales pitch, evangelist for these reports, because there is some valuable information, I think, especially for our educators. But this is what I was getting at in one of the previous bullet points. We asked our teachers, how confident are you in providing rigorous instruction? So we know going forward, we want to provide new learning. Our educators want that, our families want that, our students want that, we want that. So how confident are we right now going into that? And you can see the overall, the left-hand bar, the overall percentage was about 30% either quite or extremely confident. And then that confidence went quite high in the academic, for academically advanced students. But then as you can see in the next few, the confidence dips quite a bit, and not at all in slightly confident areas go up quite a bit. So you've seen areas where we've started to address this, including offering more everyday instruction for vulnerable populations in secondary schools. A whole bunch of planning has gone into kind of how do we get more and more resources and, again, time and planning for these students going forward. But I know that it'll be a big part of the plans going forward and probably for the rest of this presentation. So unless there are any questions on this, I'll hand it over to either Dr. McNeil or Ms. Beiersdorf.
Thanks.
Oh, yeah. There you go.
Go ahead, Dr. McNeil. You got it.
Okay. All right. So what we're going to be doing now, trustees, is we're going to be going through each one of the models for elementary, middle, and high school and how that would look on a distance learning, a full distance learning plan. So this is very different than the parents that have the option. So the plans that you adopted on July 7th, we know that parents have the option of going into a distance learning plan. What we're going to go into right now are details on a full district's distance learning plan, what that would look like at the elementary level, what that would look like at the middle school level, what that would look like at the high school level. Each one of the area superintendents will take a specific level. I do want to say you're going to see a slide in here that will say, do you want to reaffirm your July 7th action, or do you want to do something different? We're going to go through, just as President Raymond had mentioned at the top of the presentation, we're going to go through the entire presentation and then allow you to come back and make any actions that you would want to do. So if you continue to ask questions throughout the presentation, but that's what we're going to be doing right now. Thank you.
Thank you, Dr. McNeil. Good evening, everyone. Madam President Raymond, Superintendent McNeil, Board of Trustees. Again, for the record, Joe Ernst, Area 3 Superintendent. Just to help provide a frame of reference, at the previous Board of Trustees meeting on July 7th, the recommended action is summarized on this slide regarding elementary school in-person learning model and/or the temporary use of distance learning when in an outbreak status. And I'd like to further solidify, even with the new directives this evening, that our elementary school in-person model adheres to all the phase 2 social distancing protocols based on classroom sizes, and certainly will meet the new mandates that we have received this evening. So with that, I would like to turn it over to Dr. Parks to discuss guiding principles and what distance learning will look like in our elementary schools.
Dr. Parks? Did he jump off?
Oh, sorry.
All right, very good. Oh, we lost our chief academic officer there for a second.
I was so excited I didn't unmute. All right, so thank you, Joe, and good evening, President Raymond and Board of Trustees, Superintendent McNeil. For the record, Chief Academic Officer Troy Parks. As Deputy Beiersdorf noted, the distance learning model that we will employ if we need to do so in the fall will be completely different than what we experienced in the spring, especially for our teachers and students. We've talked numerous times, and I know you've seen the feedback from the community about some of the things that we had to, in an emergency response, deploy. So regardless of the model, we will be providing standards-based instruction from our teachers. Within that curriculum, we will infuse social emotional learning. Social emotional learning will also be incorporated into their morning meetings. And we're going to have an element of digital citizenship for all of our students. And this will teach them how to appropriately utilize technology, as well as how to navigate the internet appropriately and utilize it. As you well know, our professional learning since March has all been virtual, but we will continue to provide ongoing learning in Microsoft Teams. And then, of course, regardless of the model that we find ourselves in during this year and even the years to come, we've made tremendous progress as a district in implementing the key tenets of a professional learning community. We've had many of our schools still continue the work even during the spring of defining what essential standards they have in reading, language, arts, and math. And it's imperative for us to continue that work to guarantee our community that we are focused on new standards, we're focused on rigorous learning, and we're going to assess that learning and address it when our students don't learn. Next slide, please.
Dr. Parks, if I could just catch you before you switch slides, Trustee Simon Holland has a question.
Thank you, Madam President, and thank you, Dr. Parks. And I don't know, we may want to go to the next slide and I'll ask my question, but I'm hearkening back to Mr. Turner, Dr. Turner's comments about the availability of devices understandably being delayed until potentially October, when we may not be able to have a device in every student's hands for several months. I know that at the elementary level, we may be less dependent on those devices, and we've prioritized that devices would go to high school and middle school kids first. But I did have an offline conversation with Chris Turner and with Dr. McNeil in response to the statement that we have devices in schools that are unassigned, the ones that are in laptop carts. How will we ensure that we're going to have equitable access? How do we deal with social emotional learning and the building of a student's relationships with other students if they're only accessing the learning through paper packets? I hope you'll be able to address that.
Yes, I can give you some of our initial conversations, and any of our area superintendents or Deputy Beiersdorf can chime in as well. We do anticipate the possibility that not every student would have a laptop, and we've had many conversations about how do you establish a relationship if you have a student that you've never met, and even virtually, you're not going to be able to meet them. So we have talked about many different things, such as phone calls, possibility of meeting afterwards. Joe or Lauren or Gina, do you have any of the other ideas that we've discussed as a possibility for accelerating those relationships and social emotional learning?
Yes, I do think that it does present a challenge to us, certainly. As Dr. Parks mentioned, reaching out over the telephone to those students is certainly one avenue. I think that schools will have to continue to be innovative in the practices, perhaps even using some of the professional development the week prior to school beginning to form that outreach. Again, getting a very finite understanding of what the students have at home, what are the best ways to communicate with the student and the families, and continue to look at all available resources at the school and then within the verticals. And those may be some ways that we can help address that situation.
Thank you. If nobody else wants to comment, I do understand it's a tremendous challenge for you all, and it certainly weighs on us heavily, and I know it weighs on you heavily, that students will have a differential experience of their learning if they don't have a laptop. And I know we're working really hard to get them all a laptop, but so is every other school district in America. So I just want to share that for the public that we do share that concern, and we are worried about it, and I know you all are worried about it too and working on it. Thank you, Madam President.
Thank you for that, Trustee Simon Holland. All right, so in this next slide, we're going to talk a little bit more about the distance learning at the elementary. Basically, our best practices for the in-person model, we want to do everything we can to recreate those in a distance learning model. So what you might have during the day is students collaborating and communicating with each other. And then you might have some independent time where they're working on their own, completing their assignments, and then it might flow right back into collaboration and communicating in small groups or in the large group. We anticipate about 5 hours per day. Again, trying to simulate what school would look like in an in-person model. Same as the in-person model, we expect our teachers, and we know they are capable of meeting the needs of all of their learners. So for our students receiving special education services, they will be designing specially designed instruction. Put simply, specially designed instruction is the methods that our teachers would employ to meet the goals in a student's individualized education plan. For our English language students, explicit language and academic vocabulary would be in the lessons. And for our GT population, we would also have specially designed instruction, a lot of open-ended problem-based learning. And as Deputy Beiersdorf emphasized, we're really going to emphasize common standards-based assessments. Again, these assessments are going to be based on the learning that occurred, based on our planning and pacing. And the idea is not to test our students, but to actually utilize these assessments of learning to provide extra reteaching or acceleration of the curriculum based on the results of the common-based assessments. And of course, ongoing feedback for our students and grading will be taking place. This will be crucial to academic growth. And now I'm going to turn it back over to Mr. Ernst.
Dr. Parks, real quick, I think Trustee Simon Holland has another question for you.
Thank you, Madam President. We've had a lot of feedback from parents and from teachers that we want to make sure that teachers have the opportunity to develop their own lesson plans. Is that the intention that you all have?
The very short answer is yes. In this circumstance, we feel like it's very important, as we've talked about all of the uncertainties, we feel it's very important for us to have a common planning and pacing of the curriculum, but we would want our teachers to be able to have the professional latitude to decide how they would deliver those lessons and meet those standards. So certainly, yes. And now I'm going to turn it over to Mr. Ernst.
Thank you.
Okay, thank you, Dr. Parks. Our next 4 slides, we're going to look at the expectations for administrators, staff, students, and families. So when we start to look at the responsibilities of an administrator with our distance learning, really what we know is that the ongoing parent communication, support, and guidance has been essential. Mr. Hayes talked earlier about survey data that went out. Our schools, for any of the families that have not been able to answer that survey, have been reaching out to all of the individual families to get an understanding of their preference. Certainly an important part of this discussion in a role that administrators play will be leading the master scheduling. Even at an elementary school level, that's a critical component, and it's really important to put that in place so as to make sure that we are getting to the instructional needs of all students. Those schedules could include real time, some synchronous learning, some virtual office hours, but designed by the teachers. Administrators will also work to support the development and the implementation of the PLC decision-making process as they are working through. Certainly in the new normal that we are operating, there will be continual learning on a daily basis. Administrators will work with their staffs to collect information from the lessons they're providing to continually make adjustments that are going to best meet the needs of our students and our families. It will be important that we monitor all of the students through an MTSS process and making sure that we are adequately and appropriately supporting students on IEPs, EL students, and students that may even be on 504s. It's going to be important as we are approaching this for the administrators who have already begun much of this work, but continue to identify staff to serve as a team of experts to help increase the instructional capacity and the support for all teachers on staff. You saw Mr. Hayes took us through some of the differences in terms of how we address various students within the school district and the desire to find better ways to serve students that may have some additional challenges with learning. And so administrators will put together teams to help support teachers in these efforts. That'll be a part of that professional learning prior to the start of the school year and then ongoing throughout the entirety of the school year. And then certainly as principals, they will observe instruction and provide feedback. Again, we're operating in a new normal. We're working to improve continuously. And in those efforts to improve continuously, dialogue will take place back and forth, as it will in the building, between teachers and administrators around instruction. So that speaks to administrator responsibility.
Thank you, Mr. Ernst. Trustee Minetto has a question for you.
Thank you, Madam President. I don't know if this is necessarily administrator, but many parents are working, which is good. And if children, are we in touch with the daycares as to if they're, I mean, 7 hours is a long time. Are we in touch with the daycares? I mean, when is this going to happen?
I think as a school, schools are preparing for that August 17th start date.
Yes.
And to that end, really trying to complete all of the communication towards the end of this week to really have a clear understanding of where families are, the needs that they have, and then be able to look at the models that are under consideration and be able to provide the model from the recommended action. So that's kind of an update on the timeline right now.
Okay, thank you. I am just naturally concerned as to when, you know, in a day this is going to happen, because parents come home, they get home at 6, they pick up their kids, they're not going to then keep their kid up for 7 more hours, you know, and then they can't interact with their teacher either. So, you know, then you wonder, is it going to happen at the daycares? It's,
so Trustee Minetto, maybe I could jump in a little bit to provide a little bit more information. Again, Deborah Beiersdorf. So I know that there is a bit of a groundswell in the community around daycare needs if we go full distance learning, and being able to provide, you know, supervision, safe supervision for our students. So I mean, that is definitely a community challenge. We also know too that even our best intentions of, as you saw on the previous slide, 5 hours of instruction every day, there may be, well, there will be situations where a student can't engage in a continuous 5 hour of instruction. You will see a schedule, a sample schedule here in just a few slides that Mr. Ernst will talk about. But we do also have capabilities in technology that we have in the district to provide asynchronous learning. So students being able to engage with teacher lessons, teacher-made videos, for example, other kinds of support, supplementary supports at a later time that might make more sense for a family. But we are super aware that it is going to look different for sure, based on situations with our families and with our students.
okay, thank you.
Vice President Taylor.
Thank you, Madam President. Excuse me. I just want to ask our staff, if you will, because we have so many parents watching, maybe even watching for the first time, if you'll just explain the acronyms as you go, you know, PLC, you know, those things. I mean, we you know, MTSS, those kind, that would be helpful, I think, for those watching that aren't really accustomed to those things for us. Thank you.
Thank you, Dr. Taylor. That's a good suggestion. I'll be mindful of that as we're moving through the next few slides as well, okay?
Thank you.
Yeah. So now moving to teacher responsibilities. We've heard Dr. Parks discussed a little bit around that, but certainly the instruction that's going to occur to students daily. Our teachers are going to participate in collaborative lesson planning. And that will be through their grade levels. And that will be in the structure of that PLC or that professional learning community, so as to use those online curriculum documents, but again, come up with the how they're going to teach to those standards. They will be providing standards-based instruction. They'll continue to arrange daily communication and follow our attendance processes. Our teachers will facilitate resources for students that have an individualized education plan and our English language learners. Our teachers will continue to provide contact with parents and guardians. In our distance learning that occurred in the springtime, we saw exceptional outreach as far as the percentage of families that we were able to communicate with on a weekly basis and support, and that will continue. Our teachers will attend and participate in all required parent and guardian meetings. And of course, Mrs. Allen talked a little bit about the exclusion policy. And so certainly teachers will have to be ready to provide emergency subplans and instructions, just as they traditionally are required. Okay, the next part will be the student responsibilities. So when we look at distance learning and student responsibilities, of course, we want our students to maintain positive attendance and course progress. We want our students to complete assignments and the tasks as assigned. We want to make sure that they are exhibiting good study habits. And to Trustee Minetto's point, with the various families and the schedules that they have, our teachers and schools will continue to work with students and families to help support that, to help build some of these good study habits that we know will lead to success within this model. Certainly, student responsibilities, we want to make sure that students are reaching out to their teachers when they require assistance. You'll see in the schedule a little bit later here some time where we'll be able to group students, small groups of students, to provide some additional intervention when they may be struggling with a concept. Student responsibilities also attend daily and weekly required real-time synchronous sessions or have those recorded sessions to access to help solidify their understanding. And then certainly participate in those proctored assessments. Dr. Parks talked about these are assessments for learning. And really, again, as we approach our new normal, it will be using these assessments to diagnose student understanding and then being able to make sure wherever misunderstanding occurs that they've built into the schedule the ability to reteach a particular concept or content. And finally, as we are going through looking at our parent and guardian responsibilities, we all know that ongoing proactive communication is really beneficial. And when we have our students, teachers, and parents communicating proactively and ongoing, that really supports our students' ability to learn. Certainly, we want our parents to be able to assist their child in learning and directly participate with the student, specifically in the early elementary grades. Providing support, guidance, and assistance, fostering, just simply providing, as we've had many learnings with our spring distance learning, beginning to reflect on that, and then what can we do to continually improve simply by providing a conducive area for learning at home where the students are able to concentrate more readily. We want parents to continue to encourage and recognize the positive gains and the achievements that our students are making and actively monitor. Typically, we have Infinite Campus, which helps keep our parents very tuned in to work completion that's occurring. This will continue to be a system that will be used, as well as that ongoing communication between teachers and parents to really just make sure that we're monitoring that learning as it is progressing. And wherever adjustments are needed to better support the students, those adjustments can then be made. So with that, if there are no questions around the responsibilities, I'll turn it back over to Dr. Parks.
And look, I unmuted myself this time so I can just start talking right away. So one of the elements of this distance learning that I do not anticipate being much different is the response from the many departments in the Washoe County School District. If you recall, every department really was proactive and supported our schools and was there to serve them throughout the spring distance learning and in the fall distance learning. And again, it would apply to any of the models we might be in. All of us in departments, we only exist to support and serve our schools. And we had talked last time on July 7 about in our schools, we want all hands on deck. And that goes the same for the district, all hands on deck. So our main focus in our elementary schools is going to be delivering English language arts, math, science, and social studies. We're very fortunate to have adopted Benchmark, which has lessons that are based in science and social studies as well. And of course, our elementary schools, if appropriate, as Joe mentioned, when they plan together and work together, we hope that they will add other pieces to the distance learning. It is going to be imperative with as much as we talked about the uncertainty of the pandemic, and some students are going to be on distance learning. Some students are hopefully going to be coming back. We might have hybrid. It is crucially important that throughout that we have a common pacing and planning of our curriculum, because we know we lost some learning in the spring, and going into the fall, we have to provide the certainty that the curriculum for a distance learning student is going to be as rigorous and same standards as the in-person model. Of course, the Office of Academics and all of our other departments will be providing support to our sites. Again, I want to reiterate that our students receiving special education, we will be meeting their IEPs through specially designed instruction. We will have teletherapy. Just to give you an idea, our physical therapist or speech therapist will be able to provide services over Teams and meet the needs of our students who have needs in those areas. And for our students who need a functional curriculum, this is our students receiving special education in the area of comprehensive life skills. Our teachers are able to utilize our adopted curriculum in meeting the needs of our most vulnerable students there as well. If there's no questions, next slide, please. So a tremendous amount of work has been going on in the curriculum and instruction area in 21st century learning. I'm going to go through some of the resources that are currently available, and keep in mind that these resources we currently have rights to. Microsoft 365, a lot of us have utilized Teams. We anticipate that our teachers will utilize Teams for virtual meetings. We also have OneNote. OneNote is going to provide our students the opportunity to turn in their work directly to the teacher without the other students seeing their work, and also an avenue for our teachers to provide the feedback in written form directly to the student. We will have, in a distance learning model, what we call a flipped classroom. In a flipped classroom, our teachers would prepare a video based on the standards-based instruction ahead of time. And at some point during the day, the students would view that video, and then they would come together in a virtual meeting and they would discuss the lesson and make sure that they clarified their learning and understood. We of course have our online learning components, that is the online curriculum. We're going to implement and have infused social emotional lessons. We also have Nearpod. Nearpod incorporates formative assessment and dynamic media for collaborative student experiences, such as a virtual field trip that they might be able to take, and then discuss the learning around the field trip. And then Clever, this is a secure sign-in access to any online resources that we have access to, applications, access to textbooks, files, website links. And then of course, we're not sure yet, but we probably are going to have some paper pencil options available as needed. And again, the synchronous and asynchronous with the teams, there's a function in there called stream where teachers can record and students can view at a later time. And with that, if there's any questions, or do we want to go to Mr. Ernst? All right.
All right, so this slide, what you can see is simply an example of a primary schedule and a lesson and a daily lesson. And as Dr. Parks mentioned, our online curriculum planning documents, along with using the district adopted materials, will really work towards providing our students with a guaranteed and viable curriculum. So when you start to look at a day, we certainly want some type of morning meeting to start the day in our elementary school. We want to get our kids excited. We want to check in with them. We want them to really kind of activate for the day. And so there is a nice time slot for that. You can see that we have materials around SEL, our Sanford in Harmony. We also have some digital citizenship lessons, but really a morning meeting to just kind of get the day started. And again, this is simply a sample lesson for, consideration and that teachers may use. You look at an ELA block and you can see that there's real explicit components to help teach literacy. You start with the phonics, spelling, and word study. You move into interactive read alouds. We saw that in our spring distance learning, interactive read alouds were really successful in a number of ways. Then there is a writing component and tying in the reading writing connection. And then you can see further independent practice or reading. Then there's time that will be built in so that we can, as we are diagnosing our students' understanding and learning, be able to provide small group interventions. We have tremendous materials to help with that, including our leveled literacy intervention kits and our Phonics First programs that will support those students that may have some additional needs with their learning. As you move into, say, an afternoon or later in the day, 75 minutes for math. Again, using our district adopted materials in elementary school, Bridges, Envision, and Go Math, all of which have some aspects of distance learning that is embedded in those resources that teachers have already begun using and are familiar with. As you move towards perhaps the end of the day, you can see that there's a variety of ways that teachers can go. As Troy mentioned, our benchmark ELA series, English Language Arts series, is really centered on some informational text specific to social studies and science in a lot of cases. So what you can see there is at the end of the day, that connection, connecting it back to literacy through science and exploration in that manner, and also the deepening of social studies. We have some terrific online curriculum planning guides related to social studies units and standards, all of which are accessible for the teachers. So you can see that kind of takes us through just to kind of a preliminary sample, just to kind of get our hands around what that day might look like. So that's a kinder through second, or a primary type of schedule that we would be looking at.
Thank you so much, Joe. And I know Vice President Taylor has a question. I'll go through mine, Vice President Taylor, if you don't mind, real quick.
Go ahead.
So for the elementary model, looking at, this kind of possible schedule, would there be an expectation from the district about how many hours of that day would be anticipated to be instruction on Zoom or whatever Teams with the student videoing with the teacher?
Yeah, as has been mentioned somewhat throughout, is really we want 5 hours in the elementary school around the teaching and learning. Again, that will be some combination of the direct instruction that would occur via Zoom or Microsoft Teams. That would also be direct instruction, small group intervention support, and then a combination of independent work that will occur away from the teacher as well. So that's kind of the expectation as far as looking at that.
And we heard from the health district that, that he did feel it was safe if we were to go with a model like this this time. I suppose that's safe for our teachers to be in the classroom. Has there been talk at your district level about what our expectation would be for teachers and where they would be doing this instruction? Would we be mandating that they are in the classroom, or just giving that as an option? What are your thoughts around the location?
Yeah, we heard Mr. Dick speak to some of the health components related to that. Certainly instructionally, we recognize the value of teachers having access to their rooms, being able to use supplies and resources that they're familiar with and that they're able to use to provide really rigorous learning. And so really the encouragement of working from our classrooms, we certainly would recognize the ability of administrators to help even better support the needs of teachers with that type of model. So I think we really look at the opportunity for teachers to access and teach from their classrooms.
Thank you. And one more question and a comment. I didn't see on here any sort of specials, or what are we thinking about, music or library or art?
Yes, we would definitely build those in. Schools would continue again as they're looking at their master instructional schedule. They would look at that. Sometimes we see that specials get coupled together, which then allows for maybe some additional collaboration time, but certainly specials will be incorporated within the schedule.
Great. And I think my last comment is we've acknowledged, I would say continuously in writing and in our meetings, that the 2020-21 school year will not be normal. And distance learning is not, what we're used to in this district to begin with. But I just want to, first of all, commend you all on this work to get, this in-depth kind of presentation prepared for the community, because I do think it is very, likely, if not, we haven't made any decisions yet about how to start the school year, but if it weren't to be started this way, that we would be looking at some form of distance learning possibly for the whole district or segments of the district. And I think you've done a great job of giving a better picture of what that's going to look like as the elementary school and middle and high school to come. But I have to say, from my perspective, this really is looking at this sort of the best case scenario. This is the student that has a device it has a quiet space, that has the internet connectivity, and that has an adult to sit with them and assist them with all of this, throughout the day. In my opinion, I have many friends, and my niece is a kindergartner, and just knowing, especially at that kinder and first grade level, the ability to get through this, agenda in a day requires an adult that is, I think, ready and able to help. And I understand that might just be sort of the situation we're looking at, but I just want to be clear that I really appreciate this. I think this is a great layout for a day, and I think it will work for some of our kids really well, but not all of our kids, to be able to navigate this type of a schedule. I think it is much easier for older kids, I would say. In my opinion, a 4th or 5th grader could probably navigate most of this relatively, on their own at home, if they have, again, all the quiet space, the internet, the device, all that. But I just have to put that out on the record. So, Vice President Taylor.
Thank you, Madam President. And I will say, first of all, that this is already, if we're in a distance learning model at any point, whether it's beginning or during different times or whatever, at any point during the year, at least this is, just in looking at this is much better, much more rigorous, right? Than we were able to get into before. I mean, we recognize that we woke up and we're in distance learning in the spring and couldn't plan. A bunch of the feedback we've received, I'm sure you've received it too, is that there was no rigor, there was not enough structure and all of that, in the format, right, that we had, and we didn't really have the kind of platform in place that you're talking about. So I really want to commend the staff for putting this in place. I mean, in an ideal situation, I'm like Trustee Simon Holland. I can't speak for all the trustees, but I think we can all agree that in an ideal situation, we all want to be back in the classroom for everybody all the time. We just may not be able to do that. And in the undesirable event that we're back in distance learning, and children at this young age, because I share the concerns as President Raymond, a young kid being able to really do this and navigate this themselves. But should we find ourselves back where we were and everybody's at home and so on, where this is at least a much better model. And if those families that have sent us, concerns about, I might want to keep my kid home, but that was atrocious or whatever, we all got it and we understand it. So first of all, I want to commend you for that. Secondly, I want to ask this now, you talked about, in the previous slide, you talked about Microsoft Teams and some of the other technology and so on. Do families need that themselves? I mean, Zoom, we know everybody can jump on. But if you're a family and maybe you don't have Microsoft Office or whatever, will they be able to be involved in that from a technology standpoint at any level, kinder, middle school, high school, whatever?
Thank you, Dr. Taylor. For the record, Troy Parks, Chief Academic Officer, and Dr. Turner, if I misrepresent anything here, please correct me. But it is my understanding that as a district, we are a Microsoft district, and therefore we have ownership of all the tools that come with Microsoft 365. Mm-hmm. So all of those tools that we mentioned, as far as Teams, OneNote, all those our students will have access to as well, in all of our computers that they would get from us. And it's also my understanding that if they had their own, they too can download all of the software that comes with Microsoft Office 365. And anything you want to add to that, Dr. Turner?
Yeah, you're completely correct, Dr. Parks. Thank you. Due to our Microsoft licensing model, our students and our faculty can all download Office 365 while they're either enrolled or employed here as part of their link to Washoe County Schools. So if it's their own device or if it's a district provided device, they have access to all the tools that we would have normally in in-person instruction.
Okay,
does
great.
that answer your question, Dr. Taylor?
It does, Dr. Turner. Thank you. And thank you, Dr. Parks. My next question is, so is this really what part of the additional week of training is for our teachers as they come back earlier? We can give them, because as you know, as you said, we weren't really prepared, to jump into the distance learning in the spring. Is this going to provide, is that extra week, is that's part of what this is about, is giving our teachers the training that they need to understand how to best use this and operationalize the plan that you put in place if any of them at any point, right, find themselves in a distance learning situation?
Yes, Dr. Taylor, absolutely. This is going to be a tremendous amount of our focus, especially if we're in full distance. We know we have to increase the confidence of our teachers to deliver rigorous instruction over a virtual format. And we do, later in the slides, we're going to go more in depth to what those 5 additional days would look like.
Okay, great. Thank you very much.
You are
Thank you,
welcome.
Madam President.
Thank you. Trustee Minetto.
Thank you. I think I just want to reiterate what President Raymond said, that this is great for, I mean, it's great. It's wonderful. And I love the rigor, because, and, it's going to be nice that nobody feels like they're floundering. My issue is, are the kindergartners going to be able to log in to do all this stuff? Even if they have parents at home, sometimes the parents are working from home, and sometimes their parents aren't interested in helping them. I just have to say that. I guess that's not even a question. Thank you.
And thank you, Trustee Minetto. Just a little bit of a response to that, very similar to how we teach our students at the beginning of the year to use various tools within the classroom, how to properly use base 10 blocks, how to properly use scissors, how to properly use these different tools. The teachers will also be doing that with this format, how to log in successfully, what it will take to, if you have a chat and you want to offer some input or these types of things. So they'll be teaching, trying to best use these tools to make sure that they're getting a good teaching and learning exchange.
Okay, I don't see any other hands up at this time.
Okay, well, with that, we're going to continue to move forward. I'd like to introduce my co-area lead superintendent, the amazing Mrs. Ford.
Thank you. JJ, can you go to the next slide? Thank you. Madam President, Superintendent McNeil, Board of Trustees, for the record, Lauren Ford Baxter, Area Superintendent. So this first slide is again to the recommendation that was given on August 7th for the middle school model, hybrid learning model with the AB rotation. It also talks about vulnerable population, students coming full-time in person, and then also about temporary use of a distance learning model in the event of a student or group of students is excluded, or if the school or district went into full shutdown due to an outbreak. So the next slide, we'll talk about what distance learning will look like at the middle school level. So all students must have equitable access to effective instruction and standards-based grade level learning. Daily standards-based instruction introducing new learning content must occur in a distance learning model. Opportunities to address social emotional learning, well-being, and improving digital citizenship. And as you are aware, some of the middle schools have advisory classes, which is a great opportunity for those lessons. Professional learning will continue for all staff. Professional learning communities are critical to support teachers and students in order to ensure equitable, effective teaching and learning. Go ahead, thank you. What does distance learning look like? Instruction will be supported by qualified, certified teachers at the middle school level. Master schedules have been built by principals and counselors to ensure what's best for students. Daily schedules are built for students based on a 5.5 hours daily. Structured and independent learning scheduled throughout the day for middle school learners. District approved curriculum tied to content standards will be utilized. Students will have access to devices and the internet. Meet the requirements of specialized learning for students on individualized education plans, English language learners, and gifted and talented students. District adopted common assessments will be used to monitor student progress, and feedback will be provided to students and work will be graded. Edgenuity. The Edgenuity program will be able to support the content area teacher. It provides easy transition back to brick and mortar. Teachers will be able to contact students virtually or by phone to discuss the progress and concerns. School sites will be able to determine which classes are offered through the program, and professional learning is available for all teachers. So all teachers will get an Edgenuity 101 course about the program. They'll learn how they can use specific lessons in the program to align with their curriculum and their lessons they're teaching students. Also, they'll learn some courses that students could take the full course of. The next slide. Now we're going to go into responsibilities for administrators, teachers, students, and families, just like we did for the elementary slide. So administrative responsibilities, we're going to provide initial and ongoing parent-guardian communication, support, and guidance. Like Joe stated, communication with parents is a key to success for middle school students. Lead the master scheduling while considering the instructional needs of all students. They'll include schedules for real-time synchronous sessions and virtual office hours by grade level and or content area subject. Support the development and implementation of professional learning communities, design decisions, making progress processes, monitor individualized education programs, our 504 accommodation plans, English language learners, and supports to ensure compliance and differentiated learning. Identify teachers and staff who serve as a team of expert users to increase the bandwidth of support for teachers. At the middle school and the middle school level, we have 21st century teachers that have participated and earned badges. We also have middle school administrators who've earned their 21st century badge, and they can be an expert group to support the teachers in their buildings. Administrators will observe instruction and provide feedback to licensed educators. Kristen, I noticed you unmuted. Did you want to add something?
No, I was just gonna, if this, and this is on me, because I said I wanted my team to go deep into the weeds about, what distance learning looks like. But I also know, I'm very cognizant of the hour and the decisions that lay ahead. So if the slides that are similar between elementary, middle, and high, if we can just briefly speak about them, but maybe not go so far into depth on those.
I can do that. So the next slide, more teacher responsibility. Some of these are very similar to Joe's slides. I do want to reiterate that at the middle school level, teachers will be delivering content in their, like for example, an English teacher will deliver content in English, and that will be in person with students using devices at the middle school level. And I believe that's all the same as the elementary was. We can go to the next one. Student responsibilities, same as the elementary, middle school students need to focus on studying, participating in their independent lessons and activities that they have to do, small group activities, and participate in whole class instruction. Parent responsibilities are similar, again, providing support, providing guidance, a place for students to do that online work. Now, these were the same ones that Troy used. I do want to give you an example of a flipped lesson classroom at the middle school level. A teacher could record themselves with their lesson and their content, and during a student's independent practice time, the student would watch that lesson. And then when they went to first period class, they'd have times for questions and discussions and interaction based upon what they had watched during independent practice. That's a great option for middle and high school students to do. The next slide. Students will attend 3 to 4 classes per day. We realize that they're going to be online, right? Having 7 straight classes in a day for teachers and students is quite a lot. So we are saying that 3 to 4 classes per day, depending on their period schedule. They'll have options for a small group, intervention, reteaching. Office hours is a time for students to access their teacher with specific questions that they need answered, or even a parent. Office of Academics will support the instructional leads. Each department at the middle school level, English, math, science, and all the others, have instructional leads. There are district coordinators that also work with those instructional leads, and they'll bring back learning to their sites. Pacing guides are available for content areas. Like I said, social emotional learning, and again, will meet the needs of the special education and other vulnerable populations. The next slide. So here's an example middle school schedule for you. You'll see teachers start time at middle school is 7:15 in the morning. From 7:15 till 9, teachers will have the opportunity to work in their PLCs with their content area teachers, and also have time for prep, individual prep or group prep, grade level prep, depending on what the needs are at the site. 7:30 to 8:50 would be a time for independent practice. Now, again, this could be an English teacher assigning a writing activity. The students would complete that, and it would be due that day or the next day. Could be a flipped classroom, or it could be an edgenuity lesson. So they'll have that time for independent practice. Then we'll have periods like 1, 2, 3 on one day, periods 4, 5, 6 on the next day. Within the middle of the day, independent, small group, interventions, and reteach time for teachers. At the end of the day, we have that office hours and some more independent practice, small group, and support, depending on the needs of the students throughout that day. So providing 2 times of flexibility. Remember, this is just an example schedule for middle schools to use. Do you guys have any questions for me?
I don't see any hands raising. I know we talked about this kind of as a whole and at the beginning of the presentation, but I wondered, would this look different for our vulnerable populations, those groups, this type of a schedule? And you know, we've heard a lot, especially from our special education families. So if we had a student that was in a self-contained program, you know, what would this sort of a typical day look like? And then if they were in a blended classroom, if they were integrated into the classroom, is where that time would be where they get the one-on-one special education support.
So at the middle school level, a self-contained classroom is designed with, for example, a 6-period day as well. Maybe first period is in your self-contained SIP classroom. Second period, you're in English. So the student would still go to English. If they needed extra support, reteaching, or maybe some SDI based upon their individual IEP, they have that time in the middle of the day or the end of the day where they can do those lessons as well. So they'll flow through their schedule just like they would if they were in person. And I want to reiterate, this schedule would make flowing to hybrid model and then flowing into full in-person work very well. So they would keep those teachers keep those class periods, and then they would be in the building, of course, from 7:30 to 2 as opposed to online.
And so just to make sure I understand too, then that AB rotation, if we were with hybrid, their off day when they're not in the building, are they following this schedule on that day, or is that that's a different model?
So hybrid's different, right? Some schools do have students only attending 3 periods a day on their hybrid because they want to limit movement within the school. So then this would just sync with their schedule. But some hybrid models have a full 7-period day. And so the B day, when they're at home, they will have independent learning to do. And those would be similar activities that they're going to have during their independent learning also within this digital day. So it could be, again, writing, ingenuity lessons, a math activity to do at home, depending on the math teacher or the social studies teacher and English teacher.
Great, that helps a lot. Thank you. Vice President Taylor.
Thank you, Madam President. And thank you, Lauren. Just a couple of questions. This is just my lack of being a K-12 teacher. What is a flipped classroom or flipped instruction? I know Joe Ernst talked about it and I should have asked him, but now I'm asking you.
It's okay. So I'll give you the example from McQueen High School. So we have a teacher at McQueen High School who teaches a foreign language, and he is recording right now his lessons on a video. So kids will watch that video instead of seeing him teach in person, like I'm talking to you now. You watch it and record, it was recorded, and they'd watch it at home. And then when they came into the classroom, well, in this case, when they met him on Teams, they would have the opportunity to ask questions, interact, and discuss what they already watched. So it kind of, sometimes teachers will deliver, right, their instruction, and then the kids go home and do homework. It's reversing. Watch me teach at home and then come in and let's discuss.
Okay, it's the other way around. It's flipped. Got you. Second question, thank you for that. So I assume that electives in the middle school are very similar to elementary school, was based upon their instructional calendar and so on.
So middle school is different. So in this period rotation, you might have PE 2nd period, you might have art 6th period. So you would attend that class on those days.
Okay, so if I'm an elective teacher, for an example, right, PE or art or whatever, I'm still doing the same thing, and the kids are wearing different Teams rooms or whatever for instruction. Okay.
Correct. Well, they will join me 1st period in Teams for PE.
Right. Got you. Thank you.
You're welcome.
Trustee Cottle.
Thank you, Madam President. Thank you, Lauren. How would students with IEPs be handled, especially students that in a normal school day, they would have a one-on-one aide that they would work with throughout the day? How would that be simulated in a distance learning model?
I am going to phone a friend, and I'm going to ask for Jen Ventress to get on and answer that question for you.
Thank you.
No problem.
Thank you, Lauren. Thank you, Trustee Cottle. Jennifer Ventress, Area Superintendent, for the record. We have actually had some great success during our extended school year program, and actually during the spring, of specific paraprofessionals working with their teachers and the families to provide specially designed instruction. So what, for example, looking at the middle school model the way it is right now, the one-on-one aides would be with the student on the distance learning during this the student independent practice time. So they would be connected with the student through Teams or through Zoom or through whatever the platform that works, working with the student, building those skills during that time. So that independent practice time would not be independent for students that have one-on-one aides.
Okay, so those students, they would be a part of the regular periods, but they would only be with their aide then during in this schedule example, 10 to 10:50.
Well, the one-to-one would also, the paraprofessional or even the special education teacher would be available and on the period classrooms, helping support through chats or through visual cues to help the student participate in the classroom and stay focused. So they would still be with them all day long, just through a kind of a virtual model.
Okay, and then I would assume special education teachers have more than one student. So how would that work in a distance learning where they're trying to split their time amongst a group of students versus when you're in the building, you kind of have them together versus on Zoom trying to manage and follow them through their schedules? How is that going to work?
So the schools will create their schedules just through distance learning, the same as they would through in-person learning. So they'll have their students together or worked together just as you would do it as in an in-person model. So the distance learning schedule would be built basically the same as it would be for an in-person.
Can I give an example? So if you have some resource students that have co-taught English, that's first period, that there'll be two teachers in that first period teams meeting, the co-taught, the general ed teacher, and the resource teacher. Also, I want to point out there's 3 blocks of time for independent practice. So there's time for special education teachers, one-on-one aides, assistants to work with groups of students or individual students at 3 times a day at the middle school suggested model.
Okay, thank you very much.
Thank you.
All right, I don't see any other hands up at this point, so I think we can move on to high school.
Okay, and I'd like to introduce you to our high school representative, Area Superintendent Gina Curtis. Thank you.
Good evening, Madam President Raymond, Superintendent McNeil, Vice President Taylor, and all of the trustees. Thank you for being here and being here tonight, and I'm excited to see you all. So listening to Superintendent McNeil, I'm not going to read everything. I'm just going to go over the events, the slides that are actually very similar to elementary and middle school. So to revisit the decision of the AB rotation is that it'll be in person half the time and half distance learning with special attention to our vulnerable student groups. Next slide. And then the distance learning at the high school, equitable access, obviously new learning content, which is exciting for our teachers, focusing on social emotional learning, and of course, professional learning and PLCs. Next slide. I do feel like I'm going kind of fast, but I think you have heard it a billion times, so I'm confident that you're okay if you need to stop me. So again, similar, the 5.5 hours daily is super important, spending attention with our special populations, special ed, our assessments, and with high school, we do really want to focus on our master schedule and trying very hard to simulate a smooth transition in any learning program, whether it's distance learning, in person, or hybrid. That's really crucial for high school to make sure that transition back to any program is fluid. Okay, this is a new slide too for high school. So Edgenuity in the high school level, it's a full-time distance education. It's a credit accrual courseware, and it is aligned with the Nevada Academic Content Standards. It is a rigorous curriculum. So AP courses and CTE courses are available. World language courses are not recommended by the curriculum and instruction for Edgenuity. So that's one of the things that we need to pay attention to. The student progress is automatically through programs. So the student can progress without a teacher manually moving the assessments and opening up the quizzes. So the students can progress at their own level and at their own pace, which is super beneficial, especially for our high level learners. They can move faster, and our lower level learners can take their time and get some extra support. Teachers will be able to contact students virtually or by phone to discuss progress or concerns. That's something that's very important. Professional learning is available for all teachers. So that August 10th week, I know our extended studies and C&I departments have worked diligently to make sure that they have great professional learning for our teachers, especially our high school teachers. So this might be new for some of our content-based teachers to understand how it works and how it can complement their teaching. And there also is credit recovery. So it's just not credit accrual, it is credit recovery. We have used it in summer school this summer and in the spring, and actually all last year we used Edgenuity in the curriculum. And do you have any questions about Edgenuity, or should I keep moving? Keep moving, I feel.
Thank you. I do see one question. Trustee Cottle.
Yes.
Madam President, I just want to clarify. So for high school and middle school, Edgenuity is what is being used, like teachers will use Edgenuity, or are they free to kind of create their own lessons under the standards?
So that's a great question, Trustee Cottle. So Edgenuity full-time distance ed is courseware is aligned and created. So during the pandemic, students can move through this Edgenuity curriculum, and the teacher can work with them. But there's also a Edgenuity that's blended learning. So this is a non-credit course, and it's supplemental, and it complements the teacher's teaching. So for example, if you only see them on see them first, second, and third on one day, the next day that they're not there, they're working on lessons or activities or videos that the teacher has created and has the autonomy to and the responsibility of the pacing of the course. So there's a full-on Edgenuity, and then there's like a blended version. Does that make sense?
Yeah. So I guess for consistency, how is this going to work? Is it the teacher's choice to just go full on Edgenuity, or do more of the create different lessons? How is that a school site decision, teacher decision? How's that going to work?
Right. So with our core academics, I know that the departments would work together, whether it's subject matter or grade level, to collaborate so that they have the same consistency with the Edgenuity class. If there's an elective or a unique course, then I think that's when we would look at the blended learning course, so that the teacher could have the autonomy to teach and then have Edgenuity be a support.
Okay.
So, and I know that our C&I department and extended studies have a plethora of courses, and they've been working diligently to make sure they have as many courses available for our high school kids.
Perfect. Thank you.
Okay.
Trustee Simon Holland.
Thank you, Madam President. Hi, Gina. Thank you. Kind of building off Trustee Cottle's question, I have heard that rigorous is a really good word to describe Edgenuity classes. So I imagine that parents are going to have to be working with counselors to determine what's the best solution for their particular student, because again, and this is just what I've heard, my perception is that Edgenuity is demanding.
Yes, and it's different from our
Any comment?
Yes, and so our former credit recovery and credit accrual program was A+, so it's a different program, and we say rigorous because there's more involved. There is more effort, and again, Edgenuity was used in the past for credit recovery. So if it's a new content and students have to take this for the first time seeing this content, that's where it's really rigorous. And that's when we rely on our teachers to support them. And in the high school level, some of that independent work is important. So our students can use other resources. They can look at Khan Academy, they can look at Google Docs. And they need a problem solved to help themselves in the real world. But yes, so there's curriculum that is rigorous in Edgenuity, but there's also some supplemental activities and support for them. So I know we use the word rigorous in a good way, but it's also can be challenging for some of our lower readers. So.
Thank you.
Yes.
All right. Vice President Taylor.
Thank you, Madam President. Thank you, Gina. Question for you, which kind of flows probably over to Lauren's presentation. So for distance learning, and Trustee Caldwell asked one of the questions I was going to ask is if it was fully required of high school teachers or supplemental, and I got that. So thank you. But let me just, so to reach back to middle school a little bit. So for middle schools, is it the same, or if middle schools are in full distance learning, will they teach all Edgenuity, or will it again be supplemental based upon, you know, what's going on at their school?
Well, and I'm looking at it in my brain as a high school, you know, credits for diploma, graduation requirements, college and career ready. So middle school, I know they used it for summer school this year, some of the schools, and they were productive with that. But, you know, Lauren, I don't want to say the wrong thing. Is there any way you can assist me with this answer?
Lauren, a little help, Lauren?
Calling out at my friend now.
I think that for high school teachers, they've got to look at the same thing like the middle school teachers are planning. Am I using Edgenuity as to enhance my lessons on independent learning days? And they have that option. The high school, I would say that the master scheduling team, the principal, the counselors, they need to decide which courses are full Edgenuity courses for which students. But teachers are still going to be designing their own lessons and providing those lessons. Did I answer that?
Well, maybe let's speak in the flip. Let's flip that. Will middle schools be able to do that? Because the question was really regarding middle schools. I know this is the high school session, but work with me. It's late.
So middle school principals and the counselors will pick which courses they're going to offer on Edgenuity. So I'll give an example from one of Gina's schools. The principals looked really carefully at those courses, and there are some elective courses in Edgenuity that they don't offer at their site. So those would be some great classes to allow students to take independently during independent practice. And those may be assigned because they don't offer them at the middle school. So that's a great way of providing enhanced curriculum because we have distance learning.
That's absolutely answers the question. So thank you very much.
You're welcome.
And thank you, Gina.
Sure. Thanks, Lauren.
You're welcome.
Okay, so shall we move on from Edgenuity at the moment to the next slide? Okay, here we go.
Ms. Curtis, Area Superintendent Curtis.
Yes, ma'am.
I think this would be, these are the same responsibilities that were in elementary and middle. So if the board is comfortable, if we can move through this slide.
Yep, I think the next four. So administrative responsibility, teacher's responsibility, and you know, at the high school level, I know I just want to do a little shout out for high school that the special ed department, you know, there's general ed teachers, special ed aides, there's the district special ed support. So I just want to make sure that we wrap our brains around the how much support there is at the high school level in different capacities. Then we have student responsibilities, and our high school students need to be focusing on graduation and internships and opportunities for moving forward in college and career readiness. And then seniors, of course, are preparing for their graduation and their grad plans. And I know they work with their counselors and the teachers at the school for that. And then finally, our parents providing support and guidance for all of our students. So I won't belabor that. Okay, next slides. North Star Online School. So I just want to give a shout out to the principal and the staff at North Star. They've been working diligently and have put in very, very many long hours during the last couple months with such a short staff, trying to work with families to make sure they understand and can comprehend the online school program. So just want to give a shout out to them. So North Star is an online curriculum for students grades K through 12. Our enrollment is increasing daily, and the enrollment process is a little slower at North Star just because of the Pearson curriculum and how they have to have two systems communicate. So I know that parents can be a little frustrated because of the process. So I just hope everyone's patient with them in their work, as well as family support is required with online curriculum. It is important that they are working with their kids and making sure that they are logging on daily. And that's very important. And then finally, just something I wanted to tell the community, that there are no mid-semester transfers for North Star. So for example, if you are debating if you want to have your kids start at your zone school or North Star, we would encourage you to start at North Star. And then if you feel like you want to go back to your homeschool, like I know Trustee Cottle said that you have that opportunity. But if you're starting at your homeschool and then you want to transfer to North Star, that's something that isn't encouraged. It's very difficult to align those curriculums. So I just want to make sure that the public knows that if North Star is something that they want to do, they should start doing that first. And then they can always transfer back to their zone school. Any questions on North Star? Okay.
I do
All right,
see
we're-
one. Vice President Taylor.
Thank you, Madam President. Gina, this has more to do with the teachers, I guess. Since you're talking about North Star and the students transferring, I guess, and I know we've allowed, and the reason why Ingenuity has been chosen, one of the reasons is that there's really good alignment. You know, if a family decides if their child wants to distance learn versus in person, or situations change, or someone has to quarantine and all of that. What about our teachers? And I guess this isn't just a high school question as a whole. If a teacher starts off the year at home because they have a pre-existing condition or something's in their family or whatever, and then things loosen up or lighten up or whatever, can they transfer back, or is that based upon their allocations and such?
You know, I would like to refer to Emily Ellison on this, but I don't want to make assumptions that once you're committed to a school, you're there for the school year, but I would assume that Emily would answer that. But your allocation is where you are for the entire year. I don't think.
No, I mean, if you start with distance, if you're a teacher and you start at home, you know, because some teachers have opted into it, maybe they have a reason to start it at home, and then we open schools back up or something, can they, or things, you know what I mean? I guess it's more for that.
Right. Dr. McNeil, are you okay?
Yes, no, I'm fine. I have Emily Ellison in my office, and so we're practicing social distancing. And so I'm putting on my mask because Miss Ellison is right here. So I'm going to get up from my chair, and Emily is going to sit down here. But this is not Dr. McNeil. This is Emily Ellison. So hold on a second.
Thank you for explaining, because I was wondering, like you, Gina, I was like, so should we all put our mask on? I'm not sure.
Thank you.
Emily Ellison for the record. Dr. Taylor, would you mind repeating your question? I didn't hear it. I was in transit from one office to the other.
Yeah, I guess I'm asking if, because a constituent asked me this, and I actually kind of forgot about it until Gina started talking about students transferring. So maybe, what about teachers? So if a teacher starts off at home, you know, say if they're either, I don't know what level they're, or whatever, and they're at home because they have a pre-existing health condition or something like that, and then they start off the school year at home, and then let's say if when we get a vaccine, or if the protocols, if things are lift up and we can open schools up completely or whatever, will they be able to then go back to quote unquote regular teaching or in-person teaching?
Yeah, I mean, it's impossible to anticipate all of the scenarios that we might encounter, but we are working to support our employees' needs through the ADA process in many cases when it comes to distance learning. And you know, within the accommodation process under the ADA, there are certainly opportunities to modify or to cancel whatever accommodations have been made. And so I think we would work with individual employees in those circumstances to determine the best transition kind of back into our old life, right?
Okay, yep, yeah, the good old days, right? Okay, thank you. Thank you very much. Again, the constituent asked that, and I meant to ask earlier, so thank you.
Trustee Cottle.
Thank you, Madam President. What is the district's reasoning behind using Pearson at North Star but Ingenuity everywhere else?
North Star has been our only online school for years, and we have had a contract with Pearson. And so it's Edgenuity and the online Pearson curriculum at North Star are two completely different programs. And so they are a true tradition. North Star is a true traditional online school, and Edgenuity is a distance learning program that we use for credit recovery and credit accrual. So I don't know if that answers your question, but that's what I know about it. So
okay, so Pearson is set up for that online school, and Ingenuity is intended for summer school credit recovery that we're going to utilize as almost like a stopgap for those students in middle and high that want to opt for a distance.
Correct.
Basically, okay. Thank you.
And it does have, Trustee Cottle, Edgenuity actually has more courses available than the old A+ did, as far as for credit recovery and credit renewal accrual.
Okay, thank you.
Yes, there's AP courses and some CTE courses as well on Edgenuity. Okay, any other questions with North Star?
Yes, one more. Trustee Minetto.
Thank you, Madam President. This is not about North Star. I just popped in my head, and I thought it's for Jen Van Tress, really, that are we able in the distance learning to do the IEPs we need to do? Because I'm thinking there's like 800 that we got to get caught up on. Ridiculous.
IEPs or assessments, eligibility and assessments.
Yeah.
IEP eligibilities and assessments.
Pardon?
Is the question for how to get caught up on our eligibilities and assessments, or how
Yes.
to? Okay.
Or both. Sorry.
Perfect. No, you're fine. So we'll start with eligibility and assessments. Through a distance learning model, it will be challenging for us to complete eligibilities because testing for special education services is the tests we use are not designed to be given virtually. And so that will be difficult for us to do. That will be something that we would need to consider an opportunity to practice social distancing using PPE equipment and have our students work with our staff one-to-one in a building. Same with our child find process. As far as implementation for IEPs at any level through a distance learning model, again, and actually this is a slide we have coming up, but we did use the distance learning model for our extended school year this summer with some great success. And so new area superintendent Anne-Marie Dixon will be kind of giving you some more details on that in a few minutes about how we were able to provide services and supports during the extended school year through a distance learning model.
Okay, thank you.
All right, I think we have a few more slides about high school to get through, and then I think I will actually call for a recess after we get through that.
Okay, I will move along. So the next one is the distance learning at the high school level that Dr. Parks had started out at the beginning of our presentation. And it's very similar to all the online opportunities and resources that we have available at the high school level as well. There's nothing different. And then the next slide, same thing. Of course, we will have, I will give you a sample schedule for the high school. It's 3 to 4 classes a day, depending on the site. It could be up to 6 classes a day, but this is just a sample example. And again, starting with PLC and prep time so that teachers have time to collaborate with their departments or their grade level. In addition, we have independent practice for our students. And I know that schools will make sure that our daily lessons have a guaranteed and viable curriculum, and that we are reaching out to our students for the social and emotional learning, checking in with them, goal setting, and just trying to build that relationship with them during their school day. Any questions about high school?
All right, thank you so much, Area Superintendent Curtis, and to all of our presenters on these items. We do have some really important information to get to related to special education coming up, but I do want to just or need to take a short recess. So if we could be back here in 10 minutes, it is 9:02. We'll be back at 9:12. Okay, welcome back. I appreciate everyone's patience and understanding as we move through this very important decision this evening. And we are getting close to the point of making some of those decisions. I will call the meeting back to order. And we have just a few more slides, and then we will go back and reconsider decision points for all of the different models. Trustee Simon Holland.
Thank you, Madam President. We had a couple of questions about online learning, distance learning at the high school and middle school level that I thought were important questions that we might want to ask on the record. One was we received a comment that Edgenuity is not NC2A approved, that those credits don't count for the NC2A. So I hope that someone could comment on that. And then we also got a note that the deadline for registration for North Star is this Friday. So again, if that's accurate, we'd want to make sure to mention that here. Jean, I guess you can answer those. Thank you.
Yes, Katie. The Edgenuity is recognized by the NC2A. Each school has to submit individually their requested courses that they want to offer. And so the high schools and myself are working with CNI, our senior director, Kendra Fox, and we are developing a plan for if we do go distance learning, what that would look like. So yes, there is a plan for that.
Okay, great. Thank you. And then North Star, is the deadline this Friday?
Yes, it is this Friday. That is what is on their website. And I'm sure there will be exceptions if necessary. But right now, and this is their normal timeline, is that at the end of July is the timeline that they usually end applications because of the amount of time it takes to sync the two different curriculums and the two different systems. But knowing where we are right now and our unique situation, I'm hopeful that we can make that work for families that decide at a later date. But if you are, to the public, if you are thinking of it, like I said before, let's try to get those, at least make contact with North Star so they know you're interested and they can start the process. So you're in the system and you're on the list.
Okay, thanks so much, Gina.
Mute.
Okay, Deputy Superintendent Beiersdorf, do we want to go through the district department supports? And I think Dr. Parks was going to walk through this as far as with the different departments.
Yes, thank you, Dr. McNeil, and thank you, President Raymond. For the record, Troy Parks, Chief Academic Officer. I believe Dr. McNeil, I'll run through this since it is a slide that has some repetition. But wanted to emphasize that throughout the spring and during the summer, all of our area superintendents have stayed connected with their principals and schools at least on a weekly basis. a lot of that work has been focused on preparing for the different models, the distance learning, the hybrid, and of course the in-person. They are always working on safety and health plans, what those are going to be looking like. Want to give a big shout out to the work that's gone on across departments in supporting schools through this time. The curriculum and instruction department has been working closely with the 21st Century Learning Department. There have been, all throughout the spring, there were virtual opportunities to practice teams and work on teams. In the summer, that has transitioned to daily opportunities for our teachers to participate in teams. As we move into August, that will shift to an afternoon opportunity to be on teams and receive instruction so that our teachers can be participating in their site-based professional learning. And the rest of the slide is kind of the idea that we've presented, that even as a district, we are ready, regardless of the model, to be serving and supporting our schools. And with that, if there aren't any questions, I'd turn it to our newest area superintendent and congratulate her. Mrs. Anne-Marie Dixon is going to present the next slide.
Thank you, Dr. Parks. Good evening, Madam President Raymond, Superintendent McNeil, and Board of Trustees. For the record, Anne-Marie Dixon, Area Superintendent. As Mrs. Van Trest stated, I'm going to talk to you about some of the special education services and supports that we've had in place. She mentioned our extended school year. We did have ESY services provided for students June 22nd through July 17th. Teachers and related service personnel provided services through a digital platform. We utilized online curriculum, direct instruction, and consultation with families. All students were provided a laptop and hotspot if needed, and a shout out to the IT department for providing those for us and working with us to make sure that our families were able to have access to technology. We did provide professional learning for all staff, working with students on how to schedule services, address goals and objectives, support students and families while at home, and how to progress monitor for services. And that was our extended school year. As we move into this school year, as part of our back to school professional learning, all special education teachers and related services personnel participated in coursework around online and blended learning, pre-K through 12, specifically addressing how to provide specially designed instruction. Teachers of self-contained programs all participated in training specific to the curriculum adopted for their programs and in providing SDI for students. So we do have a new curriculum adopted for our strategies classrooms, which includes an online and hybrid learning curriculum component. And for our CLS, or Comprehensive Life Skills program, we do have a curriculum that's been updated to include an online and hybrid learning component. Are there any questions about either of those?
Don't see any.
Okay, thank you. Mrs. Van Trest.
Thank you, Ms. Dixon. Welcome to Area Superintendent World. We're excited to have you with us. So good evening, President Raymond, Superintendent McNeil, and members of the board. For the record, my name is Jennifer Van Trest. I'm the Area Superintendent for Area 5 and over special education. I just wanted to add a little more detail as far as how we're providing special education services moving forward. Our special education department is currently developing guidance documents for our schools based upon the 5 or 5.5 hour days, as earlier you saw in our presentation. Schools will be provided those documents with templates and exemplars within the next week. Though at that time, the schools will be able to work with families to help them determine the most appropriate way to provide the specially designed instruction, whether depending on decisions made tonight, whether it's in person, whether it's a hybrid model or the distance learning model. We'll also provide specific programming information along with early childhood. Like Ms. Dixon said, we have the comprehensive life skill program that we've updated, and the strategies programs that also that teachers are going to be trained on, or are actually receiving the training as we speak. As far as related services, I know that's also been a big question that's come to several board members. I want to let you know that we are working with, and I believe I may have win the jargon of the night with the new acronyms. So when we look at related services, we have the American Occupational Therapy Association, we have the American Speech and Hearing Association, we have the American Physical Therapy Association, and we have the Behavior Analyst Certification Board. And we are looking at their national documents and their recommendations as far as how to keep our staff safe, either through distance learning or through in-person models. And we are using those documents to help drive the decisions for working with our staff. So we will be, in the next week, we'll be providing that information out to our schools and our staff on how to provide telehealth therapy as well. Any questions?
Don't see any hands raised.
Fantastic.
Nope. Looks like we can move on. Thank you.
Well, then I will turn it over to Dr. Parks.
Thank you, Mrs. Ventress. And Dr. Taylor had earlier asked about our plans for the 5 additional professional learning days. Big shout out to Dr. LaPenta and Mary Martini. They have been working days, nights, and weekends to make sure that our Infinite Campus is up and running, that regardless of what model we're in, it will be efficient and effective for our teachers to be able to take attendance and track that attendance. And then, as you might imagine, and I want to refer us back to the data that Ben shared, teacher efficacy. When we talk about teacher efficacy, put simply, it is that if a teacher believes that they can meet the needs of their students, that's a very good start. And if you refer back to our data from Ben, I would argue our teachers during our spring episode of distance learning didn't feel a lot of efficacy. They didn't feel like they could meet the needs of our most vulnerable populations. If you look back, about only 20% felt that they could meet the needs of their English language students and their students receiving special education services. So that is a huge concern moving into this next school year. And our professional learning is designed around increasing teacher efficacy. One of the ways we are going to do that is through our professional learning communities. As we talked, we really think it's extremely important that the curriculum planning and pacing be standards-based, and that new lessons are able to be delivered regardless of if a student's on distance learning or if we happen to be in person or hybrid. And then our Office of Accountability and Curriculum Instruction Office have been working together to make sure that we have assessments that will be aligned to those standards-based lessons, and that as our teachers teach, they will be able to assess our students' learning. And if students aren't learning, they'll be able to address quickly misconceptions and reteach, and also at the same time be able to extend learning for our students that are mastering the standards. We have a big emphasis on edgenuity. We see this being an opportunity for our middle school and high school teachers. Obviously at the middle school and high school level, if we're in a full distance model, we will have more in-depth training for those students serving, for the teachers serving our students on the distance learning model. I have mentioned previously all the tools that we have available in Microsoft, and that will be our focus. And then on this next slide, I really wanted you to see this Washoe County School District video. It's important to note that this was created prior to the pandemic, and our 21st century department, as well as curriculum and instruction, have been working to accomplish many of the things you're going to hear about in this slide. So JJ, would you play the slide, please?
Teacher communities. Hello. Welcome to this video tutorial on how to join teacher communities through Teams and access the abundant resources available. The Curriculum and Instruction Department has created curriculum notebooks in OneNote for grades K through 8, including ELA, math, science, and social studies. Resources for high school and other subject areas are currently under construction. These amazing resources provide teachers with a one-stop shop for lesson planning and student assignments through Teams. Pages can be copied and personalized for ease of use. Access the digital curriculum notebooks found within the communities for instructional resources such as standards, pacing guides, unit plans, lesson plans, student pages, and essential strategies from 21st century learning, English language development, equity and diversity, family school partnerships, gifted and talented, social emotional learning, multi-tiered systems of support, and special education.
So with that, I wanted to just give you a little bit of a preview of the work that had happened prior to the COVID-19 outbreak. That work is obviously ongoing. One of the successes we did see during our spring distance learning was the distribution of materials. If you recall, we followed this model for much of our graduation celebrations and scheduling, practicing social distancing, face covering, and these were led by Mr. Ernst and Mrs. Ford, and involved a tremendous amount of people in our schools and our community coming together to have a plan to distribute materials and pick up materials. So we feel like we are very prepared in the case that we are distributing laptops here in the near future. And in the case that a student or group of students needs to move to a distance learning model, we feel confident that we have systems already in place to make sure that we are following the current guidance and being safe and getting appropriate tools and learning opportunities into our students' hands. If there aren't any questions about the video or distribution of materials, Dr. McNeil is going to take it over from here.
Thank you very much, Dr. Parks. Well, that concludes our presentation for this extremely critical item. We wanted to make sure that we walk through what the distance learning plan would look like. I really pushed the team around the rigors of a distance learning plan, knowing that for all the commentary that we've heard about our distance learning plan, and we did the very, very best that we could. It was an emergency. Schools were closed, and I'm still very proud of where our district went with the distance learning plan. But we know that distance learning can't continue. It can't. Our students were suffering within that distance learning plan. And, you know, I have taken great amount of time, just as all of the trustees have. I haven't been able to keep up with all the public comment and all the emails during this meeting. I was caught up before the meeting. I'm way behind now. But a lot of consideration, a lot of deliberate concentration on the hybrid model and on the in-person model. The plans that were approved back in July by the trustees. We've listened to concerns of our employees, we've listened to our parents, and we've listened to students. I've had students email me, the trustees have had students email them on their concerns on a distance learning plan. You know, it's our job to make sure that we're taking all of the information and providing it in such a way that the trustees are informed in order to make a decision. And I have to go back to when we put together the hybrid model and the in-person plan for our elementary. And the option that still exists today, that if a family wanted to opt into full distance, they're absolutely able to do that. Whether that is in North Star or at their home school, they are still able to opt into a full distance learning model. I've respected all of the information and public comment that our employee associations have contributed in the meetings that we have had with our employee associations. And all of the employees that may or may not be part of the association absolutely respect all of our employees and their comments and their concerns. But because I still have extremely grave concerns for our students and where our students are at and not being in school. We know that school is a sanctuary for many, many of our families. We know that school is a safe place for our students. We know that it is a place of learning. We know that it is a place for connection. We know that it is a place for relationships. We also know that our schools are places of medical care and consultation around mental health supports. We know that our schools are places where our students receive food security, nutrition. We know that our schools are places where our counselors and our social workers do heroes work around suicide prevention. And for all of those reasons and our vulnerable populations, including special education, English language learners, children in transition, foster children, gifted and talented, our refugee families, the fact that it crosses no socioeconomic background as far as students that are suffering from depression and anxiety. We know that our society has changed. Our society has changed globally. This is a global pandemic. We can no longer hug. We can't interrelate how we are used to. Fist bumping, elbow bumping, those are the terms that our students are learning. But we have to mitigate this virus together. We have to take on the virus together. We have to fight it as a team, as a community. And the virus, you know, we've all read the articles. We know that the virus is going to be with us until a vaccine, and nobody knows when the next vaccine, when the vaccine is going to be. You know, I've heard to 2 years. For all of the reasons that I have listed, I cannot, as the superintendent of the Washoe County School District, at this point in time, recommend a full distance learning model for all the reasons that I've stated. And I respect our employees. I absolutely do. But I I would like for the trustees to consider looking at the data and the recommendations around with the medical advisory team and the governor's directive that just came out, and to look at the possibility of other solutions other than moving to a full distance learning model at this point in time. I'm open to questions.
Thank you very much, Superintendent McNeil. You know, if I just might add, I do want to recognize the amount of work that our leadership team and all of our administrators and teachers have done since the July 7th meeting. I know many, of our school sites were well on a path of preparing for an August 17th start with students in the building, and have spent a lot of time and energy. And we didn't anticipate necessarily that we'd be back here today to be having conversations about whether we'd be continuing with those models or not. The reality of the pandemic is that things are going to continue to change, and we will have to be prepared as a district for those changes. And it's going to require that fluidity and that ability to be nimble and make those adjustments. Chair Lucy referenced that in his public comment that we just, as a district, we need to be prepared. And so while I wish that we wouldn't have to be in this position again, where we're talking about the direction of our schools and whether they're in person or hybrid or distance learning, in all likelihood there will be future conversations about this, but I don't think that should prohibit us from moving forward with decisions today, and so that we can provide some sense of ease to the staff and our families and students, and knowing what to expect. And so I do appreciate all the work, again, that our team has done to get this information together. If I might ask a couple questions that came through that might be more directed towards Ms. Curtis or Ms. Ford, our area superintendents. And then I think if the other trustees are ready, we could go through our action items. But we got a number of questions that referenced the difference between elementary having the 5 hours of instruction, and then the middle and high school having 3 50-minute classes, and that not equaling 5 or 5.5 hours of instruction. So can you please provide information about, at the middle and high school level, what is that direct instruction time if there's only 3 periods in a day that a teacher's teaching? Where is the rest of their time going?
So at the middle school level, the schedule showed you independent practice, that small group time, and it also showed you office hours, independent practice. Those time slots count toward those 5.5 hours a day. So if we go back to that slide, I think it was 47, JJ, and you look at the minutes, the only time frames that are not added up in that slide is the teacher PLC and prep time and lunch. So if you add the other time frames, it'll equal the 5.5 hours, or 330 minutes.
Okay, thank you. And another thing I meant to ask earlier related to the elementary schools, and I know we have discussed the hybrid model at the elementary level, and I actually, I think, stated at a previous meeting about that hybrid model that, it's just such a hardship on families either way, if they're hybrid or full distance, to find alternatives to care for children that in my mind, the goal was to try to get to that in-person model full time. But I just wondered if anyone could speak to whether the hybrid model at the elementary level has been brought up again, if there's been any reconsideration of that as a possibility, and if not, why?
President Raymond, again, Deborah Beiersdorf, Deputy Superintendent. The reason why staff brought the recommendation to our trustees on July 7th for an in-person model for elementary school is that through our analysis, working with our principals, knowing our schools, we were able to bring all of our elementary school students back 5 days a week and still be able to maintain phase 2 guidelines, expectations around distancing, the 6 feet of distancing. If you remember as well, we talked about it and we explained that meant the utilization of many spaces within a school, again, whether it's multi-purpose room, cafeteria, library, computer labs, etc., in order to be able to space students out appropriately. And then in all likelihood, the staff at the school and also staff that would have to come perhaps from central office departments and that to make that happen. So we were proud of that work. We were happy to bring that recommendation, wanting to get our youngest learners in the buildings with their principals and with their teachers. But that's why that recommendation was brought back earlier this month, or brought to you earlier this month.
All right, thank you very much.
President Raymond, can I jump in there too?
Absolutely.
Thank you. And I would echo what Deputy Beiersdorf said, but I would also add, we spoke earlier to the importance of, in the hybrid model at middle school and high school, of assuring that our families that have middle schoolers and high schoolers are on the same schedule. And our principals are going to work together to assure that. That would be another element of a hybrid model, that now you'd be having a third possibility at the elementary school and trying to align all the schedules between an elementary, middle, and high for our families would present challenges. And I just refer back to the data as well. In making those decisions, we at the time had a lot of our community and families preferring, I think it was about 67%, preferring that if we could at all possible bring them back to in-building. We all know the benefits of being in person and the relief that would provide our families who need to work, just to add to Debbie's comments.
Thank you for that. I appreciate the information. I want to make sure too, not to forget that we're going to read the names of our public comment, but we'll get to those questions first. We'll do the public comment and then we'll go through our action items. Trustee Cottle and then Trustee Minetto.
Thank you, Madam President. I just had one quick question for Jen Van Tress. I got a message from a special education teacher wondering if self-contained special education teachers will receive training for both the ingenuity and the specific curriculum for the self-contained students, which is unique. Is that going to happen?
Yes, the trainings will be happening. Part of the unique curriculum was offered during the summer back to school training. So we did do an overview at that time, and if they were not able to participate at that time, we have plenty of opportunities to give them the online training for unique. And then also during the 5 days professional development days during the week of August 10th, we will be providing additional training with Edgenuity for all teachers, but definitely our special education teachers, as well as additional training in unique. for our strategies and our CLS teachers.
All right, thank you.
Trustee Minetto.
Thank you, Madam President. I don't know who I'm asking, maybe Kristen. I have a question about if we have to go from in the building, a classroom gets shut down, do we automatically flip to the distance learning just the next day as we have it set up? Because it's quite amazing. Is that flipping ability, or is it going to take, weeks and weeks for that to go?
So I'll start, and then if Debbie wants to jump in. So Trustee Minetto, it's probably going to depend on the actual, if it's a classroom, and even if Margaret wants to jump in, if it's a classroom, that's one thing. If the health district comes in and says that, the school is then shut down. So I go back to Huffaker Elementary, which we remember, and we did that as a district out of an abundance of caution. But that, if the school is shut down, then that particular school, we would flip into the distance learning model. And then if it's a larger scope issue, then we would flip into the distance learning model.
Thank you. Appreciate that.
All right, if there's no more urgent questions at this time, we'll go through our public comment. And then I know there are some statements and things we'd like to address individually that we can go through at that time. And I'll just remind everyone that for our public comment, we will be reading the names of individuals that have submitted public comment for this agenda item. And the public comments that were received prior to the start of today's meeting or earlier this afternoon are on our website. We've received a number of new public comments since that time. Those will be made available on the website tomorrow for everyone to see. So I will now ask our clerk, JJ Batchelder, to read off the public comment for this agenda item. The names of the people, sorry.
We received comments from Dawn Roxkelly, Nori Stadmeister, Christine Nui, Daniel Taylor, Shell Batter, David Walco, Carly Humason, Sydney Rogers, Angela Metzger, Jennifer Fahey, Mary Butolf, Stephanie Foreman, Madison Quintero, Anonymous, Gina Gilbert, Lottie B., Margaret Jensen, Michelle McKay, Bill Sandbank, Victoria Hudgens, Melinda Biederbeid, Lisa Hall, Genevieve Durenga, Sarah Bowman, Krista Rossi, Matthew Cope, Christina King, Kathleen Stylinen, Lisa Burnell, Amy Klein, Andrew Crisnacho, Kelly Roper, Michael Spitzer, Summer Elston, Jamie Clark, Kendrick Bratcher, Katie Jameson, Robert Woods, Aaron Mesa, Lori Gerboth, Kimmy, Lindsay Baker, Dr. Nick Surak, Allison and Wade Platts, Cindy Peachy, Carrie Woodhead, Jennifer White, Anonymous, Dr. Lindsay Hofber, Veronica Feller, Michelle McKay, Zach Woodhead, Jerry Fulgham, Rachel Anderline, Jenna Larkin, Sherry Mason, Brooke Hassel, Jeff Schaefer, Rachel Kingham, Catherine Cook, Anthony Barazzi, Jennifer Garzon, Elaine Kudnick, Natalie Garcia, Amber Patton, Jane Brown, Amber Alfaro, Mark Stovak, Amy Cozy, Katiana Taylor, Kim Price, a student, Michonne Atuafi, Timothy Zisk, Cody Black, Kelly Perrell, Leanne Ingram, Colleen Woolley, Holly Underwood, Dr. Meg Jack, Steve Williams, Gladys Kurelik, Susan Parlane, Anonymous, Sandy Steenberg, Amy, Tara, Danielle Ming, Jill Thayer, Cara Schweidener, Katie Thompson, Annie Cates, Isabel Reed, Dr. William Toledo, Amanda McCline, Clinton Toledo, Scott Davies, Sherry Koppel, Kathy Johnson, Jamie Deanda, Barb Snellgrove, Trina Kleinheinz, Arlen Maffey, Lisa Aland, Brianne Kukulos, Angie Diananti, Rachel Devine, David, Jamie Kalash, Michael Scott, a Reno Huffaker mom, Dr. Ron Ariel, Colette McKenzie, Alexa Olson, Robert Brinkman, Janie Nelson, Tamara Boyd, Jessica Flake, Debbie Patrick, Alexa Youngberg, Carol Wallace, Anonymous, Marianne Swain, Susan Shepard, Carrie LaFieri, Joseph Bondra, Angie Goss, Peter Lucier, Catherine Milliken, Kelly Case, Christine Johnson, Shauna Planeta, Heather Johnson, the O'Connell family, Harriet Newman, Brandon Seary, Steve Mulvanen, Sandra Martin, Nicole Wyko, Chantel Day, Beth Martin, Heather Seary, Lisa Ashby, Dan Landon, Stephanie McCaffrey, Linda Schaefer, David Sullivan, Patricia Green, Clara McKinney, Allie Nugnet, Carrie Hudnall, Michelle Gipe, Ashley Labrador, Deborah Baron, Larry Cates, Michelle Blinko, Megan Franklin, Jennifer Shepard, Dr. Sarah Ream, Alyssa Coleman, Jana Copeland, Nancy Fink, Anonymous, Carrie Falchi, Alicia Ontani, Vicky Boley, Pam Reese, Maggie Babb, Elizabeth Cadigan, Jana Rager, Amy Ray, Valerie Wade, Stephanie Hanks, Sarah Coleman, Aaron Atkinson, Kathy Zarker, Lizzie Stark, John Lindgren, Stephanie Falk, Lydia Ledesma, Ryan Falk, Leah Kirchhoff, Alma Cerna, Michelle Churchill, Anonymous, Gloria Reed, Kristen DeHaan, Arnold Schmidt, Keith Namaska, Charla Baker, Janie Luciana, Teresa Bonin, Lauren Evans, Alicia Mujica, Dina Kurjan, Howie Stockton, Kristen Schatz, Andrew Patrick, Morgan Dusek, Erica Kristoff, Jillian Sass, Amy Bentel, Debbie Grimes, Tammy Soong, Connie Lynch, Bryant Gibb, Empower Nevada Teachers, Greg Canton, Colby Clendenin, Lydia DeFloro, Rosa Corletto, Bonnie Johnston, Marika Moore, Deanna, Lainey Hewitt, Darren Rupert, Nicole McDade, Mary Culpepper, Katerina Penman, Russell Barnum, Tiffany Marty, Joanna B., Kaylin Glines, Ashley Wade, Tina Tucker, Richard Schweigeter, Scott Kraus, Melissa Hill, Monica Rodriguez, Rhonda Bybee, Christine Eccles, Tara Jones, Ginger Humke, Anne Byington, Faye Hui, Annie McMillan, Laura Wilson, Mary Benson, Christina Novelli, Zach Hafner, Amanda Jones, Vivian Bolanos, Jennifer Delaney, Leslie Natty, Brandy Watson, Jesse Campbell, Olivia Paschal, Dr. Joshua Garn, Darcy, Veronica Dominguez, Chris Steffens, Janice Pearson, Nicole Berman, Malia Pukta, Debbie Deach, Tina Draculich, Julie Mannion, Lee Wimes, Sierra Aronson, Simone Weaver, Jennifer Deline, Catherine Bagel, Michelle Sanchez Bickley, Jerry Jacobs, Mark Ennis, James Benall, Nicole Rounds, Marissa M., Somi, Sarah Gregovich, Andrea Alvera, Shelley Williamson, Julie Leimbach, Kevin Shepard, Paul Grant, Natalie, Jenna Larkin, Mitch Grayson, Ashley Doster, Danielle McIntosh, Bobby Oneto, Lisa Garcia, Storm Buxton, Carrie Nuttall, Kelsey Penrose, Demetria Garnsey, Randall Hurlbert, Chris and Anissa Hendrich, Tonyan Weaver, Tatum Wirtz, Renee Becker, Chuck Johnson, Lisa Flores, Megan Hudson, Steve Bosco, Victor Paul, Dr. David White, Kathy Merritt, Michelle Wilson, Debbie Earl, Bob Rowe, Yvonne Scheinfield, Jeannie Sartoni, Cindy Opperman, Anonymous, Corrine, Jeremy Murray and Adrienne Soretta, Daniela Morla, Joe Lawrence, Allison Aker, Jeannie Sartoni, Michelle Roney, Nia Waters, Tatiana Long, Sean Tousley, Catherine Powell, Shayna Stout, Deidre Mazzetto, Lee Gray, Zach, Deborah Barreno, George Wizard, Kyle Kittle, Shannon Liedman, Michael A., Annie McMillan, Scott Collier, Aaron Lane, Mary Bryant, Amy Benham Bookley, Lori Henderson, Demetra Wilson, Susan Punchard, Jolene Hamilton, Mrs. Troy Reinhardt, Sean Tolucci, Michael Austria, Daniel Hedges, Stephanie Gibson, Sarah Afua Amongo, Rachel Coe, Jonah Howell, Leanne Shelton, Jamie Lindwall, Ryan Evans, Ashley Farmer, Dustin Colley, Kelly Evans, Debbie DeCalgorio, Jim Hannafin, Robin Griffith, Jessica Atkinson, George Summerhill, Paul Malo, Riley Wing, Patricia Coates, Debbie Earl, Jim Marin, John Anderson, Doug Bookie, Paul Smiley, Karen Kendall, Wrangler, Stella Losky, Troy Howell, David Dodson, Wendy Schneider, Rebecca Shiles, Allison Brown, Annie Ricks, Dawn G., Renee Becker, Daisy Buchanan, Lori Ziegers, Karen Neinhold, Jamie Stewart, Sabrina Smith, Anonymous, Carrie Pruitt, TM, Susan and Craig Lemons, Polly Jeffrey, Kristen Edis, Aaron Atkinson, and Heather Toole.
Thank you very much, JJ, and thank you as always for keeping track of all of these, for managing the responses, forwarding them on to us, and cataloging them on our homepage. It is always important to us to have this level of engagement. It has particular importance at this time, and we just really appreciate your handling of all of these public comments for us and the work that goes along with that. All right, I think I will look to my fellow trustees before we get into our decisions for this evening to see if anyone has anything they'd like to say. Trustee Simon Holland.
Thank you, Madam President. And I know that my colleagues will probably have other thoughts. I wanted to be able to share my thoughts all at once before we got into the individual actions on decisions, and just share my thought process with the folks who are listening. I appreciate the tremendous amount of work and thought that has gone into this planning. I know that many folks in the public have not been fully aware of the intense amount of detailed complexity that this team has dealt with, and I just want to compliment the entire district staff, as well as the families and the students and everyone who's given us input that has helped inform our thinking and helped inform this planning. So I want to thank everybody first. And second, I want to say that I agree with the superintendent that school is about much more than academic content. School is about safety and psychological and emotional growth, and building a sense of self-efficacy among students, and food security. It's about developing relationships that sometimes can last a lifetime. I do understand that we're in a very risky time, and I'm sure I am joined by my colleagues in calling on every person in this county to practice enhanced safety measures to reduce this risk. As has been said by several folks tonight, we all have to make that happen. But that being said, I believe that elementary schools should go back to full-time in-person with all the previously approved safety procedures, with the parental option for full distance learning, because the preponderance of available data shows that children up to around the age of 10 are far less likely to either become infected or to transmit the virus to adults. And their needs for in-person learning far outweigh the risks. Based on comments from Dr. Trudy Larson and other experts who are familiar with the needs of children, I have to say, in my assessment, the majority of emails we've received from local doctors support our students going back to in-person school. And because of the information we know from Mr. Dick and others, I believe that middle schools and high schools should open with full-time distance learning based on the research that shows that students aged 10 to 19 become infected and transmit at similar rates as adults. And currently, as we know, we're far above the 100 cases per 100,000 threshold identified as desirable for controlling community transmissions. There may be exceptions for middle schools and high schools, maybe such as Gerlach and Incline, that the superintendent can evaluate. Research shows that the greater risk is from adults transmitting it to each other, so we must rigorously implement decisive action at all Washoe County School District facilities to mandate proper safety procedures to reduce the transmission to and among adults. I believe that teachers should teach from school sites in whatever model is decided for their school level, because it enhances the rigor of the academic environment the students need, and it presents a dedicated, disciplined example for students. I believe, in response to the letter that we received from some of our unions, that a 9-week delay is arbitrary and has no basis in science and would be bad for our children. I believe that vulnerable populations, as previously defined, should be prioritized to return to in-person school whenever possible, because we've been provided information and input attesting to the particular importance of in-person relationships to the education of our vulnerable populations and the higher risks to their safety and well-being if they're not physically in school. And if principals need to make exceptions, they should work with the district to develop consistent guidelines for exceptions. I support rigorous, standards-based, grade-level appropriate new content for distance learning as described in the staff presentation, and I support letting teachers develop their own lesson plans that are consistent with the Nevada academic content standards. I would like to see further planning on what the thresholds of rates of infection, et cetera, would have to be to cause us to either go to full distance learning for elementary schools or return all students to either full in-person or hybrid learning. So I think we need to talk about what the future thresholds might be for those decisions. And I will say I'm seriously concerned that all students won't have access to technology to fully and equitably participate in distance learning. It's a huge concern for me. I'd also like to see us provide some training for parents on Microsoft Teams, et cetera, so that those families who wish to support their children will have more support from us. So those are my thoughts at the moment, and thank you for enduring my long discussion here. I appreciate the opportunity, Madam President. Thank you.
Well, thank you very much, Trustee Simon Holland, for your words. And we did not have to endure anything. I didn't catch exactly when everyone's hand went up, so I'm going to say we'll go first to or next to Trustee Minetto, then Vice President Taylor, then Trustee Kelly.
Thank you, Madam President. I've seen studies that show that I'm very concerned for our children's social and emotional well-being. I'm concerned about the suicide rates. I mean, Nevada is one of the highest in teen suicide. And I see the American Association of, believe it or not, we have an American Association of Suicidology says that Nevada is 11 in teen suicide. That's just, and then an Oxford study kind of showed that isolation can lead to depression, which naturally can lead to drug addiction, and it can lead to suicide and anxiety and depression. And I think there's an element of numbing going on. I know I feel numbed every time I turn over the calendar. It's like, oh, another month's gone by. And, you know, because I feel like our lives have stopped. And we need to be living. The CDC does say, you know, we've all read a lot of that, and that the children, at least last I read, seem to have not as severe cases and don't seem to carry even the stuff up in their nose that they can sneeze out on people as much. I worry about equity. I worry about children living with disabilities, and if they're not, and minorities, because the CDC says that separating them out harms them, and we just can't do that to these children. Jen Van Trest said all the situations with the IEPs and getting the children qualified for the IEPs is, I know she'd be able to do it, but just the overwhelmingness of what she said was just beyond what I think she needs to do. I believe people need choice. I believe that we're social beings. I'm very concerned about our children not having advocates to, as a teacher, probably everybody on here who's taught, we've had to take our role as mandated reporters and say, something's not right in that house. This child's not being treated right. Who's going to do that now? And I understand that abuse at home, violence in the home is up. I think the children need to be in school. And I think what we have established on the 7th was a really good plan. And I just feel like that's what we need to do. I also feel like it's hard because if there is a light at the end of the tunnel, it's very tiny and far, far away. And I think we just need to, the kids just need to have some hope. Thank you.
Thank you, Trustee Minetto. Vice President Taylor.
Thank you, Madam President. I will, at risk of, I don't want to repeat anything that's been said because I know it's late. I'll just refer to some of the comments, but I would be remiss if I didn't acknowledge all the incredibly hard work that's been done by the team in the district throughout this summer, getting things ready, regardless of what's going to happen. As things shifted last week, as things shifted in July, as things shifted. I mean, you've been very, very resilient and worked extremely hard through all of this. I can't imagine the kind of lift that this has been. This is a very large enterprise. We have 64,000 students, probably more importantly than anything. We have 8,000 teachers. We have 104 buildings. We have a $750 million budget in most years. This is a big enterprise. It's a huge shift. So just acknowledging, I really want to thank those, as you can see by the list of emails that we got. I really want to thank those that took the time to email, and in particular, those in their emails that certainly advocated for their cause, but they said, I know this is a very difficult decision for you. I know you guys are doing your best. They just acknowledge this was a tough place. I appreciate that. Those of you that recognize it, and I shared it, because this is a huge, huge decision that we know will reverberate across the community. Just a few notes again. I don't want to repeat things. I want to thank Mr. Dick and the health district, his colleagues that was here with him. They both, I think, did a tremendous job. One of the things I've learned in this process through my own research and then the research of others is that there are a lot of experts out there that have really strong opinions on either side of the issue. And we have some very passionate people that made sure that we saw all of the data and the charts and the videos and all of those things that were sent our way. So I certainly want to acknowledge them, and certainly Dr. Trudy Larson, who weighed in herself. I appreciate that work. One of the things that Mr. Dick did say, because it's hard to land someplace because you have so much of it from all over, did say that I think was important is that he did include that having in-person instruction, which is where I'm going to land on this to get to the bottom line early, up through 5th grade was something that seemed to make sense to him. And I grabbed a hold of that because I thought that was just an important point that many other experts have weighed in on as well, including the CDC. So as I look at some of the information that came from the Washoe Health District, I am concerned about the numbers like everyone else, as we should be. I'm a little disappointed in our community, frankly, because I just know that we can all come together and regardless of what's happening at school, help the numbers go down. So based upon CDC recommendations as well, based upon data that we know that we've had based from our research, as well as from the emails, the majority of the parents that we've heard from, the majority of the doctors that we've heard from, the majority of the students that we've heard from, and a lot of the teachers that we've heard from want to get back to school. I've said this to many and I'll say it again. I believe all of us as trustees want nothing more than to get back to school as normal as we possibly could. But of course we have to do so safely. I will add that a big thing that sticks out with me in this is also the equity issue. It is important that when we say all, every child by name and face to graduation, that's every child. And it's not the fault of a child if they don't have a device or don't have internet access or anything like that. It isn't their fault. And it's our responsibility to give every child the best opportunity we can to be successful. And that's equity is a big issue, and it can't just be something we talk about. It has to be something that we support and line up when we can do so and do so safely. The number one responsibility I see as a trustee, I see my number one job is to keep people safe. Certainly that's physically, that's also emotionally, and socially, educationally, and economically, and all of that in terms of our people that work and our teachers and so on. And I take that very, very seriously. Something I was looking for throughout this whole process is the opportunity for parents and families to have choice. And I think that's really, really important because there is some very passionate and certainly valid. Not that I can even give value one way or the other. Reasons for not sending your kids to school or not wanting to, not participating because you have a vulnerable condition yourself, whatever the case may be, there's choice. And I think that's really important, to allow families to make that choice for them, for their students. The choice is gonna work best for them. And I think it's really important as a district that we support them in that choice every way that we can. As we have staff members that are from a vulnerable population, let's support them. And I know that work is happening with Emily and her team, and parents that want to choose to keep their kids home on getting the devices and the Wi-Fi, and having a group of teachers that are part of the distance learning program. So those students that are at home are not being left behind. All of that matters, but it's important to note that there is choice. There is choice. I know that this decision, no matter where we land as a group, is not gonna make everybody happy. I know that, but I think this is a place for us to be, in the best interest overall for our students, our staff, and our community. And so I will line up behind K-5 or pre-K-5, as Mr. Dick recommended, to be in person, and then the hybrid model for both middle school and high school. Thank you, Madam President.
Thank you, Vice President Taylor. Trustee Kelly, and then Trustee Cottle.
Thank you, Madam President. I think that everything I'm about to say is right in line with Governor Sisolak's directives from the Nevada Department of Education, our medical advisory team, all the things that they've been talking about and recommending to us. But I also think it's in line with what the community wants and what the community hopes to see for its students going to school. I do think that the plan the school board adopted a couple weeks ago is a good plan. And just to kind of recap broadly, I mean, that plan was elementary students coming back to school in person, and middle and high school students, half of them going to school for a week while the other half distance learning, and then they swap, so a hybrid plan. And I think that plan it was a good plan and is still a good plan because it's not set in stone. You know, it's a flexible plan. It's nimble. It takes into account all these directives that we are receiving from above us, from higher above us. And it's looking at all the concerns and all the little details, all the hundreds and hundreds of little details that can make a plan work. And what we approved a couple of weeks ago takes all that into consideration. And I think that's important because just look at what's happened in the last week or two. You know, we have been seeing COVID-19 cases increasing a little bit. We've seen numerous emails from staff that have said, okay, this is what you've approved, but we see issues, we see gaps, we see things that need to be fixed. And I think that our leadership team has done a very good job and has worked very hard to address a lot of those concerns. But I feel that there's still more work that needs to be done. And it's an evolving plan, and I think that's important because this virus changes, the situation changes, we have to be able to adapt with it. I've been taking notes throughout this meeting, and I think my statement from here on out is just gonna focus on three main stakeholder groups, which is the community, our staff, our school district staff, and then the students. So I wanna start off with our community. And I wanna say how impressed I am with just the sheer volume of emails and people just reaching out to the school board and then to me to express their opinion. And their opinion in almost all cases was backed up by very personal stories, concerns, criticisms, and other things. And so I really appreciate that from the community. And I think that, as I've heard before, it's the community wanted options. They didn't want a one-size-fits-all plan. They wanted options so that if they felt really good about the school district and what we were doing to keep people safe, then they would feel comfortable sending us their students. But if they weren't at that point yet, and if they had medical concerns within their own family, somebody had underlying conditions or whatever, that they could go to distance learning. So I like the fact that the community told us that, because I believe that the plan that we developed 2 weeks ago has those options. I was impressed that I think we received 2 separate petitions. So one constituent sent the school board a petition, I think it was yesterday, that was signed by more than 2,000 people. And I spent some time looking through this petition, and I recognized quite a few people, and I did some spot checking. I checked on social media, and I went to the assessor's office, and everybody on there was like a real person. And here's 2,000 people saying they want students to be able to go back to school, but they also want a better distance learning option than what we had given in the spring. And so I just thought that that was really important, that the community very, very strongly felt that it was important that elementary students go back in person, and that middle and high school students have that ability to go to in person, but also distance learning as well. I want to move on to our staff, because I feel that I heard from a lot of staff that they were excited to get back to school, that they missed their students, that they wanted to be there for their students and teach, and they felt comfortable with what the school district had proposed. But quite a few staff still have grave concerns. And I really hope that the superintendent and her leadership team realizes that our staff is not fully on board yet. They're really concerned. They're not just concerned, a lot of them are scared to death. And I hope that that our superintendent and her team continue to work on this plan, work on it, get personal protective equipment into our facilities, work on the policies, work on the procedures, because we need our staff to be on board. I know that what our school district has been doing, it's right in line with what the Centers for Disease Control Prevention say needs to happen. Everything from displaying reminders and education materials to wash your hands with soap and water, to be able to provide face coverings and hand sanitizer, the ventilation systems that are constantly circulating air. All those things that we're doing are in line with what the CDC is saying, but our staff wants more. They want to see more specifics, because there's still quite a few unknowns that are out there. But I do want to say to our staff directly, our bus drivers are important, our counselors are important, our food service workers, our custodians, our principals, our teachers, you are all very, very important. What you do is important to the community. And there's a lot of people in the community that are counting on you to come back to school. And if for whatever reason you don't want to come back to school, you want to support students in other ways, distance ways, that they want you to do that. But I think the most important community that wants you to come back is the students. Our students, they need you, and they miss you, and they want you. And our students have, they've gone through so much the last few months, and they've gone through a lot without having had you there with them. Or you've been there, but it's been distance, and we all know that's not quite the same thing. So I really hope that staff, I hope that you consider coming back. I hope that you realize that the school district is working really hard to make things as safe as possible for you. And then last but not least, I want to talk about our students. I know that we've gotten some emails in the last few days from students. I'm hoping that even though it's a late hour, we have quite a few students that are watching this now, because really what this is all about is making things safe so that students can resume their education. We've heard it before from other people that social and emotional skills are perishable, and they degrade over time. And we've had students now that have been away from school, they've been away from their counselors, they've been away from many, if not most of their friends. And I really worry about the effect that being away from school is having on our students. 6 months is a long time, and I just can't imagine having to add another 2 or 3 or 4 months to that. So I think that it's important for our students to be able to come back. I think that they want to come back. They want their teachers and staff to be there for them. So for all those reasons, I mean, I could go on and on, but I think for all those reasons, I support I continue to support the plan that we developed a couple weeks ago. And that's what I'll be voting on when we get to that point. But again, I want to just thank everybody for chiming in with their thoughts, their ideas. I feel very informed, more so than I did a few weeks ago. And that's kind of where I stand right now. So thank you.
Thank you, Trustee Kelly. Trustee Cottle.
Thank you, Madam President. First, I just want to express my gratitude to staff for all the work that has been done, not just over the past couple of weeks, but since March, once we were put in this position. Thank the community for giving us their feedback, and thank our staff all across the district. As a product of a public school teacher, my mother's taught for over 30 years. You know, over the past few weeks, it's been heartbreaking to see so much hate on social media towards our teachers. And I would just plead with our community to show love towards our teachers. It's okay for them to be concerned. We're all concerned. And we just need to stop with all the nonsense on social media and show love towards our staff. As I look at our decision today, I can't support going distance learning because in distance learning, kids get left behind. And it's not the fault of the school district. It's not the fault of teachers. It's the nature of distance learning. There's inequities. Our students from low-income families and working class families, they get left behind in distance learning. Students in vulnerable and at-risk populations get left behind, as well as special education students. Back in the spring, on average, the school district could not touch base with 3,200 kids on a weekly basis. That's our average. Kids got left behind, and it would just be so hard to move forward knowing that not every student would be given the same opportunity for distance learning in our schools. And we're seeing some of the trouble that comes with distance learning down in Clark County. Clark County is an extremely different situation than us, and I understand that, but we can take lessons from what we're seeing. Clark County is trying to find buildings where students can do their distance learning, but they can't use the schools. Clark County is looking at busing kids to school so they can eat because they aren't going to get the food at home. They're trying to find these solutions because in distance learning, kids get left behind. We've received so many recommendations, whether it's federal, state, local, and it's hard to really land on the right decision because the recommendations differ in many ways. But what I come down to is that the governor does not want to be involved. He has authority to close our schools, and he doesn't want to be involved. He was asked the question last night in his press conference. The health department said on multiple occasions the decision is ours. The health department possesses the authority to close our schools in the event that they feel it's necessary, and they stopped short of doing that. They left it up to us. While the school district needs to be prepared for distance learning in the event that a higher authority mandates it, until it's mandated, we have to think about all of our kids. More choice for parents will equal more opportunity for educators. We will need educators for distance learning because parents will go distance learning. I would encourage parents to opt for distance learning if they have concerns. I appreciate the dedication by everybody involved. We have to remember that this process has been extremely transparent. The reopening task force of 70 to 100 members made up of staff ranging from teachers, principals, district staff. We had parents, we had the business community, the faith-based community, medical experts, and representation from the Washoe County Health Department. So we're here today just to make sure we've made the right decision. And while no decision's perfect and it's going to be hard to please everyone, moving forward as a plan that offers choice so we could be ensured that we're going to take care of our vulnerable population, to me, is the best way to go at this time. So thank you, Madam President.
Thank you, Trustee Cottle. Trustee Calvert, would you like to say something? You're on mute.
So anyway, I'm like you, everyone else. It's really a very difficult decision. Like everyone else, I've heard a lot of different things, and it is hard. And our kids definitely do need to go back to school. I totally 100% agree with that. And how we do that in a way that's safe and equitable for all of our kids. I do agree that Ms. McNeil and all of the other staff members have done the best that they can do with the information that they have to move the situation to a place where our kids are able to get an education. And my concerns are at some point in time, the mental health of our children. How do we address that going forward? Because we know that we're going to have fatalities from this as far as them being out of school, being away from their friends. And there are kids that have enjoyed the distance learning. And like Ms. McNeil was saying, I've seen the kids with the little mask on, and you know, it's hard, it's difficult. And I just believe that we should move forward and go ahead and put these kids back in school. And if it does mean that we have to go back to distance learning, I totally understand and I get that. But I do agree with everyone that we have to make this as equitable and as safe as we can, not only for the teachers as well, because I agree they have gotten a lot of grief, and it's not anything that they personally have done. It's just a situation in which, I mean, I don't know. It's just really hard, I think, for everyone to come to, I mean, it's hard. It's been really hard. So I just feel that we have to do the best we can with what we have and do what's best for our students. And if that means putting them back in school, and if they have to come back out again, then they just have to come back out. But I do believe we need to do what's best for them.
Thank you, Trustee Calvert. I just want to briefly share my background and how I'm coming to my decision this evening. And then I know we have some actual decisions here to make. You know, I think it was reiterated in the governor's directive tonight, and it's something I know we've all been aware of before this pandemic even, that schools are essential and our teachers are essential. And to me, that means in person. And it's not just for the academics, as we've talked about. There's just so many more elements that come into play when we talk about our students and our staff being in the building. I think for me, what I look at is, we know the pandemic comes with so many unknowns, and we covered that with our health district presenters tonight, that you know, there just aren't enough definitive studies in all these different areas. But I think the evidence that we do have supports our decision to keep in-person, full in-person learning for our elementary students. And for me, it's more about the risks that we know that exist outside of school for our students if they are to be in distance learning. You know we have homeless students. We know we have students that face food insecurity, and that school is that safe place for them. There's our students will face the possibility of being left home alone if we're in distance learning, I believe, because parents aren't going to be able to make that decision about, you know, taking time off to be there to sit with their young student. I think another issue that's been mentioned is that equity issue. It's huge for me. You know, my daughter will be fine. Many of our students will be fine, especially those whose parents can hire tutors or can bring in outside help to sit with them, hire babysitters. And for those students that don't have those resources, it's possible that they'll end up in, similar to what Trustee Cottle was mentioning, in some sort of a safe online learning center, where they're just going to be exposed to each other in a different location. And so I see an opportunity for us as a district, and I believe we can do this, where schools can be one of the safest spaces in the community for our students and staff right now. We are taking such great steps to make our classrooms safe and our schools safe. And I think about our students that, might be home alone, again, might be facing danger, but also that might just decide it's more fun to go hang out with their buddies. And so they're all congregated somewhere where when they're in our buildings, we know they're wearing masks, we know they're washing hands, and we know that they're safe. So for me, it is an absolute priority that we stick with our decision to have in-person for our elementary schools. And for me, that is elementary school, not just the pre-K through 5, because I know we do have elementary schools that still have 6th graders. But I do want to, when we get there, just talk a little bit more with my fellow trustees about the decisions for middle and high school. I feel similar to Trustee Simon Holland mentioned at the beginning that we do need to, I think, make some considerations there about what's the right step forward. So I think we've all had our moment to speak, and so I think we can go to, and I don't know if we want to pull up the slide again, JJ, but we will start with elementary schools. And based on what I think we've heard, that might be a relatively easy one to address. And I will ask, oh, there you are. I couldn't find you, Superintendent McNeil. I don't know if you have at this time anything you'd like to add or cover before we consider action on this item.
No, I just really appreciate all of the comments and the deliberation that the trustees have said. I've continually stated that I truly believe that our trustees are taking everything into consideration, all of the data, all of the comments. It's a huge lift. I mean, every single email I think that we have received is nobody wants to be in your chairs. And so I truly appreciate all of the deliberation that you all are doing. And we'll walk through each one of the motions. And that's up to you, Chair Raymond, as far as if you would rather do elementary separate and then secondary, but I'll leave that up to you. We have 3 slides, the elementary, the middle, and then the high school.
Well, I think it makes sense if we want to discuss each area separately. So if we would like to start, I know we each made a statement relative to elementary. I see Trustee Simon Holland's hand is up.
Thank you, Madam President. I see Scott Kelly's hand is up also. I don't know, Trustee Kelly, if you wanted to go first.
I mean, I could, if I don't mind making this recommendation unless you wanted to.
No, go ahead. Go ahead.
Okay. I recommend that the Board of Trustees reaffirms the July 7th action for elementary education.
I'll second, and then we can discuss if needed.
Okay, I have a motion by Trustee Kelly and a second by Trustee Simon Holland. Is there any discussion on this? All right, all those in favor, please signify by saying aye.
Aye.
Aye. And any opposed? So that motion passes unanimously. And we will move on now to the middle school slide. So I'll start with this one and kind of where I'm, sitting with this. I think, as was stated in, I think our district health officer, Mr. Kevin Dick, mentioned it. It was in Dr. Larson's letter, and it mentioned in the Harvard study and many of the recommendations that for me, middle school is a sort of a next level of priority after that elementary school. I think it is important to get those students back in the building as soon as possible. And I guess where I'm looking for some discussion with my fellow trustees is about that, what their thoughts are, and I just want to make sure I heard everyone. I know some people were talking about different ideas for different levels. So I will start with Trustee Simon Holland and then Trustee Cottle.
Thank you, Madam President. I did say in my remarks that I believe that middle school is different. I think we have research that shows a higher incidence of both infection as well as transmission among that age group. And I am respectful of the statistics we heard from Mr. Dick. I was alarmed to hear that the incidence of cases per 100,000 has risen to 240 when we are looking for that case incidence level to be 100 or fewer per 100,000. So for me, because the middle school age group is more similar in the adult level of transmission and infection, I do think they should be treated differently and be in full distance learning until we can get those transmission rates down. The CDC and the American Academy of Pediatrics both have said, yes, we need to return students to school, but that depends on controlled levels of community transmission. And I would argue that at 240 per 100,000 population, we don't have a good level of control over community transmission right now. The studies we've seen internationally have related to, again, schools being opened when there are lower levels of community transmission. So I would not be in favor of reaffirming the July 7th action for middle school education at this time until we can get closer to the 100 per 100,000 population case incident and the lower positivity rates for testing.
Thank you, Trustee Simon Holland. Trustee Cottle.
Thank you, Madam President. Today, as we know, the governor allowed through 8th grade the social distancing to be 3 feet. However, I do think that the hybrid model for middle school is still the best way to go, even though some would say that with 3 feet, you could put more kids in the school. I don't think that is the best way to go. Hybrid allows the kids to be in the school, but it still allows plenty of social distancing to be available. And the model that we passed on the 7th allows full distance learning for families that would like that option. And I would encourage families to take that option if they feel the need. My reservation with full distance learning is we have a lot of middle school kids that especially in areas I represent that are, I'm concerned that we're going to lose track of them during this time, and that's going to be an issue, and it's hard for me to get past that. So that's where I am. Thank you.
Thank you, Trustee Cottle. Trustee Minetto.
I feel that the hybrid model is the best for them, for the kids, because as Trustee Cottle said, there's an element of kids who just won't go to school, and sit at home and play games. And then there's also the social, emotional, and the equity issue of how do we teach successfully without being with them. Thank you.
Vice President Taylor.
Thank you, Madam President. Excuse me, I believe I said this when I gave my opening comments. I actually just talked about all three. I do believe that the right action step is to remain with a hybrid model. And for me, primarily, I am absolutely concerned about the numbers. And really, I'm with my colleague, Trustee Simon Holland, and that community transmission rate is much higher than I'm comfortable with. I think that's for me, it is something that I believe that in the schools, these students are a little older. I think we can have a higher level of expectation for them to, follow the protocols, regardless of hopefully everyone will be practicing at home now. But even if they aren't, and my primary concern is to use Trustee Cowell's phrase, is the students that will be left behind. There's a large portion of my district where students will absolutely be home alone and may not be in an environment that will really support their ability to take the steps that are necessary. And I know there's a great plan in place from the district to track these students and reach out to them and so on. I think these students as a whole will do better if they're in the classroom every other day. And as I said, I think that from a safety standpoint, that we can have an even greater level of success in keeping these students and teachers and staff safe in that environment.
Thank you, Vice President Taylor. Any other thoughts at this time? Trustee Kelly.
No thoughts to add. I was just I'm prepared to make a motion and we'll just kind of see where it lands, unless there's any other comments from other trustees.
I would maybe just add that one of the things that's sort of swimming around in my head is, that we don't know where we'll be in 2 weeks. We don't know where we'll be in 3 weeks with our numbers. And, I think we've all expressed our feelings about the priority level for elementary education and have taken action on that. But looking at our middle and high school levels, I do wonder about some sort of a criteria or a threshold. And I'm not, I am not necessarily saying that it has to be that 100, but I'm wondering if we do put some kind of criteria around this, because if we're, another 2 weeks down the line here, and we do hit a different number, higher or lower, we don't necessarily need to have this meeting over again a third time on August 11th. And so, I want to try to find a way where we can set some guidelines for our superintendent so that she knows sort of where those critical points are for us. And, I think we were given a sense from the health district, what they're looking at, it does seem to differ from what the governor's metrics are. And I think he might even be coming out with different metrics later this week or next week. I might just ask our superintendent, Dr. McNeil, if she has any thoughts around that, if there's anything that she would feel comfortable with, or are you comfortable with reopening? I know you have stated that you're not in favor of distance learning. But...
No, and I appreciate that, President Raymond. you know, a thought could be as far as for middle school, and then when we get to high school. Middle school for me is one of our top priorities. I mean, I really do have significant concerns with that age group and not having them somewhat in school. And so, you know, taking a look at the metrics and whether you use the 100 cases per 100,000 to get to that metric. And, you know, it could be such that if by August 17th, we are at that level, and if numbers have increased, then middle school would go on a full distance model. If numbers decrease or they stay the same, that we start our middle schools on the hybrid model. My concern with the 3 feet is I know we can do that in our elementary schools. I absolutely know that we can do that. And I appreciate that. And I also appreciate the fact that that translates for transportation as well too. But knowing that, I would recommend that we take a look at that metric, and if the numbers have stayed the same or decrease, we start the hybrid model for middle school, and then if they have increased, that we would move to the distance learning model for a particular period of time. And whether, you know, you give the superintendent the authority to make changes on the models depending on those metrics, but that's something to consider.
Thank you, Superintendent McNeil. I do like that. I think that gives us, as a community, it gives us a goal to work towards. You know, we do need to work together, not just to reopen schools, but really for our own well-being, to bring those case numbers down. And I think it helps to provide some level of transparency to the public about when that decision would be made and how. So I think I do support that idea. Any thoughts from anyone else? I know Trustee Kelly, you were about to make a motion, so we can start there if you're ready.
Well, I mean, yes, I would make a motion. I'm just trying to think if there's a way it would be a 2-part motion then, to reaffirm and then to ask the superintendent to work on a threshold to bring back to the board. So I'm just trying to think in the top of my mind. So I'll take a shot at it, and we'll see if you know, if the trustees like that motion, if I get a second, if we vote on it. So
okay, I just quickly want to check. I thought I heard Superintendent McNeil saying that for her it is that where we are today at that case number or below, that's her threshold. Is that correct, Superintendent McNeil?
Yes, correct.
Which was the 240.
So then if that's the case, so we already have a threshold and then we don't need her, the superintendent, to develop one, correct? Okay. Then yeah, I can make a motion. I move that the Board of Trustees reaffirms the July 7th action for middle school education, and that the superintendent establish the threshold that would warrant middle school going to distance learning in the future.
Okay, and she did mention, and I don't know that it needs to be part of the motion, that we do sort of need a cutoff of August. I'm sorry, I should have asked for a second. So we have a motion. Any second?
I'm Madam President, I'm uncomfortable with setting the threshold that high, just personally. When, you know, CDC and others have given guidance that 100 per 100,000 is a safe threshold to bring kids back to school. So that's why I'm not providing a second for this one.
Vice President Taylor.
Thank you, Madam President. I was going to suggest that we actually have a goal threshold that's better than the 241. I just think that is, I mean, that's almost 150% higher than the guidelines. I mean, I'm comfortable being over that to some, but I think if we're going to actually establish a number, I would like it to be a goal number, more so than 241. And that makes, if we're going in this direction, and if we're going to give it to the empower the superintendent to make the decision, I would want it to be one that was lower. And I don't necessarily have a number in mind, but I'm just not comfortable with one that's almost 150% higher.
Yeah.
Okay, so we had the motion and I don't see a second. And I apologize, Trustee Kelly. I didn't mean to send you down that path.
It's okay. I mean,
so that motion fails. I don't know if we'd like to have some more discussion. I was going to try to quickly look up and see where we were on July 7th when we approved this the first time. I know we weren't thinking in those terms at that point. I don't know if anyone else has an idea of a threshold number. Trustee Cottle.
Thank you, Madam President. My only concern with the threshold is the risk of going back and forth. And we're hybrid, distance learning hybrid. And if we don't, we would have to put in other guidelines on the time frame to switch back and forth. And honestly, I is my opinion, for everyone who may disagree with whatever we do, one thing they would probably disagree with you more would be going back and forth. I would say people would just want us to decide, and then they would adjust to it. But the idea of having to check every Monday to see where we are to determine what we're doing that week would be an extreme hardship on everyone, the district, parents, teachers, because everyone will have to wait for a number to determine. And that's a hard, I think that would backfire on us pretty significantly, and we would want to walk that back because the number could change. If there's one issue at one casino, the number could change, and then we're changing all middle schools across the whole district. That would be hard. I'm not against the threshold, but we're going to have to think about it more in depth and how we put it together. So that's my 2 cents on it.
Those are good points. Thank you, Trustee Cottle. Trustee Simon Holland and then Trustee Minetto.
Thank you, Madam President. I want to disagree respectfully with my colleague, Trustee Cottle, somewhat. I think that we've all heard that it's important for us to be flexible and to be nimble. I don't think we should be going back and forth on a weekly basis, but circumstances could dictate that we change our course. Whether that's we look in a quarter at the, what's the 14-day rolling average in the next quarter or some period of time. I think we are obligated to look at changing circumstances because we are impacting the health of the community by these decisions, and the health of the community can change. I agree that we don't want to be flipping back and forth, but I do think part of our decision ought to include a reevaluation of all these models at some point in the future. And again, not on a weekly basis, but we do need to look at the current conditions at some interval, in my view.
Trustee Minetto, sorry, your little blue hand melded into the background.
Oh, thank you. Yeah, I struggle with the threshold thing, unless it was a matter of, like Trustee Simon Holland said, that perhaps it's like at the quarter where we look at it. Because if it goes too high and we, don't you think that the health department will say this is what needs to happen without us having to? It would be terrible if that happened. But yeah, I don't mind the threshold if it's like in a reasonable amount of time, I guess is what I'm saying. Thank you.
Thank you, Trustee Minetto. Well, I think, you know, the more I think about this one, I do think that, you know, as Vice President Taylor said, we've worked really hard on this plan. I think we've made a lot of decisions that consider the safety of our students and our staff in this model that, you know, we really would be looking at almost 50% capacity in these middle schools, and with the masks and distancing, you know, I feel comfortable that this is a safe model, and believe our numbers will be lower by the time we get to that point. So I'm comfortable with the action to reaffirm at this time. Vice President Taylor.
Thank you, Madam President. I was going to say, you know, I do think that Trustee Cottle made some really good points in terms of we don't want to jump back and forth, and I would agree with that. We don't. But I do think I'm going to also agree with Trustee Simon Holland. It is our responsibility to pay attention to the numbers. We just don't want to do it with the same kind of frequency that Trustee Cottle referred to. You're right. I would agree we don't want to, but I think that if we don't leave ourselves in a position to be responsive to the data, what we know is happening in our community, then we're just like writing this thing out. And then I think we're being irresponsible. So I don't, you know, I think that we should just know that we're going to pay attention to what's happening in our community, and at when appropriate, we're going to adjust. The phrase "be nimble" has been used quite a bit tonight, and that may mean opening things up even more, and that may also mean restricting things a little more, based upon what we're seeing. So as I considered, you know, I don't mind having a threshold. I think that might be counterproductive, because it could be something that kind of ties our hands in the future, and we want to always be able to be nimble, and be able to be responsive. I think we'd be irresponsible if we don't leave ourselves that kind of flexibility.
All right.
Alina, can I ask a question?
Absolutely.
So how often would we address this, or would it be on when we reach that threshold? Is that a time when we would adjust it?
Well, I as one trustee was actually thinking, and it's not for us to consider, I think, in this moment, but I'd like to suggest that during this meeting that we make a decision, or that I'd like to ask that we consider you know, at some point we just need to give the authority, I believe, to the superintendent to be able to determine, you know, when we are moving from one model to another based on those numbers, and based on recommendations from the health district, because we can't, as a board, react quick enough to call a special meeting or to gather as a group. And so, again, not for maybe the decision to be made right now, but I do think at the same time, we would, as a board, I would want to have regular updates and information about how it's going and what the, you know, how the models are working. And I don't, again, that's not weekly, and that might not even be at every single board meeting, but, you know, I don't think we need to have this agenda item to consider the 3 models that were submitted to the Nevada Department of Ed at every meeting, just to be sure that we can, you know, move if we need to. I think we do have to, at some point, give that authority to our superintendent to decide. Trustee Benetto and then Trustee Cottle.
Thank you, ma'am. I do agree with you. I believe that Kristen's really the one who needs to make the call on this. And even if we voted on doing it exactly the way we planned, it doesn't mean that, well, that's the way we have to do it forever. Because, you know, in 5 weeks, it could be different. And Kristen could say, you know, our numbers are too high, we got to do something here. And which would make sense. So yeah, I'm kind of don't like us doing the threshold thing. Thank you.
I don't know, Trustee Calvert, I shouldn't have moved on so quickly. If that sort of answered your question, I wasn't trying to answer necessarily your question. That's just my kind of perspective. And I don't know if the superintendent has any more to add to that response.
Oh, thank you, President Raymond. I think part of the issue is the, you know, we keep using the word, and rightly so, nimble, flexible, malleable, you know, and it's an entire organization that we're having to shift, and to be able to do that, and paying attention to what the metrics are. And I mean, you all know, you know, you hired a superintendent to make these decisions. Now, obviously, the consulting and those types of things, and always updating the board, which I do on a regular basis. But we have to be able to execute. We have to be able to make these decisions, and to make sure that we're getting to the point of the matter, as far as making sure that, you know, whether it's the middle school or the high school, that I can then, you know, execute on the plan. And I agree that some level of flexibility would help.
Sorry. Does that answer your question, Trustee Calvert?
Sorry. Yes, and I do agree with Ms. McNeil that we should give her some latitude or whatever she needs in order to move forward. If we do reach that threshold, I totally 100% agree, because I mean, maybe we can't all come together to help make that decision. So I think that if we give her the latitude to do that, that would really help. Thank you.
Thank you. Okay. Trustee Cottle, then Vice President Taylor.
Thank you, Madam President. I mentioned this earlier, I just want to point out that the governor and the health district both have the authority to close one or more schools in the event that there's an issue. So if the health department feels there's a big enough issue at one or more schools, they have the authority to close them without us saying anything. And so, and they've done that before. And so that can be the flexibility. And I have no problem giving Dr. McNeil flexibility, but what I don't want to look like is that we don't want to make a decision. So we just put it on her shoulders and make it for us. I don't think that's right. We need to make the decision, and we can give her flexibility, but the health department said over and over again today that it's our decision, but they have the authority to close one or more buildings if they feel it's necessary. So that can be I'm not saying we have to wait for that to happen, but that is available for us in the event that they feel there's an issue.
Vice President Taylor.
Thank you, Madam President. I was going to recommend that I agree with Trustee Cottle that we want to make a decision and so on. And for the two people that might still be out there watching, then they deserve it for hanging in there this long with us. You know, what if we did something? But I also think that in the midst of giving Superintendent McNeil some flexibility, at the end of the day, we're still responsible and accountable for it. So perhaps what we can do is ask staff to bring us some kind of gauge in that to our next meeting. We take a look at the direction that we want to take tonight, and then we make as an agenda item. That way we have a little more opportunity for staff and ourselves to become informed, a little more informed about where should those numbers be? What should that be? A range? You know, what will be the influence, the input from the health district or even from the governor's medical team? And we come back and we make the decisions now, but how with that nimbleness or nimbility, yes, I'm sure I just made that up. I see you laughing, Trustee Simon Holland. You know, see what that looks like, because we all agree there should be something in there, but we also agree that we should be the ones to set it because it's our responsibility, but then we don't just fly into it without really being informed about it appropriately.
So just to reiterate and make sure I understood it, your suggestion would be we make the decision tonight. The request would be that then a future agenda item would be to set sort of, or look at some of those criteria or thresholds, and that would be for all elementary, middle, and high school, or were you thinking one for middle, one for high school, elementary, we established sort of different?
Thank you for saying that, because I do think this is important for all three levels. And they should probably be, we should have the flexibility to make them different for all three levels, if that's what, you know, as staff spends a little time and it gives. I know all of us have probably done a ton of research on this over the past month. And I'm sure we'll do the same, because these are really important decisions. We can be informed around that, but let's decide on that when we had a chance to go into the meeting thinking about where we want to land. The thing I don't know where I would want to land, but I can tell you where I don't want to land is 241%. Or not percent, but you know what I mean. 241 per 1,000. Per 100,000. Yeah, that's it. It's late. You know what I mean.
Yep. It is late. We're on track to break our record. A 10-hour meeting.
But did I make that clear, Madam President? What I
did. Yeah, that helped me. Thank you for clarifying that. So, all right, are we ready then for a motion on this item? Trustee Cottle?
Yeah, I was just gonna move to reaffirm the July 7th action on middle school education.
And I'll second.
Okay, so I have a motion from Trustee Cottle, second from Trustee Kelly. Trustee Simon Holland.
Thank you, Madam President. I just wanted, under discussion, to say I too care very much about our middle school students, and I care very much about uncertainty for them. I know that having any of our kids out of school is hard on those kids, but I'm also persuaded by the expertise of Dr. Larson and another member of the medical advisory team who also made the same recommendation that middle and high school students, for now, during this high level of community transmission, not be in school because of the danger. So I'm going to be opposing the motion, but I have great respect for my colleagues.
Thank you for that, Trustee Simon Holland. All right, then I will ask for a vote on this item. I'll ask everyone to make sure they turn off their microphones. And so all those in favor, please signify by saying aye.
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 And any opposed?
Opposed? No.
So that motion passes 6-1. All right, then moving on to our high school. Okay, so, I think I'll just say for me personally that, I feel like I have the same feelings about high school as middle school. I think, it really is about the steps we've taken for safety. And so I support reaffirming this action for high school and for many reasons, but I think one that has occurred to me more recently is with the recent decision from the NIAA related to sports. I think for me, the consideration is so much about the mental health of our students and especially our teenagers. There's so much instability and change in their lives. And I think if we can try to have this hybrid model there for them, that is the best thing for our district and for our students. Trustee Cottle.
Thank you, Madam President. I just wanted to make this point real fast before we kind of moved on. I didn't mention before, and I should have, but I would like the district, at least I would encourage the district to make a good faith effort to get with our associations to discuss the sick leave issue, because we're getting so many emails about that, and there's so much concern out there that staff are going to run out of sick leave. And so I think that would be a really good thing for the district to take that step, to start the conversation of how do we ensure that our staff are taken care of this year. So I just wanted to get it out there before our last action. So I'll just leave it out there as just an encouraging point to staff. Thank you, Madam President.
Thank you. Any Vice President Taylor?
Thank you, Madam President. Before I make the point I was going to make, I'm just going to thank my colleague for putting that out there. I think that's really important, that we at least have some conversations and can come to some understanding. The thing that we don't want is we don't want our educators to think that all of our educators, any of our educators, I should say, that their safety is not important. I'm gonna, as I segue into my comments around this, I'm in the same position, I believe, as President Raymond, and that I'm really counting on the safety procedures and precautions that were presented to us tonight to keep everyone safe, but in particular, as we talk about high school, even more so, and middle school, because those are the scary areas for me, quite frankly, that those procedures are absolutely in place, and that if teachers have questions or issues or need more PPE, that those things are provided. And we were informed tonight that those things would be available and they will be responsive, because not only do we want them to be safe, we want them to feel safe. And it's going to be scary going in, and I certainly understand that. But how we go in, and as Trustee Kelly said, you know, there are mistakes that we're going to make, and as we adjust and respond, I think is critical. It's really critical during this time. We want to take care of all of our employees that will have these opportunities and these challenges in those classrooms. So I just wanted to say a little bit about why I will support this, but that it's a little scary for me too. I do think it's best overall for all involved. But I just want to make sure that we are absolutely responsive when it comes down to providing that safety support for our staff that was shared with us tonight. Thank you, Madam President.
Thank you, Vice President Taylor. Right, I would, Trustee Simon Holland.
Thank you, Madam President. Just again, absolutely am concerned about providing a great educational experience for our high school students, as all of us are. We want to get our kids back to school. We want them to have great lives and great high school experiences. I'm still just really nervous about putting all of those kids back into the buildings with the level of community transmission that we have. And I want to thank my colleagues for the very, very thoughtful and compassionate and professional analysis of all of these factors that relate to these decisions. It's very tough. This is a no good decision scenario that we're in. I would love us to rather be in a full distance learning model for high school education until we can see better numbers in the community and have the community work hard towards that. But I understand where it's going, so I respect my colleagues. But I thank you all, and I thank all of the members of the public who have shared their thoughts with us tonight. They've added a lot to our conversation, and thank you to everybody, and particularly thank you to the staff for the excellent work on the planning. I thought it was a great plan. The July 7th plan was an excellent plan until I was better informed about some of the data. So I know I'm outvoted, but I appreciate everything that's been said and all the thought that's gone into it.
Thank you, Trustee Simon Holland. Superintendent McNeil.
Thank you very much, President Raymond, and for all the conversation around making sure, you know, we have worked very hard to get federal guidance around leave and what that looks like. And we've worked hard with our federal delegation as well. We've worked hard to make sure that we can get that guidance out. It's not where it needs to be at this point in time. I mean, I know that we can probably do a better lift as far as getting information out to our employees, and you know, that's my responsibility, and we'll take that on. I do want to, you know, talk about the contact tracing and the testing program that was brought up today, because that has been a request from our associations that we do have a viable testing program. And it's not just one test, it's several tests, multiple tests, and the contact tracing program. I also want to reiterate the self-screening program, and that's a responsibility for our employees. It's a responsibility for our community. And Dr. Taylor stated earlier today, today, a couple hours ago, that we need our community to do a little bit better job. And so when we talk about self-screening, and for our parents to make sure that they are doing that screening for their students, and that if the child is sick, that the child stays home. If the employee is sick, then the employee stays home, and to get that constant communication out there. So I wanted to add that in reference to Trustee Caudle's concern.
Thank you, Superintendent McNeil. And actually, you brought up, and it, you know, it has impacted my decisions tonight too, that the commitment from the county and Chair Lucy and his commitment financially to make this a priority. I think he made it very clear in his public comment that you know, he sees this and the reopening of our schools as a top priority for the county as a whole, and as the chair of the LEAP panel, he worked to with the governor to work out some of the details around that. And so I appreciate that. And I think that does give me a sense of security in knowing that we can safely reopen. Okay, I would look then for a motion on this item. Trustee Cottle.
Thank you, Madam President. I move the Board of Trustees reaffirms the July 7th action for high school education.
Second.
Motion by Trustee Cottle and a second by Trustee Minetto. Everyone could unmute and I'll call for a vote. All those in favor, please signify by saying aye.
Aye.
Aye. And opposed.
No.
And that vote passes 6-1. Well, thank you all, and thank you, Trustee Simon Holland. I know how much you care, and I know that this had weighed heavily on you, and that your decision came with a lot of thought. So I appreciate your perspective. I was looking into and wanted to just call on our Chief General Counsel Rombardo. I think we learned that, or he knew all along, that we don't necessarily need to take action on the superintendent's ability to sort of shift course with our models. So I will let him go into greater detail around that.
Well, I think first of all, good evening, night. So under Board Policy 5625, the superintendent does have some leverage with regard to decision-making for the health of students. So I'm not suggesting that she can just ignore what was done tonight, because that would have been inappropriate. But if something goes wrong and numbers go sky high and the health department comes to her and says, we need you to shut down, or we need you to change something, that policy is clear that she is to work with the health department to ensure the safety of students. So at this point, with the vote the way it's gone, I believe that the board has said we are comfortable. We have found enough evidence to adopt school the way it is for the 3 different levels. And if something were to happen where the health department felt a change needed to occur, they could come to Dr. McNeil. Dr. McNeil could make that decision, and then she would bring it to the board at the next possibility, as long as we can get it posted and things of that nature. That would not fall under the emergency provisions of the open meeting law, but we could get it on an agenda within a week or 2, depending on where it would fall in our standard schedule. So I hope that at least gives you some peace of mind that if something happens and a spike occurs or something of that nature, that the superintendent can manage the situation per our board policies.
Thank you, Chief General Counsel. And my only question, I guess, would be a scenario where, let's say we had a mismatch in students compared to teachers or adults, or in a situation like that, would that have to come back to us?
I think she would be, by the board policy, allowed to use her discretion, but at some point it probably would need to come back to this board given the current circumstances.
Okay.
So I wish I could give you better advice than that, but until we actually see the fact pattern, it's a case-by-case basis in my mind.
Okay. Well, I think then we are good on this agenda item. I don't see that there was any other action items, but I do echo my fellow trustees' comments and points about the communication with our employees. And I just wanted to see, I know there was talk about a special employee forum. Are those on the calendar? And I apologize if you just
They are.
mentioned this.
Okay, so sorry, President Raymond. So yes, we have two forums. One will be for for principals on the 31st after the lead, teach, learn. And Deputy Superintendent Beiersdorf, if I'm saying anything, then shout out. And then there will be another one on August 7th. And then following one on August 10th for employees. And I believe those are from 3 to 4 p.m. Is that correct, Debbie?
Dr. McNeil, they're from 3 to 4:30.
Okay. And they're on August 7th and 10th.
Correct.
All right. Well, thank you all. I think everyone's gone off to bed, but for everyone who presented this evening, I appreciate all of the hard work and the effort and time. So we will move then on to 5.01, which is board reports. Any takers? I'm just going to very quickly say that it was a huge honor today to join Trustee Minetto and Superintendent McNeil for a tour of Bohotch Elementary School and to get to see the excitement in preparing for students at that school. Okay, Superintendent Report 5.02.
Well, thank you very much. And just looking forward to our new educator. Used to be a breakfast, but now it's going to be a virtual type of setting. But just want to, we're really proud of all of our new educators. And then obviously looking forward to our Lead, Teach, Learn kickoff on the 31st. We have Dr. Doug Reeves coming as our keynote speaker, talking about equity throughout our schools. So it's going to be a great presentation and looking forward to that. So thank you.
Thank you. 6.01 is future agenda item requests. Vice President Taylor, would you like to officially request anything?
If we're alluding to have some kind of range, as we spoke about before, I would request that staff comes back to us with some kind of recommendations around what some thresholds may look like. A range of thresholds or something, again, that isn't very limiting, but at the same time helps to trigger a deeper look or perhaps some action that may be required to make sure that we're keeping people safe.
Thank you for that. Anything else? Okay, 6.02 is public comment. I will ask our clerk, JJ Batchelder, to read the names of individuals that submitted public comment. This would be items that were not, again, related to a specific agenda item or came in after the names were read for the previous agenda item.
We received emails from Heather Bowman, Denise Paxton, Susan and Craig Lemons, Kelly Cruz, Annie Ricks, Christine Collier, Maureen Vergara, Isabella Vergara, Heather, I called Heather already, the Howell family, Lisa Jersey, Donna Snowski, Pat Arnett, Mark Horton, Michelle O'Connell, Sharon Kennedy, Jeannie Sartoni, Don Hepner, Ryan Falk, Kelly Roper, Kim Hedges, Lisa Baines, Sean McCaffrey, and Daniel Hedges. That's all I have.
All right, thank you very much, JJ. Okay, then before we officially adjourn, I will announce the next meeting, which is scheduled for Tuesday, August 11th. And as I mentioned at the top of the meeting, as our students will be back in buildings, it is our intent to be back in person for our meetings. I know that we've identified, I believe, a location for that meeting, but we will make it public when we officially announce that meeting. And unless I'm looking to just see if the superintendent knows if that's been confirmed.
We have Spanish Springs High School confirmed for the 11th, and then for the 25th, we're looking for another site. It may be Damani Ranch, but that's not for certain yet.
Okay. And those meetings, now that we're into August and back in session school, now are scheduled for 4 p.m. again. So if for some reason something were to change with the governor's directive, then we will get that information out there. All right, I will adjourn our meeting. Good night, everybody.